morning, everyone. Welcome to the session on strengthening climate change education for all health professionals. I'm Yin Zhang, the chair of the capacity building subcommittee of the WHO Civil Society Working Group on Health and Climate Change. I'm associate professor in the University of Sydney, Australia. I've been teaching climate change and global health for over a decade. And it's my great pleasure to co-chair the session with Dr. Cecilia Sorensen. She's the director of the Global Consortium of Climate and Health Education at Columbia University. And the session is also co-hosted with the WHO headquarters and regional offices. As we focus on achieving resilient and low-carbon health systems, one of the key strategies is to strengthen education and training programs for all health professionals, so we can have a highly proactive, skilled, and determined, committed health workforce. In June this year, we developed and launched an open letter to all universities and all educational stakeholders. We urge all deans, academics, training staff, as well as accreditation and examination bodies to ensure that graduating health professionals are prepared to identify, prevent, and respond to climate-related health disasters. So in the open letter, we present urgent calls with 4 very broad recommendations to incorporate climate and health competencies in all health curricula, accreditation, and continuing professional development. To provide a health lens to support the development of climate change education programs in other sectors to foster multi-sectoral collaborations. And to advocate for and provide additional funding and resource on climate and health education and research. And finally, to share resources and to expand the educational opportunities. So today's session is a continuing effort following up upon our initial call since the open letter. So today we hope to we will present successful initiatives and hopefully inspire more local actions for capacity building. So in the session we will hear 4 keynote speeches with Q&A and also additional panelists. They will share their different perspectives from different backgrounds. So now I'd like to invite Dr. Cecilia Sorensen to give us an overview of climate and health education at a global level. Over to you.
Thank you so much, Yang. It's really an honor and a pleasure to be here. Thank you all for coming. So my name is Cecilia Sorensen. I'm an emergency medicine doctor by training, and I direct the Global Consortium on Climate and Health Education, as Yang mentioned. So if we could bring the slides up, that would be fantastic. We might get slides here in a minute, but we'll continue anyway. So really, our goal here today is to share with you a perspective on why health professionals are so essential to, oh great, next slide please. So our goal today is to really share with you a perspective, actually many perspectives, on why engaging and training health professionals is so crucial to tackling the climate and health crisis. So we know from the IPCC report that climate change is a code red, and that language is so important. That is medical terminology. That means that the heart has stopped. That is not good, right? This is a code red, and we need to do some very quick resuscitation. We also know from the IPCC report that the severity of climate change risks to health is highly dependent on how well health sectors can protect people. So said another way, health systems are the barrier. We are the first line and we are the last line of defense in terms of protecting the health of humanity. Next slide, please. So I just like this slide. You know, we are in a crisis, and the two Chinese characters that make up the word crisis. The first one represents danger, and the second one represents opportunity. So although we are faced with a huge crisis, we are also gifted this incredible opportunity to come together like we never have before to change the future of what is going to be the health of humanity on this earth. Next slide, please. So when we look at what the health professional workforce is, this is data from the WHO. In total, if you combine all the known nurses, dentists, pharmacists, and doctors, there are nearly 50 million clinical health professionals. And those are just clinical that we know of. Beyond that, we have midwives, we have physical therapists, we have social workers, we have public health professionals, and I would guess there's somewhere around maybe 200 million plus health, or even more, people who focus their profession and focus their life work on health. So we are an incredible force, and we have the potential to make massive change. There was a recent study that looked at attitudes of health professionals as it relates to climate and health. This was a multinational survey, and what it was found was that, of course, many health professionals are recognizing the impacts of climate change in their communities. They are seeing impacts, they are highly concerned. The biggest barrier for health professionals getting involved in this is education. We do not, by and large, feel equipped with what we need to know and what we need to do to protect the health of our patients and communities. But we know that there are solutions. Next slide, please. So we formed the Global Consortium on Climate and Health Education in 2017, and our mission is to ensure that 100% of health professionals globally have the knowledge and skills to recognize, prevent, and respond to climate and health-related health impacts. So what we do is we organize, we mobilize, organize, empower, and amplify the voice of health professionals to really say how climate change is harming health and what solutions we can use to confront those crises. Next slide, please. So right now we are a consortium of nearly 300 health professional training institutions in over 50 countries. And these schools have pledged at the level of the dean or head of school to train their nurses, their doctors, their dentists, their pharmacists, their veterinarians, and their social workers in climate and health impacts as well as solutions. And we are reaching approximately 200,000 health workers every year in some way, shape, or form. So this has been an incredible effort, and there are many more here today that you will hear about. Next slide, please. We've also found that it is incredibly important that we come together with this as a community. So in addition to working with health institutions, we also work with an incredible array of governmental and non-governmental partners in order to bring health professional training not just into schools, but to practicing health professionals in many different contexts around the globe. Next slide, please. One of the things we really keep close to our heart and really at our core is that you see there is a huge range of health professionals that we need to mobilize in this effort. Each different specialty has the roles and responsibilities unique to their profession. However, we need to be working in interdisciplinary spaces. We need to be teaming up. We need to be bringing together public health with clinical knowledge to really have the most maximum impact. And so much of our work is focusing on this interdisciplinary space so that the most viable and the most effective and efficient solutions can emerge. Next slide, please. So as one of our core functions, we produce and iterate a list of climate and health competencies. We see these as our North Star. Of course, every different university, every different context needs different education that's locally adapted, locally tailored. What we try to provide is a little bit of a roadmap to help institutions, to help NGOs, and to help governments start to think about what are the competencies so that we can train health professionals to really embody the roles and responsibilities we need them to in order to respond to the climate crisis where they are. So I'm happy to share a link. It's on the screen, but find me afterwards and I will give you a card. Next slide, please. So another function that we have at the consortium is that we have been working with many governmental and non-governmental partners to develop climate and health courses. So far we've done courses in North America, in the Caribbean, and in Latin America. We're providing certificates and we're providing continuing medical and professional education credit in order to make sure that professionals everywhere are equipped and have access to free, evidence-based, and expert reviewed information. Next slide, please. We also have a very lively learning collaborative. As you know, there are so many ideas forming around how we can best train health professionals to tackle the climate crisis. And so we welcome you to join us for this learning collaborative where we share ideas, we share challenges, we share opportunities, and we share opportunities for collaboration because we need to do this together. Next slide, please. So if I could write one magic prescription on my prescription pad, it would be that we educate ourselves, our students, our communities, and our patients about how climate change is harming their health and how climate solutions can protect their health. So thank you all so much.
Thank you, Cecilia. I know that you might have some questions, but please save that for a little while, so we will have some Q&A later on. So now I'm pleased to introduce Dr. Manzi Markawi, Regional Advisor on Climate, Air Pollution, and Chemical Safety at the WHO Office for the Eastern Mediterranean region in Jordan. And Dr. Markawi will talk about the newly launched 5-year project to promote climate change and health education in the region. Over to you.
Thanks a lot. Thanks a lot. Appreciate the presentation on the board. Thank you. I'll be speaking on an initiative that we've just launched a couple of months ago called the GeoHub for Climate Change and Health in the Eastern Mediterranean region, which is a consortium of universities from the region as well as from the United States of America with one main object, two objectives actually, to strengthen the health the climate change and health education as part of the formal education at the university level and the postgraduate level, and to strengthen the research component, which is by all means is lacking in the region. Next, please. This is our region. About 650 million people live in the 22 countries of the Eastern Mediterranean region. It's a quite diverse region from the social and economical terms. I usually say that we have the richest countries of the world, one of the richest countries of the world, and one of the poorest countries of the world belong to our region. It's quite diverse, though we have a lot of commonalities between the countries of the region. One of them is the high burden of environmental risks, including climate change. The other thing, the harsh environment that we are living, which is severely affected by the climate change, namely the water scarcity, the high levels of air pollution because of natural sources like dust and sea salt. Next, please. This is a list of the universities that are involved in the project, and the door is still open. We can add other universities, and in this project we have a regional component. We would like to share the outputs of the project with the other 19 countries of the region. Just to name them: the Jordan University of Science and Technology, the Balamand University of Lebanon, the Mohammed VI University of Health Sciences in Morocco, University of California, San Diego, University of California, Berkeley, Harvard University, and us, the WHO Center for Environmental Health Activities, representing WHO. Next, please. This is the algorithm, the flow of the work of the thing. There are two projects with a certain interface. We have a project between the three American universities headed by San Diego University, and we have the three universities at our regional level. What we are doing, we are implementing a lot of research activities to handle different health outcomes that are affected by climate change. But meanwhile, we educate the students on how to do it and trying to give them the basic capacities to do, because we've discovered that some of the basic competencies are not being educated in the different universities of the region. Take, for example, the health risk assessment, for instance. The concept is totally new that we started offering training, valuing the impacts, valuing the health impacts, how you can translate the health impacts into money terms, because when you talk to policymakers, sometimes they don't care much about the burden. If you say 1,000 people will die. But if you say we are losing this amount of money because of the health outcomes, it would be a different way of convincing them. The project over the 5 years will implement several ideas. I will go to them in details. We will involve 100 students at the MSc level and 5 to 10 students at the PhD level. Hopefully, by the end of the workshop, at least we have a representative workforce that can help us, in delivering the message of climate change and health. Next, please. Yeah, the aims, as I started, we have two main objectives. First is, we knew it, and I think Maria is with me. Part of the resistance within the health system was because simply the health workforce were not aware what is climate change first and how it is affecting the health. And if you don't know, definitely you will resist. So we are planting seeds now within the health systems that at least people to start knowing what we are talking about. What do we mean by the health outcomes that are affected by the climate change? What are the different scenarios that are going to affect the health system? Why the health system should be concerned, with climate change? The other part of the problem that we are having, WHO is a normative organization. We base our guidance on research and outcome of research. And by nature, research is lacking in most of the developing countries, including the regions, including the 22 countries of the region. Whatever guidance we are saying, unfortunately, it is biased towards the United States of America, Canada, and the countries of Europe because of research. We did a systematic review on climate change and health in different parts of the world, and very few articles were coming from the region, and we were looking why? Because the research protocol was very weak. There are problems with the data. Well, we thought that let us twin some of the best universities of the world along with our universities, at least to mentor the researchers and take their hand. Next, please. Yeah, I'll just possibly. The research projects that will be done during the 5 years will focus on four main issues. One is the health impact of climate change. Go down. Water scarcity. We are possibly the driest region of the world, and climate change is the victim. We see difficulties in Iraq, in Syria, in different countries. Even in a country like Egypt, for instance, where water is flowing from outside the region, we started feeling the impact of climate change. And definitely it has health outcomes. There will be several projects trying to understand how the water scarcity will be affecting, including the impact of nitrate on villages and families in Jordan. As I said, air pollution is affecting us in the region. Possibly the highest levels of air pollution can be seen in the region, not simply because we have a lot of sources, but we have natural sources of air pollution. We have dust that is contributing 30 to 50% of the levels of air pollution. And honestly speaking, the level of science at the world is not adequate to say, is it really harmful as black carbon, for instance? But we are launching a project in Lebanon just to improve the understanding of the impact of dust and its relation with climate change in Morocco and Lebanon. And one lacking capacity is actually what we are going to do as WHO. There are several tools to try to understand the impact of climate change on different aspects of health, including putting values and money, how to translate the health impact into money values. We implemented the project in Pakistan, trying to understand the co-benefits of climate change interventions. What does it mean if you change the fossil fuel into another source of energy? Of course, in terms of carbon emissions, but most important to us in the health sector, in terms of how much would be the health impact. Next, please. Yeah, I'm not going to go into the details of the four components, but we already started by a very interesting training workshop. As I said, in late September, early October, we had a training workshop, a regional workshop for 100 students from different parts of the region. And we started a face-to-face basic training on health risk assessment of climate change and air pollution. And I'm glad to say to you that we continued the workshop online. It was just completed. The exam was yesterday, and I'm not sure how many of the 100 students who attended already passed. Just for the sake of time, I'll stop here. I'm not going to go into the details of the project. Thank you.
Thank you very much, Dr. Mahavi. Our next speaker is joining us online from the UK. Do we have her for the next speech? Here you are. Now I'm pleased to introduce Dr. Sang Mei Tan. She's the lead for education for sustainable healthcare in the medical science division at the University of Oxford. Her efforts have led to curriculum change at a national level. So over to you, Dr. Sang Mei. Sorry, we can't really hear you.
Can you hear me?
Oh, now it's all good.
Okay, can you hear me now?
Yes.
Great. Thank you. Thank you so much for inviting me to speak at this wonderful WHO Pavilion event. We've seen that there's a massive demand for urgent action to strengthen climate change education for all health professionals. I'd like to tell you about a recently published document that is a tool or resource for educating health professionals on planetary health and sustainable healthcare. I was the lead author with a working group of medical educators from several medical schools, a number of whom I know have tuned in to this event. So thank you to my colleagues for all you do, for your expertise and commitment. The document is called Education for Sustainable Healthcare, a Curriculum for the UK. However, it was written with an eye on how it might be useful for other health professions so that it can be used in other cultures and countries and at other levels of training beyond undergraduate medical education. I think everyone here would like to see our health professionals be knowledgeable about, prepared to deal with the devastating health impacts of climate change, which are unequally distributed in time and place. But they are beginning to affect all of us and at an accelerating rate. In developing this curriculum, we haven't stopped at just the health impacts. Our curriculum deals with the difficult issues of how we train health professionals to act to limit the crisis. Some would say this is straying into policy, and I would say yes, as medical professionals, we have to influence policy, push structures and systems to change in order to protect our patients from preventable harm. There is strong evidence that most diseases are made worse by climate change. Paradoxically, what we do in our daily work of providing healthcare is a major contributor to the climate and ecosystem crisis. So the education is not just about planetary health, how human health is inseparable from the Earth's natural systems, but also includes sustainable healthcare and its relevance across professional life and clinical practice. There's communication skills needed too, how to speak to colleagues and patients about these issues. Sustainable healthcare is good for the patient, good for the planet, and good for the healthcare practitioner, because it's about improving health and delivering better healthcare, and doing this by listening to what matters to the patient. This is not generally understood and must be made clear. Because in some health systems, the patient's voice isn't heard, and things are done unnecessarily or without proper explanation, where the patient might have wished differently. Defensive medicine, for instance, or medicine for profit above all else. These have to be challenged, as too much medicine is not only wasteful, it harms the patient. At the other extreme, lack of access to healthcare and other forms of structural injustice also have to be addressed. To get the curriculum endorsed, we had to navigate the national medical education channels to get it approved by the MSc and the GMC. The Medical Schools Council is the representative body of all the UK's 40+ medical schools. Although the content, pushes the boundaries of traditional medical education. For instance, there is a sentence in there about the reality, scale, and urgency of the existential crisis. The Medical Schools Council fully endorsed the curriculum and published it on their website. In the UK, the medical regulator is the General Medical Council. The GMC doesn't set a curriculum, but each medical school has to implement the requirements of its Outcomes for Graduates document, which outlines what students must know and be able to do in order to qualify as a doctor. The GMC has added this ESH curriculum to their list of resources for medical schools to use to inform their curricula. In fact, it will be a point of reference to inform the next iteration of the GMC's Outcomes for Graduates. The education of other health professions in the UK is overseen by the Nursing and Midwifery Council and the Council of Deans of Health, who also see this as a useful and helpful reference going forward. We're pleased that the curriculum has also proved helpful in contexts outside of the UK. The Southern African Association of Health Educationalists, SIG, with Ghent University in Belgium, have launched a position statement on integrating planetary health and environmental sustainability into African health professions education curricula, referencing this curriculum. At the National University of Singapore, it's informing the plans to develop the nursing program. The University of Lausanne in Switzerland has launched a sustainability and health platform and is finding the document helpful in developing a curriculum for its Faculty of Biology and Medicine. These are examples of how the ESH curriculum is adaptable to the educational requirements of other countries around the world and other healthcare professions. The content is presented in an accessible way so that institutions can easily set relevant learning outcomes according to the competencies and level required within the local context. Sustainable healthcare is not a standalone topic, but a mindset, a perspective of the bigger picture. It's something that becomes part of how you behave, like patient safety or professionalism. It should be an integral part of all teaching in whatever specialty you're involved. The documents has hyperlinks throughout so that if you're teaching pediatrics or psychiatry, for example, there are links to these quality assured sites for learning resources. And I've made this QR code. It's going to be displayed on the screen so you can go straight to the ESH curriculum document. Do please read it, share it, attribute it and adapt it as you wish to your own context if it's helpful, and adopt it in your own educational institutions.
Thank you, Dr. Sun Yimei. Now we are showing your QR code in the room. Now please welcome our next speaker, Dr. Hossein Rashid, the Regional Advisor on WASH and Climate Change at the WHO Regional Office for Southeast Asia. He has led the development of many technical tools and guidelines related to climate change and health. Over to you, Dr. Rashid. Can we have the slides on, please?
Thank you very much. So I'm representing like over a quarter of the world's population, the region, Southeast Asia region, and the fact that the Southeast Asia region is the most vulnerable regions to the impacts of climate change and health. We have been doing a lot at the Southeast Asia Regional Office in collaboration with member states to ensure the health sector is fully equipped with the knowledge and information that is required on climate and health. So on this regard, we have developed a lot of courses, training modules and materials which are particularly aimed at health workers. Next slide, please. So as I mentioned, Southeast Asia region is the most affected with 3.8 million deaths due to climate change and health in our region. Next slide, please. So this is what we launched last year during the COP26 at the Glasgow, the advocacy toolkit, which is an online advocacy toolkit which provides different infographics, how to conduct an advocacy toolkit at community level. This can be not only for the health workers, but also for general, everyone, medical students, and everyone can use this, how to, all the key messages and everything that can be used. It's online. Next slide. And this is how it looks like, and the link to the website. Next slide. Now, as I mentioned, we are developing a lot of training materials and tools, different educational modules targeting health professionals. And this particular modules focuses on health national adaptation planning, climate resilient and environmentally sustainable health facilities, integrated climate sensitive disease surveillance. All these are part of different modules that we are developing, and these are self-paced learning modules that can be available, and we will be uploading all these modules at Open WHO platform for easy access and for the whole community to use it. Next slide. These are, I think when we talk about climate change and health, you just can't ignore mental health, and mental health is very crucial, and with the COVID and all that is going on, we have recently initiated a project to develop a toolkit to address mental health, climate change and pandemic situations, how to address, coping strategies and all this.
Dear
because
family doctor,
the
nurse,
health workers are at the forefront, and we need them to understand how to cope and also to deal with patients, and that's why we are developing a specific module targeting on health workers on how to deal with disasters, climate situations, and even pandemics in the future. Next slide. So this is a part of the climate resilient and environmentally sustainable health facilities modules that we have developed, and the Public Health Foundation of India was instrumental in supporting us in developing this. Next slide, please. So I will not go into details. These are the early warning systems and climate sensitive disease surveillance modules. So as I mentioned, all these modules will be available for public and to medical students online at WHO Open Platform. Next slide. So that's it. I'm keeping mind of time. I just wanted to run through all these different modules and training packages that we have developed, and certainly this will help us to build our communities more resilient and health workers more ready for future pandemics and climate epidemic changes. Thank you.
Thank you. Please join me to thank all the speakers so far. Now, because we are a little bit behind the schedule, so could you please hold your questions a bit longer? So now we just invite all the additional panelists on the stage to have a panel discussion. Thank you.
Can you give me a 5-minute warning, because I don't have a watch? Thank you. Thank you all for joining us. Welcome. So we are now joined by Azina Rangunwala, who is a medical scientist at the Public Health Association of South Africa, Purnima Prabhakaran, who is the head of environmental health and the director of the Center for Environmental Health at the Public Health Foundation of India, Amber Rose Atkinson, who is a PhD student from Australia, who's here representing First Nation communities, and Mohammed Isa, who is the liaison officer for public health issues at the International Federation of Medical Student Associations. So thank you all so much for being here today. Sorry. So just to get things started, I'd like to hear from each of you. You're all doing so much incredible work in this space. I'd love to hear from each of you what your perspective is on why it is so important to train health professionals in this space. And we'll start here.
Thank you, Cecilia, and morning, everyone. Thanks for being here in this important conversation today. So, health workers are the first responders, and we didn't just see that during the pandemic. Health workers have always been the first responders, and it's important that as first responders, the health workers are equipped with the latest information, and the education system is quite rigid at the moment. And new information, it takes a while for new information to get onto the system. And the climate crisis is here. Like you said, it's code red. And we need all hands on deck, and that means all first responders need to be sure that they have all the latest information on climate and health issues.
Thank you so much. Over to you, Mohammed.
Okay, so basically my answer would be that the importance of being evidence-based. If we're, as healthcare professionals, if we're like working on the interlinkage between climate change and health, we need to make informed decisions, we need to be evidence-based, and that only happens through formal and informal education, and that's why we need to include this in the healthcare professionals. Further, I would say preparedness for dealing with the climate crisis. So, yeah.
Thank you so much. And over to you, Pormina.
Thank you, Cecilia. Good morning, everyone. Thanks for being here. Just to reiterate what my previous panelists have already said, we know that the climate crisis is a health crisis, and really the health professionals need to be equipped to be at the first line of defense. If they are not in the know about what the health crisis is really about, then they're not going to be able to act. So I think as first responders, as the first line of defense, these are the people who need to be empowered and equipped to become the first community anchors in a way, because health facilities are the first port of call when there is a surge in climate sensitive illnesses.
Absolutely. Thank you. And over to Amber Rose.
For me and my peoples in Australia, I see it as being like three sort of factors as to why it's important. Well, there's many, but I'll go three. Ensuring that there's ethical and quality care provided to Aboriginal and Torres Strait Islander people in Australia that is contextually informed and culturally informed. Too, as my panelists have said, health professionals are on the front line, and so being able to provide that culturally responsive care is really critical to meet the holistic health needs of Aboriginal and Torres Strait Islander beyond just, your physical, mental, emotional. It also includes like our cultural health and well-being, which is really impacted by the climate health crisis, because for us in Australia, it is a colonially induced climate health crisis. And so prior to climate change, we already experienced disproportionate health outcomes in comparison to the non-Indigenous population, lifespan, chronic disease, access to culturally responsive healthcare, deaths in custody, not being able to access healthcare, list goes on, and this is further compounded by the climate health crisis.
Thank you so much. So each of you is working in your region on incredible initiatives to build capacity and to train health professionals. So I'd love to hear a little bit from each of you on some of the work you're doing, just so we can see the diversity of what is happening in the climate and health capacity building space.
So we work through various mechanisms in South Africa. I'm part of the Public Health Association of South Africa. There's a special interest group on climate, energy and health. And we work with several actors, we have with work health professionals across the board, mostly through academia as well, from the special interest group. But I'm also a coordinator for Global Green Healthy Hospitals. So I work directly with health organizations, health systems, and health facilities, and also these environmental health practitioners at these facilities specifically. And we also rope in nurses, and we do various capacity building mechanisms, because there's different ways to learn. And in addition, Groundwork is an environmental justice organization. Those are the people that actually pay my salary. And they have what we call an environmental justice school. And in addition to that, we realize that there's this big health gap when we talk about climate change. So they've developed like health literacy modules that can be used in workshops for people who have not finished school, because not a lot of people make it through to university, and some health workers, such as community health workers, are not put through the formal system. So these health modules, helps with health literacy, but it also helps with looking at the intersections of climate and health, and how we can equip people to be these first responders throughout. So that's just a quick recap of the type of work we do. Thanks.
Thank you. Incredible. Over to you, Mohammed.
So yeah, from my side, I'm not working on a regional level, I'm working more globally. However, what we have been doing, first of all, one of the things we have been doing since 2019, we analyzed what's happening regarding climate change in our medical curriculum in the different universities that are presented in our, in different countries that are presented in our organization. Just to know more about the gap and what's the existing situation. And unfortunately, it was disastrous when it comes to climate change and medical curriculum. So consequently, what we have been doing as well, since IFMSA mainly focuses on also informal education and peer-to-peer education, we have been working on capacity development mainly for the members in terms of knowledge, skills, and competencies. So whenever there is an opportunity for having a workshop that can be under the theme of climate change and health, and where people can learn more about public health through the climate change and health, about, for example, advocacy and policy making through climate change and health, about, for example, mental health and its relation to climate change and health. All of these present opportunities for students to learn, in addition to the fact that we have a specific program in the IFMSA on environment, climate change and health, in which we encourage our national member organizations to enroll their activities. And luckily, one of the highest levels, I would say, or the priority area that many of our NMOs work on is the capacity building in terms of equipping the medical students with the required knowledge, skills and competencies in order to be able to deal with the climate crisis. And I would say finally, from our side, what we also do and very much believe in, the importance of hands-on experience. So I would just reflect very quickly. Yesterday we were having our reflection meeting as IFMSA delegation, and it took us 2 hours. Why? Because we were reflecting on our advocacy plan regarding what we came here to COP, and we thought we knew, and what we learned here in just 3 to 4 days, and how we can change our advocacy accordingly in order to make further impact. So we believe very much in the hands-on experience and in the importance of knowledge and experience sharing between the different people, especially that many of our countries and many of our regions are actually more vulnerable to the climate hazards and the climate-related health impacts. So that's what we basically do with IFMSA. Thank you.
Thank you so much. Purnima.
So I'm just going to give a quick bird's eye overview of what we do at different levels, because it's one thing that we have to equip health professionals, as in the clinicians, to respond to the climate crisis. But there's also very many different actors that have to work with the health sector. So I think my effort started at home. So with the Public Health Foundation of India, I introduced the climate change and health curriculum for my public health students. With the medical students, the Medical Students Association of India is a good target for me, because it's still not a part of mainstream medical curriculum like in many other parts of the world. So at every opportunity that we get, we talk to the medical students about climate change and all the related health impacts. At a regional and a national level, I work very closely with the Ministry of Health, which has a national program for climate change and health. And there it means killing two birds with one stone. The policymakers themselves, are they making the right programs and policies for climate change and a health agenda? And the implementers on the ground at state level. So that requires both a top-down and a bottom-up approach to educate everybody about the climate change and health impacts. So we have developed a lot of training modules that we deliver through trainer of trainers programs. So we do the master trainers training, and then they take it down to the very decentralized levels of healthcare in India. So that's an effort that I think should have a ripple effect across the country. At the regional level, I very recently put together a consortium for climate change and health in South Asia, which covers 11 neighboring countries, including my own India, and we are coming together to use that platform to expand climate change and health education for very many different players, not just the health professionals, but all the different allied actors who need to come together. And I think at the global level, we have two little efforts. One is an international effort to bring together graduate students from 4 different geographies, from India, from the United States. The University of Villanova leads this effort, from Finland and Nigeria, 4 very different geographies, where we bring together the graduate students over a 11-week e-course, where they share experiences, their programs and policies, and how they are approaching the climate and health agenda in their region. And at a very global level, we've worked with the WHO to develop an e-course with 5 different modules. Dr. Rashid mentioned it, and we hope that's going to be available on the OpenAQ platform at a very global access level for people who even have a mobile phone. They should be able to access it. So that's a quick, I hope I haven't gone.
You're doing so much. I know that was hard to pack in, but thank you.
Thank you. Sorry, I forgot to add before, the health sector are really well positioned to act as advocates for First Nations peoples because they directly see the impacts of the climate health crisis on our health and well-being. So I just wanted to add that in as well. A little bit about the work that I do. I'm a PhD candidate at the University of Queensland. I'm in my second year. I'm really looking at repositioning the way that we think about the environment for us as, or for me as a First Nations Gumbaynggirr Nyami. It's so much more than just a landscape. It's like it's kin, it's country, it's culture. There's so much more that is represented and encompassed within country. And so my PhD is really looking at the relationship between climate, country, and the health of my peoples. I'm aiming to reposition the way that we view and respond to health crises. What else does my study do? It's really looking at how health of country is measured. In Australia, we have a lot of, and sort of across the board, there's a lot of really Western scientific frameworks from which this evidence base extends from. That often doesn't include the more holistic way that First Nations peoples view the health of country. So yeah, that's what I'm looking at doing, and looking at how my study can help my community and respond to the health needs of my community, because for us, country and health are inextricably linked. And so the impacts of colonization and the climate health crisis are also inextricably linked. For us, systems are interconnected, they're not siloed, which often when dealing with, I'm sort of in academia, I guess, knowledge bodies are siloed, they're segregated, and they don't allow for that. For First Nations peoples, we're inherently interdisciplinary, nothing is interconnected. So it's really about changing the way that we view climate health, pedagogies, and decolonizing the way that we view this. Because if we don't do this, we cannot solve this crisis, which was created by this by a dominant discourse and a dominant worldview. We need, different perspectives and our solutions to be able to appropriately and adequately respond to this in a way that is actually going to help us in terms of the threats that we as a humanity is facing, but First Nations peoples are disproportionately facing. We're the first to be impacted, yet the last to be heard.
Thank you so much for sharing that. So Purnima, you are working on local levels, regional levels, and global levels. And I imagine you're working with many different types of professionals, nurses, doctors, as well as thinking about how we educate journalists and policymakers. So tell us a little bit about what you've learned in terms of how we can reach this many different types of audiences with climate and health education.
So the journey has not been easy because, the willpower is there, that we recognize that we need to educate very many different audiences. It's not just our health professionals, it's not just doctors, it's nurses, it's public health students, it's public health actors on the ground, as well as urban planners and disaster response teams. But when I think of a climate crisis, I think it's code red for sure for the health system, but it's also very many actors that kick into, for example, in a flood situation, you have disaster response teams there, and they should be working very closely with health systems. So integrating all of that has been a little challenge, but what we've done is approach each one disciplinary wise, and then we are hoping to integrate and bring it all together in a kind of an integrated climate and health education course. But while on that journey, I think we've had some really good lessons to be learned. I think one is that we need to talk with the people who hold the key to these. For example, if you want to change the medical curriculum, in India it's still not part of the medical curriculum, and I think the case is the same in other parts of the world. You need to work with the people who are changing the curriculum, which means for me the National Medical Commission, and knocking on their doors and making them understand that this is code red has been a challenge itself, because they have not learned it when they were in medical school. So it means maybe thinking of continuing medical education for doctors who are already there on the ground, and then talking across these interdisciplinary departments in the health workforce and making them come together and align themselves in their training programs. So I think capacity building, there's a lot to be done for climate change and health education, and I personally am looking to bridge those gaps in India by talking to the different ministries that are responsible. So they think they are doing, so there's the Ministry of Health, there's a Ministry of Environment, and then there's different ministries doing different things. The Ministry of Women and Child Development, they need to understand that theirs is one of the most vulnerable populations. So maybe an interministerial task force needs to be created, and we need to bring this conversation to that table and have the right people bringing this, these insights to them. So lots to be done, but I hope we will get there.
Thank you so much for sharing your experience. Hamid, you've been working on developing a medical curriculum that could be applied to settings everywhere. Tell us a little bit about the curriculum and how you've been able to work this with so many interests being represented, because medical schools are already so packed. There's so many challenges that are faced. So tell us about your approach.
So yeah, according to the approach that we have been following is creating a framework that focuses mainly on competencies. It's not just about giving knowledge or just giving like a set of statistics that can be present somewhere else and where people can actually access it in a very easy way. However, it's about giving them the skills and the main concepts that they need to understand in order to be able to tackle the climate change. So if, for example, I understand what planetary health is and why climate change is happening, I can understand consequently how climate change will be affecting everyone and how it can be affecting different determinants of health. If I understand its impact on different determinants of health, I will be consequently able to come up with the different diseases that can be caused by the climate crisis. So all these are examples of how we're including it in a framework that focuses mainly on skills, on competencies, on concepts, rather than just putting a list of data, list of statistics that people can find easily somewhere else. So yeah.
Thank you so much for all the work you're doing. Over to you, Amba. Tell us about how First Nations knowledges can be brought to bear on decolonizing climate and health education.
Good question. So for me, it's really about ensuring that health professionals are providing culturally informed and culturally responsive healthcare. And to do that, we need to ensure that the institutions that are responsible for their training, for their education, are embedding that genuinely in the curriculum. And how I believe we do that is by acknowledging the socio-political, historical context of that place. In Australia broadly, yes, but also making sure that it's localized and context specific. The history of colonization is different in every different region of Australia, and so it really needs to reflect the different ways in which it functions currently. We have different sort of states. These are not traditional states. They're not reflective of our sovereign, Aboriginal nations. But within these different areas, we have vastly different health experiences. And so first and foremost, to be able to provide culturally safe, responsive healthcare, health professionals need that education, and we need to embed that through representation, through voice. And it cannot be done without First Nations perspectives guiding and leading that curriculum development.
Thank you so much. And over to you, Aziza. Tell us what type of approaches that you are working on might ensure efficiency and create an effective training for health workers.
So currently, I think our approach with our education system is quite, it's homogeneous. We work very much with a very old curriculum. I mean, South Africa, we are years post-apartheid, but apartheid is still very much built into the curriculum. And we have not integrated Indigenous knowledge systems. Like you spoke about cultural sensitivity, there's also a lot of medical racism that is an issue in general. And I think when we speak of climate change education for health professionals, it needs to have a health equity angle. And when we speak of health equity, that's when we have to unpack those social determinants of health that you have spoken about. We have to unpack the social determinants of health in the curricula, detailed into it, because something is just like we people have, the current education system is you study to get a certificate. What you remember from what you studied is not really as important. And I think we need to start building in different ways of how we integrate these Indigenous knowledge systems with science, with evidence, because Indigenous knowledge is also science. And we fail to understand that. And we always say that people work in silos. I think in our professional capacity, we talk about how people work in silos. But then people are studying in silos. So how do you expect them to not work in silos if they are studying in silos? So if we can kind of decentralize that and integrate social science with your hard sciences, your soft science, your clinical science, and not have that elitist mentality when it comes to university education, then perhaps then we can embed climate change education for all health professionals at all levels. And at some point we need to understand that public health is not just a health professional's issue. It's every single human being's issue. And I think everyone needs a basic understanding of how, applying critical thinking skills, a basic understanding of infection control, like how we were during the pandemic, and also that basic understanding of what climate change effects are and how it presents to you. How does your patient present? Because not often healthcare professionals don't always ask where someone is from, where they live, in what structure do they live. I did a guest lecture like just a month ago, and the medical students are willing to learn, and they're willing to learn about all these new concepts. And the problem is they say they're just tired of hearing about diabetes all day. They do not learn anything about climate change. They learn about climate change through guest lectures, and that is a problem. We're sitting here with this big crisis, and we are not speeding up that change in the curriculum, and that's because of red tape and these hierarchical academic institutions and organizations. And I think we need to go from the top as well, not just from the bottom. And we need to use both approaches so that we can somehow meet in the middle for that effective approach for climate and health education.
Fantastic, so much wisdom there. And I can't say how many times I've heard different rooms here say we need to break down silos, so it's a common theme. But I would add that, as health professionals, as nurses, doctors, community health workers, public health professionals, we are society's confidants, right? We have the trust of society, and so we are just perfectly positioned to be these messengers to break down silos. So keeping that in mind. So you mentioned several challenges, red tape, et cetera, that prevents climate and health education in South Africa. So I'd love to hear maybe a little bit about some of the barriers that you face so we can acknowledge the barriers and think about solutions. So how about starting with you, Mohammed?
So yeah, in terms of the barriers when it comes to climate change in education in general, I guess the preparedness of other sectors, or I would say first the health sector and the education sector, to learn that we need to put climate change in the center of these policies and these health issues. Still at the moment when we speak about the risk factor of a disease or something, it's never mentioned that anything related to the environment or climate change is there. So I guess also it's about the structural norm that is just very much deeply rooted in our systems at the moment, that people, yes, some people or many people I would say understand the health impacts of climate change, but still it's no, not in the education, not in the curriculum. The curriculum is already big. Yes, the curriculum is already big, but there are so many issues with the curriculum that it needs a structural reform in order to make sure that these new or these upcoming healthcare professionals, they can actually meet or tackle all the health challenges in general. So that's the first thing, and the second thing specifically about the link with the other policies as well. Because when we speak about determinants of health, unfortunately, many people and many healthcare professionals, many medical students do not yet know about the determinants of health, about social, economic, environmental, commercial determinants of health and how they are all interlinked. So I am unable to put climate change in the medical curriculum. I am unable even to link it to the other policies as well, which is more even barriers, as I say. And unfortunately, I would say the priorities. Because many of the decision makers, many of the policy makers, their priorities are not putting health on the agenda. And I guess we can see this in COP, health is still not on the agenda. It's 2 hours on the Science Day, I guess. That's it. So still there's so much to do in order to change the behavior and the knowledge and the attitude of people in terms of the climate change and health. So yeah.
Thank you for all the work you're doing. And, I think the voices of students in this are some of the most effective in terms of changing institutions, cutting through red tape. The voices of students have been so important in this. So thank you for all the work you're doing. Over to you, Purmina.
So in terms of bringing interdisciplinarity, I think the medical students in India, where I come from, have recognized that this is an important issue. So I think we have a good start over there as well, because even though it's not part of their mainstream curriculum, they're willing to come to courses that we do to learn what they want to learn. So I think that's a good start. And similar requests coming to us from the nursing groups. So they come to us saying, we have to start from scratch. Can you do a separate course for the nursing community? So I think that's a good start. There is the willpower in different audiences, and I think that's a great lever for us to kind of make the opportunity happen through that channel. So additionally, I think policymakers are also waking up to this crisis. The climate crisis and the agenda is there at the top of their minds. They just don't know how to approach it. So I think using our agencies to kind of sensitize these people, build awareness, help them to build those training modules that they're asking for, and customize it to the different audiences. I think whether it's policymakers, the planners, the facilitators, the implementers, as well as students and youth, of course, like you mentioned, I think they are the big power that we need to work with. And I remember when pre-COP last year, we mobilized a youth charter, for the voice of the youth to reach the COP. And I think one of the first things they wanted was to be educated on climate change and health. And I think that's a big force that we need to reckon with, and make it happen for them. Yeah.
Yeah, thank you so much. And I've seen that approach be very successful. We partner with groups, right? We can serve as technical advisors. We can provide experts. We can work together to help build training and programs in other sectors and other places where there currently isn't education. So much of this requires unprecedented amounts of cooperation. So I'd love to hear from you, Amba, what your thoughts are on, what are the current challenges that you see happening in your region and how we can potentially overcome them.
I think in my experience, it's really about challenging dominant discourse and the impact that this discourse has on not only our climate change education, but also our education system in general. To this day, the dominant curriculum in Australia does not actively address the colonization and how colonization has impacted the socio-political landscape that we are currently in Australia. There's still, I did my Master of Public Health at the University of Melbourne, and there were still elements of it that were completely deficit discourse. There's still students, there's people that I know who are working actively in the health sector that don't know anything about the true history of their own country, and that is problematic, especially when they're going to go and treat or work with Aboriginal or Torres Strait Islander patients. And it really goes back to the the ethics of their care, and is their care truly ethical or informed? So for me, it's not just necessarily climate change education, but the education system as a whole. We need to subvert the system because discourse is consequential, and the consequence of that is silencing of the true history of our country, and that's not going to move us forward. That is only going to keep moving us backwards in terms of equity for First Nations peoples in my country.
Thank you so much. Well, I've been sort of hogging the mic here because I'm just so delighted to hear how you all are approaching this very complex challenge, but I'd like to invite our audience to ask any questions. I can bring you the mic. Questions for these panelists or any questions for our prior set of speakers?
Hi, thank you so much for all of your insights. My name is Beth Gillespie. I'm the Director of Undergraduate Medical Education at the Climate and Health Program in Colorado, US. And like a lot of themes that you've brought out, the youth are powering our integration of climate and health into the curriculum. And one of the major barriers that we've encountered, even though the administration is supportive, is just the fear that the educators have about this new topic, this seemingly new topic. And so what approaches have you seen that have been successful in kind of training the trainers, like you've mentioned, and just making one person, one guest lecturer can't be responsible for educating. And so how do we empower the educators, like the professors who didn't have this training, to teach the students this important topic?
Great question.
So that's the problem that all of us have recognized. That the current practitioners or the professors haven't had this training when they were in college or in the universities. So it's a challenge, but I think a couple of ways that we've thought it might work is these professors have annual conferences that they go to. So one of the strategies that we have thought about is when their conferences are happening, go to them and say, can we introduce a session where your audience is there and we'd like to talk to them about climate change and health. It has worked sometimes it hasn't, but that's one strategy that we've been using. And many of the universities have continuing medical education credits, So working to the people who are deciding on those different courses or credits that will become a part of those CME programs, we've tried to introduce climate change and health over there as well. It's still an abstract topic for a lot of people. Air pollution, yes, still, okay, they can relate to it, but climate change is still an abstract topic. So I think these innovative kind of ways to kind of get to them, I think, and maybe find some champions. So there are a few people who are willing to learn and want to take it to their own communities. I think if we look for those champions and use those people as our levers, I think we can get there. Couple of strategies for you.
We'll just add something very quick. I would also make use of the accreditation systems in the medical schools. Because this is something, for example, in the IFMSA, we have a standing committee on public health and a standing committee on medical education, and we very much work in collaboration together for this, because every single medical school, according whether like national accreditation or international, they very much work towards it. They very much focus on accreditation, and even like for us, for example, why like since Egyptian medical students, they usually have 3 destinations that they want to go to, either US, UK, or Germany. That's mainly the destinations there. So what our medical schools are doing, they are just trying to get the international accreditation systems to acknowledge our current education or current curricula. And that's why what I would say is that it's very important whenever we get even into the workplaces must put in the competencies, how we're dealing with the climate change, our knowledge on climate change, and how to deal with the patients who are suffering from the health impacts of climate change. So if these competencies are there, and they are enforcing medical schools and enforcing any, I would say, educational institute that is focusing on healthcare professionals to teach their students about climate change, then this would be a good step forward for them to actually work on it. So yeah.
So just a quick response on the guest lectures. We do have professors that are willing to take leadership roles and be champions for climate, and obviously, but they are mostly bound to their curriculum. And I think once we need, that's another gap we need to address, where we instill leadership skills and ethical leadership skills, and try to support them to try and get all these things beyond the guest lecture and get these modules actually as part of the entire curriculum. Because you can't just do that in one slot. You need different modules on air pollution, on water, on vector-borne diseases. You can't just do a quick climate change crash course.
Thank you so much. Do we have any other questions from the audience? We have time for one more.
Thank you. One comment, one question. First, don't give up. Be tenacious, because if you think about the different types of curricula changes that have occurred with COVID, with HIV, with drug addiction, they all started to become part of our curriculum. So I think this is definitely something that will become universally part of it. The second question is, a lot of our education, allied health professionals, medical schools, we learn by doing. There's didactics, but there's also pursuing the action. And so I'm wondering, because we live in a system that also contributes to greenhouse gases, to what extent do you think in each of your systems, in each region that you represent, can we create a conduit by which in the medical system itself and the allied health profession system itself, that we learn through decarbonization of healthcare to get effective action and learn by doing?
So yes, we've been focusing a lot on the response and the adaptation response of the health system. But just to say that Aziza and me are part of, the Healthcare Without Harm network, and we work in our regions with the health systems to also decarbonize their thing. And different kinds of approaches to that. We've done trainings, we've done a lot of webinars during COVID. The whole concept of climate smart healthcare, whether that's sustainable buildings, resource efficiency, energy, water, waste management, sustainable transport, sustainable procurement. There's a whole there's a whole a movement, I think, that we're building for decarbonization of healthcare. The conversations around that. So I think for us, the Ministry of Health in India has taken that up as well. So I think that's a first win, and it's kind of percolating across regions. So
yeah, from my side, I would just say that basically when we speak about health systems, one of the building blocks is the health workforce. So when we get to work on the health workforce and we get to work on the capacity development, including the decarbonization and decreasing the emissions of the healthcare systems, then they can lead by examples and adapt and change their actions when it comes to the health system and the healthcare facility they are working on. And this can be one way forward in order to ensure that our health systems are resilient enough while also making use of our health workforce and educating and building their capacity. Thank you.
All right, well, we are at time, so thank you all so much. Thank you to our panelists, to our keynote speakers, and of course all of you for being here. We invite you to speak with us afterwards, and have a wonderful day. Thank you.
Thank you. We do apologize that we cannot interact with those who are joining on Zoom, but thank you for being here, and we will continue sharing our resources, and we'd love to hear your ideas how we can leverage the global pressure and resources for more local actions for capacity building. And thank you.
Hello? It works? Yeah? Yours doesn't.
I mean, if one is not.
I can show
1 2 1 2.
Oh, hello?
I just turned it on.
All right. Hi, everyone. Thank you so much for coming, and sorry about the small delay. We were trying to sort out some issues with the internet, but I think in times of Zoom, we're all used to that. So thank you so much for being here in this session of Evidence to Policy. We have quite an exciting at the Institute of Clinical for Occupational, Social and Environmental Medicine in the LMU University Hospital in Munich, Germany. He currently is working on topics of planetary health, on climate change and nutrition, e-health, spatial epidemiology, and spatial modeling of exposure pathways. He has special interest in developing analytical methodologies to address inequalities, especially in nutrition, and is also a lecturer and researcher in the Department of Epidemiology and Biostatistics at the University of Zambia, and a founding member of the Planetary Health Eastern Africa Hub. And finally, we'll have Sébastien Denis, who is the Director of Environmental and Occupational Health Division at Santé Publique France, the national French agency for public health. He has more than 20 years of experience in environmental health and has several French public agencies supporting environment or health policies acting at different levels of interventions, local, national, and international. He currently chairs the YAMPI Committee on Climate Change and Health. Oh, and we have the slides on? Brilliant, thank you so much. So this session is focused on understanding how the scientific evidence that we are producing, the researchers that you'll have in the session, and how it's being translated or not to action. We've known about climate change for many, many years. I don't need to tell you this. In 1965, the US government was already warned that climate change was dangerous for our health. We were already warned that we had to do something about it. In the first IPCC report in 1990, there's a chapter that focuses on the health impacts of climate change. And they already started talking about heat stress, vector-borne diseases, food insecurity, water insecurity, and the risk that this posed on our health. In 1992, we all came together to sign the UNFCCC, and we agreed to avoiding dangerous anthropogenic warming. And we're seeing very, very dangerous events already happening, leading to thousands of deaths every year all around the world in high-income countries, in low-income countries. We're seeing diseases spreading, dengue, malaria, other infectious diseases further north in latitudes where we did not find them before, threatening African people in highland areas where they were before protected. And we're seeing extreme weather events beating all records every year. So I think we have failed to avoid dangerous interference with the climate system. And the science has been very, very clear. We have had scientific consensus on the dangers of climate change to our health. A few years ago, in 2009, The Lancet started to publish its first ever commission, and that commission was on climate change and health. And the conclusion of that commission is that climate change is the biggest global health threat of the 21st century. There cannot be a more daunting conclusion of any commission, that we're dealing with the worst threat to our health of the whole century. 6 years later, the second Lancet Commission was published, pulling together new evidence from the health community and concluded that climate action actually is the biggest global health opportunity of the century. That we could deliver cleaner air, healthier diets, enormous public health benefits, immediate lives saved because of sound climate action. And that those two things go hand in hand in win-win situations that we rarely find. After that 2015 commission, and you might recognize the year, the same as the Paris Agreement, so it was quite an important moment. The Lancet Countdown was pulled together to do a monitoring exercise to track progress on how well we were going to be doing year on year in mitigating climate change, avoiding the health impacts of climate change, and delivering these enormous co-benefits. And for the past 7 years, we have been producing annually indicators with annual updates monitoring the progress on health and climate change. Our latest report shows that we're still having our health being threatened by our fossil fuel addiction, and that our health is at the mercy of fossil fuels. So we have not quite delivered much of what we were hoping for, but there is some progress done. A few years ago, we recognized and we realized that while our global report paints a global picture and can be very informative to assess the global state of climate change and health, policymakers need local information. They need information of what's happening to their people, to their constituencies. They need information that guides their own local policies and understanding their own local benefits. So about 3 years ago, we started opening regional centers around the world to try to expose these local patterns of climate change and health. And we have been doing an enormous amount of effort in translating our evidence into action. And you will hear today from some of the people that lead their work. IAMPI has recommended just last year, in November, that public health agencies should start monitoring and developing infrastructure to monitor what are the health interactions of climate change, such that they can be informed and act with the evidence that is required to protect people from this hazard and to deliver these co-benefits. And other public health institutions, Planetary Health Alliance, have also doing an enormous amount of work in terms of capacity building to ensure that we are equipped with the tools that we need to ensure that our science no longer remains locked in publications, in scientific papers, and in our curriculums, because that's not what we care about. What we care about from the academic, scientific, climate change, and health community is that the evidence that we're producing actually helps drive what's happening in the other room down there. And that health is at the center of how we understand and respond to climate change. So with that, I'm delighted to introduce you again to Stella Hartinger, our first speaker. As I said, she leads on our South American Center, and she's going to tell you a bit more about what the experience has been for them in trying to get policymakers in the very, very vulnerable South American region to listen to the science and protect the health of our people.
Thank you, Marina. Maybe if I could get my slides up and running. So, buenos días a todos. It's a pity that I can't speak in Spanish. It would be great, actually, if I could actually do this conversation also in my language. I think that is one of the biggest barriers that we have right now for South America and for low-middle-income countries. So maybe for the future, we can also think about simultaneous translations so that we can also speak and we can actually express better in our language. I think that's a barrier. But anyway. I think Marina said it all, but this is one of the biggest things that was happening. We have a big global evidence in the interaction between health and climate change, but most of this evidence is coming from high-income countries, which is very difficult to translate to low and middle-income countries. So I think it was actually brilliant when the Lancet Countdown said, okay, let's open a chapter for South America so that we can talk about the perspectives, we can talk about the problems that we have in each of these regions. The second slide, please, or the next slide. So they tasked us with this small mandate, which is to promote and develop research at regional level on the impact of climate change and health. This is what you guys told us to do, okay? In South America, we didn't know what the Lancet Countdown was. Many of the policymakers could not recognize even the Lancet. Many policymakers did not make the link between climate change and health. So we actually had to come with a strategy on how to do this. Because we were now talking about the South American region, which is completely diverse, completely different to any other region in the world. What we had to do is build partnerships. This was the first task, so that we could coordinate collaboration with academics and research institutes. We had to promote research, so we need to develop case studies locally or regionally. We have to develop indicators to be published in the Lancet Countdown Global Reports. And we had to produce the Lancet Countdown sister report for South America. What we actually did and was actually coming out by the end of the year or early next year. So please, yes, thank you. That's actually great. Yes. And the third task was to promote communication. So expand country-level communications and engagements. My next slide, please. So that is us. That is the 30-plus partners, researchers coming from 7 South American countries and 2 Central American countries, which are actually quite a little bit angry because they don't have their own chapter, Central America. And they would actually also be involved with the Lancet Countdown, but for the time being, they're part of us. We work with 15 universities and several organizations in the region, including the Pan American Health Organization, the Inter-American Institute for Global Change and Research, and the Global Climate and Health Alliance. I don't know if they're here now, but I think it's super important and very important to actually mention other organizations, because the way that we engage our public in South America is different from the way they do it in the global north. Because the global, for us in South America, I know that the medical associations are very strong, but they're also very political. So we need to be very cognizant of how to approach them and how much of the involvement do we want from them. And remember that when we created this collaboration, we were in the middle of a pandemic. And Peru has one of the highest and worst mortality numbers. So really approaching the medical institution at that point maybe was not the best idea. Please, the next slide, please. So, but how to create ownership, right? We are 30 people from different countries, from different backgrounds, from different academic institutions that did not belong previously to the Lancet Global, so they had to understand what we were doing, but they had to make it their own. So what we did is we started with the global framework. We follow the 5 working groups, the 5 areas, the impacts, adaptation, mitigation and health co-benefits, economics and policy. We follow those, and we recognize that we share direct and indirect pathways as those described in the Lancet Countdown Global. However, we must address the additional areas that are specific for us. Can you please go to the next slide? So really the difference for us is that we have tropical glaciers. We have 99% of the tropical glaciers of the world, and we need to assess what's going to happen with them. We have the Amazon rainforest that, because of the agricultural expanse and land use change, we are seeing environmental degradation leading to loss of biodiversity and ecosystems in the regions. We have a large group of indigenous communities in South America that we still don't know what is going to happen to them regarding their health and what type of other adaptation measures should we be implementing. We also have high socioeconomic inequalities, high levels of poverty, undernutrition, increased food security, insecurity, and we don't have universal access to healthcare. So really the inequities are massive. If you add to this, we have an uncontrolled urban expansion in South America that it's also aggravating our lungs. The air pollution quality is very, very bad. So the next slide, please. So now we had our agenda for the future. The next slide. So now we had our agenda for the future. This is the research that we will need to include in the Lancet Countdown South America in the next iterations. We need to focus on tropical glaciers, Amazon of carbon sinks, marine productivity and food security, health system strengthening, climate mobility, perceptions and mental health, indigenous communities and adaptations, and really push to get health naps in our setting. But why are we here? The next slide, please. For policymakers, right? So the way that we actually do it, we did follow what the Lancet Countdown was doing. We did our launch events, and we increased our launch events year by year. So we started in 2017 with maybe one launch in Peru. Then the next and the following year, we did a launch in Chile, in Peru, in Brazil. Last year, we did Peru, Ecuador, Costa Rica, Argentina, Chile, and Brazil. So every time we go bigger, we go broader, and we do these launch events. However, we don't stop there. We always go and engage with other organizations. One of the organization, well, not organization, I just can speak for Peru, but we also go and talk to Congress in Peru. We talk to the high-level climate change commissioner in Congress so that they also know, so that they can also hear what we are doing. And hopefully in a near future, because we have a congressperson here in the first row from Peru, they will include health as part of the agenda as well. Can we go with one more slide, please? And then I'm done. We also increased our policy briefs, since they're an amazing tool to actually present concise findings for policymakers. But I do think that we need to change a little bit the strategy on this one, Marina, because we need to go a little bit further. I'm not sure that the right people are reading these policy briefs or understanding what they're reading. So I do think that we need to find a way to not only go to the national levels, but go to the subnational and maybe municipalities and local municipalities there and bring them into the discussion so that also the community members or the people that are furthest away can actually also be involved in the process. So I will stop here and then.
Thank you so much, Stella. I don't know if you've picked up on Stella at the beginning saying what a big task we had given them and just how hard it was to do all this. And they've outdone themselves. So you're not entitled to complain because you did an amazing job. But they did it on a shoestring. And that is also something that needs to be highlighted. The fact that most of the research, most of the evidence still comes from high-income settings is an enormous problem. Much of the problem is that the funding infrastructure for lower middle income settings is nothing like the one that we have in high income settings. They are not tenured and they really depend on grants. And that is an enormous barrier to promoting relevant evidence for the key issues that are particular to the specific regions that we're dealing with. So thank you for everything you do, and we have to rethink the policy briefs. I would now love to introduce you, if she's online, to Rachel Lowe. Professor Lowe, as I mentioned, is a professor at the Barcelona Supercomputing Institute, and she leads on our Europe Lancet Countdown, who has just published their first annual indicator report as well. So I don't know if Rachel is online and can hear us.
Hi Marina, can you hear me?
Rachel, if you're talking, we cannot hear you, but we can see your slides.
Can you hear me now?
Rachel, can you hear us now?
Can you hear me?
Yes, quite loud.
Oh, you can hear me now. Wonderful.
Yes, there you go.
Okay, thank you so much for the introduction, and I'm very sorry not to be in the room with this amazing set of climate and health scientists, policymakers and activists, and I'm delighted to be joining this session to present to you our Lancet Countdown in Europe Regional Centre and our first indicator report towards a climate resilient future. So the Lancet Countdown on Health and Climate Change in Europe was launched in September 2021, and as one of the largest historical and current emitters of greenhouse gas emissions and one of the largest financiers of adaptation and mitigation plans, the response from Europe is absolutely crucial for the well-being and health of people across the planet, and it's important for us to build regional and local capacity to be able to monitor and understand the impacts of climate change and the response to this. So we are one of the newest centres alongside the Lancet Countdown in South America. We just heard about from Stella. We have the Lancet Countdown in Australia, in Asia, in Africa, and also smaller and developing states. And between our regional centres, we are looking to build capacity and to work together to address common problems and see how we can transfer this knowledge from these different regions. So some of the challenges that Stella mentioned, we're also facing similar and contrasting problems in Europe, and also in smaller and developing states, for example, we're looking at ways we can downscale our indicators at the local level to really make sure we can understand those regional impacts. As Stella mentioned, our regional centres are following the approach of the Global Lancet Countdown, where we're tracking the impacts of climate change, the way that systems are adapting to climate change, tracking efforts to mitigate greenhouse gas emissions and the co-benefits of doing so, and also monitoring the economic and financial dimensions of a transition to a clean economy, and the ways that society and politicians are viewing climate change as a health issue. So our Lancet Countdown in Europe team comprises several experts across Europe. I am the director, and recently Dr. Catherine Tony from IS Global in Barcelona joined as co-director. We have two chairs, Professor Maria Nelson from Umea University and Professor Josette Maria Anton from IS Global. Kim Van Dalen has been leading the report and will soon be joining me at the Barcelona Supercomputing Centre to pursue her postdoctoral studies. And we have several working group leads. We have Professor Joachim Roklov, Jan Semenza, Anil Markandia, Professor Slava Jankin, Dr. Mihir Desandi, and we also are joined by Dr. Oliver Schmoll and Dr. Vladimir Kendrowski from the WHO Europe Centre, as well as Marina from the Global Lancet Countdown, which has been instrumental in guiding the way we set up our centre. So in our first report that we put together over the last year and was published alongside the global report on the 25th of October, this included indicators produced by 44 experts working across Europe from 29 different institutions. So we published our first report detailing this and demonstrating the accelerating impacts from climate change across Europe. I encourage you to read the report. In summary, we can see an increase in the impacts across many different areas, including heat-related mortality, the increase in climate suitability for infectious diseases such as dengue, malaria, West Nile virus. We also had an indicator looking at the ways areas of Europe that are climatically suitable for the introduction of these infectious diseases are very much linked to areas where these diseases are endemic, and we're seeing increasing movements of population from these areas into Europe. And we're seeing very little progress to transition to a net zero economy, and we're very far off reaching that target of net zero by 2050. So our indicators are feeding into the European Climate and Health Observatory. This year we've provided the observatory with over 10 indicators to monitor the impacts. The Climate and Health Observatory includes a series of country profiles, case studies and indicators, and these will be available in an interactive format so that decision makers can actually enter the platform and view the changing impacts for their country over time. Just yesterday, the European Environment Agency published a policy report on the threats of climate change to health and well-being with a focus on heat and infectious diseases. And this is just a quick look inside at some of the indicators from our report, including heat-related mortality, where we can see increasing level of heat-related mortality, particularly in Southern Europe, and also an increasing risk for West Nile virus, as shown here. So as Marina mentioned, the biggest challenge is bringing together the funds to be able to establish these kinds of regional centres, to be able to communicate and engage with policymakers. Last year, several members of our core team put together proposals for a call from Horizon Europe on the health impacts of climate change and the costs and benefits of action and inaction. And we are very lucky to be involved in 2 projects that are funded within a 60 million cluster of 6 different projects addressing the impacts of climate change and including the One Health dimension. So I'll just say a couple of words about some of those projects that we're involved in. One of them is called Catalyse, which is led by Catherine Tony and IS Global. And the other one is ID Alert, which is led by Joachim Rocklov from UMIA and co-coordinated by the BSc. So the Catalyse project has 3 main questions, looking how to optimize health in climate change mitigation and adaptation, and how to close the knowledge to action gap to accelerate climate change action, and how should health systems adapt to climate change and reduce our footprint. The ID Alert project looks to frame the way we're addressing and building climate resilience to the emergence of zoonotic infectious diseases using the IPCC framing of risk in terms of hazard, exposure and vulnerability, and the One Health approach to disease surveillance in terms of monitoring animal, environment and human health. So in this project, we are looking to develop indicators to track progress on health and climate change in terms of the Lancet Countdown, to develop a seasonal indicator platform, and to project the changing profile of risks of climate change to the end of the century, looking at different mitigation adaptation scenarios. So we're looking to develop this knowledge at a regional level and also at a local level. We have particular hotspots in Barcelona. We're also working with partners in Holland, Sweden, Greece and Bangladesh. And we're particularly working, for example, with our stakeholders in Barcelona who have been engaging with us to look how we can develop this information to resist the emergence of infectious diseases and also be prepared for extreme heat in the region. This is particularly important in Europe, given our the increasing global connectivity, the issues we're seeing with populations on the move. We're seeing increasing health risk in urban areas, and we're hoping to strengthen our knowledge through these projects. So if you'd like to learn more about our Lancet Countdown Europe collaboration, you can find more on the Lancet Countdown website. We also have a Twitter page, so please do follow us there to find the latest information about our reports. We had a virtual launch event which is available online through the BSc YouTube channel. We also had a local launch in Barcelona where we were able to engage with the City Council, with the Public Health Agency in Barcelona and in Catalonia. And we're really excited about expanding our reach and the work we're doing with the European Commission, the Environment Agency and policymakers across Europe. And I look forward to the discussion later. Thank you very much.
Thank you so much, Rachel, for that. We are very fortunate of being able to do this in Europe. Europe has an amazing data infrastructure. We have amazing scientists, and the funding of Horizon has been quite a big push for this to happen. But the amount of work that Rachel and Kim Van Dalen, who also has been working on this project, have done this year is out of this world. This to us is also quite powerful in terms of helping lower middle income countries, because there's a lot of the models that will be developed in Europe that we're hoping can then support translation to low middle income settings. But the other way around is also so important, that those models that we're developing in low middle-income settings then help build into how we perceive climate change and health in high-income settings like Europe. So we're looking to a close intersection between climate and health in those different domains. Thank you so much, Rachel, for that. I think our next speaker is... Do you have slides? No. You too? Okay. So we're going to change, and we're going to go to Given Munga. So as I said, Given is the planetary health advisor for the Eastern Africa hub of the Planetary Health Alliance. And they're doing an enormous amount of work in capacity building and getting climate change into the conversation also in Eastern Africa. So Given, I hope you can hear us.
Yes, I can. Thank you so much, Marina. Hope you can hear me as well.
Yes, loud and clear. Thank you, Given.
Perfect. Thank you so much for this opportunity, and glad to see the team there. So, I'll talk about the Planetary Health Eastern African Hub, which I support as the educational advisor. So this hub aims to simulate regional community building, providing education and transformative action, and push for strategic policy making in the face of the greatest planetary health emergency of our time. So the hub aims to establish sustainable knowledge and solution hub on planetary health at the Eastern African university. So we do a lot of work within the Eastern African region, universities as it were, but we also bring closely policymakers so that we can help translate scientific research into tangible actions within the region. So our main focus areas really is supporting universities by providing courses, disseminating planetary health courses through a diverse network of universities within the region, but also creating a network of experts and key opinion leaders within the region. So we have strategies where we bring various researchers, professors, and also that they can begin to talk to each other and have collaborative research within the global south. Also, we realize, I talk about this a little bit later as well, we realize the great opportunity that we have in Africa, it really having a young population. So we engage a lot of student movement, empowering them with knowledge so that we can have champions within the universities through student-led activities. We also provide several online courses so as to have more knowledge base within the population. But most importantly, also we need to share this research, translate it into action, and also we try and bring the knowledge sharing, not only in the global south, but also north to south, as it were, so that we can strengthen the generation of evidence, but also strategize and learn from other regions how this can be actually strengthened. So we have a couple of collaborating partners within the region, the Global South, within African region, Eastern African region, ranging from universities, which some are listed here, but also some other organizations that help generate evidence, such as the Climate Action Network of Tanzania and many others. So we try to work with these local and regional networks. But we also leverage on global networks, and we have worked closely, like Marina has already mentioned, with the Planetary Health Alliance, which actually helped the establishment of the hub in the Eastern African region. Also, other strategic partners like Health for Future, Planetary Health Academy, and many others. So through these networks, we are able to have more collaborative work, research that we can do, and also bring together a platform for learning for students in medical universities and health sciences from Europe and in Africa. I mentioned here that there's quite a lot probably that can be shared from the Global South as well. This has been mentioned several times, how Africa is disproportionately the most vulnerable region in the world affected by climate change, and mainly due to lack of resources and inadequate mitigation and adaptation strategies. And we also find that within the global south, within the African region, also there are differences in terms of vulnerability, and we see that many is the poor communities that are greatly affected. But in all this, we see that also there is a lot that can be done from the global south, from the African region, and this is what we want to leverage and strengthen to ensure that communities can begin to participate in the global initiatives for and commitment for climate action. And there are so many opportunities for sure, because if you look at the development trajectory that we see at the global level and where Africa sits, there's a lot that can be done better in terms of how Africa then handles different things such as energy, and there's a lot more that can be done, for example, in sustainable energy management, acceleration, and also how this is developed. How do we then begin to have evidence so as to promote renewable energy and sustainable energy that can be harnessed and developed within the African region? And we have several partners that we work with, such as the African Development Bank that has been supporting the Sustainable Energy Fund for Africa, so as to accelerate energy transition within the African region. There are many more other opportunities that we see, but here I highlight that if we learned things from the pandemic that the world is just emerging from, we also got to realize that there is a lot of collaboration that can be done. Obviously, we've also seen that it's not easy to build consensus even when we face a universal challenge, but we've seen that this has created opportunities that we can begin to talk to each other and begin to address issues that affect us as a human population. And during the pandemic, we worked together with the planetary health hubs within Europe and Africa to try and bring resources, packages of information that could be shared and also disseminated to the Eastern African region. And this was the beginning of many things that we have now embarked on, because we realized that we could work remotely, for example, we could build trusted networks, we could begin to talk to each other, and the young people from universities could share information and share strategies and build these networks. And we have now looked at this as a benchmark as we have developed other strategies within the region. We have, for example, this collaborative project called the Sophia Project, which aims at strengthening One Health and planetary health in Eastern Africa. So we partner and supported by the DAD, and we have several universities that are participating in Africa, but also within Europe, basically in Germany. And we have mainly 4 thematic areas, which is education, research and collaboration as the second, community outreach, and also strengthening of student exchange. And within the education aspect, we are developing curriculums, digital lectures, annual summer schools within the 2 regions, Europe and Africa, and also developing planetary health education, online toolboxes, and all. But within the research and collaboration, I think this is part of the discussion for today, where we are developing research, joint research, but also scientific conferences where we can even bring policymakers to begin to have this conversation and see how research can be translated into policy by sharing policy briefs during these dissemination platforms of conferences, but also community outreach, because there's still a lot more that the African communities in East Africa do not know and the like. So we want to empower the community through community-based activities, and we're leveraging on the young people that we have in the region to be part of the movement as campus ambassadors, as it were. Also have student exchange so that we can begin to expose students to different settings and see different strategies that are being applied in different regions. I want to end with this slide, but to emphasize that planetary health, climate change, and indigenous perspective, and the core knowledge, values, and practices need to be incorporated into the education and sustainable healthcare. And this is one of the key things that we try to embrace and bring forward as the hub. For sure, the Global South can lead way on incorporating this new approach in medical education. And we've taken this lead in ensuring that we incorporate planetary health, climate change ideas, topics, and all in the medical training curriculum. I want to also emphasize that there are many opportunities for implementation research and evidence generation. I think there's a lot more that has not been done from an African perspective, such as benchmarking indicators, and also so that we can begin to provide this evidence, continue to provide this evidence, and also bring relevant implementers, policymakers to the face of the evidence, so that we can together suggest different ways that we could implement various research suggestions, as it were. I'll end here, and I'm looking forward to further discussions. Thank you so much.
Thank you so much, Given, for that. And the work that you guys are doing in terms of education, and particularly engaging with youth and with indigenous communities in Africa, is crucial. Without engaging with youth and indigenous communities, you cannot have sensible policies. So thank you, Given, so much for that. Can we have the next presentation, please, on screen? Thank you, Given. There you are. Thank you so much. Now we see you. Can we have the next presentations, please? Oh, there we go. All right, so I'm delighted to welcome now Sebastian. Sebastian, as I mentioned, Sebastian is...
Can you hear me? Can you hear me?
Sebastian, can you hear us?
Yes, I can.
There you go. Sorry, we had a few microphone issues. So Sebastian is going to tell us a bit more about the work that YAMFI is doing in terms of building data infrastructure in public health agencies. Go for it, Sebastian.
Thank you very much. So do I need to share my screen, or do you see the slides from your side? Can you hear me or not?
Yeah, we can hear you, Sebastian.
Okay, so yeah, that's fine. So thank you very much for the invitation and great discussions with the different presenters. I'm very happy to be here and to present you what did YAMFI so far about engaging and supporting national public health institutes as key climate actors. Next slide, please. So, as you might know, YAMFI, we have the next slide, please.
Can we have, yeah.
Sorry. So, as you might know, YAMFI is an international network of almost more than 100 national public health institutes spread over 95 countries, so it covers all the continents. And one of the main objectives of this network is to strengthen capacities of national public health institutes worldwide and to stimulate a real task force, allowing for these institutes to be really visible. And I think that in the field of climate change and health, and it was already said by the different speakers, then we have an essential task is that is to bring the evidence base to policymakers. And so in this topic, it's very important that the different national public health institutes can create such networks. The activities on climate change started 2 years ago, and so we did a preparation for the COP26, on which we had settled a small informal group, starting with 6 members of YAMFI, and now we are more than 50 members, so you see that we are going very fast on this topic. And the idea of this group was to promote a common vision of what should be the role of national public health institutes in the field of climate change and health. In addition, the climate change topic was included in the Yanfi Strategy and Action Plan between 2021 and 2025. And this Standing Committee on Climate Change and Health was created at the early of 2022, just after the COP26, on which the roadmap that I will present very shortly after was launched. So I have the pleasure to co-chair this committee along with Revati Forky from UKHSA. Next slide, please. So prior to the roadmap that I will present you just after, we did a survey among the different members of Yanfi, and we received 43 answers from, you can see on the map, different countries, ranging from low-income countries to high-income countries. And as the first speaker said, related it, I think it's very important that we share experience between low and high-income countries. So we really are looking for participants to be representative of the different income countries that we can have around the table. And from the survey, it appears that NPHCs are already a lot engaged in climate change and health activities, and for some of them, then they do climate change and health without knowing it, actually. But yet very few are considered as key climate actors and have the necessary resources. So we've seen that, and it was a common observation among the different NPHCs that answers to the survey, is that it is a problem of resource and maybe also of organization of the different NPHCs, having an ancient kind of organization separating infectious disease and chronic disease, for instance. And as the previous speaker Morgan said, then it should be a more integrating vision that we should develop in the scope of climate change and health. Then it appeared also from this survey that NPHCs have an important role to play to promote cross-sectoral approaches on climate, biodiversity and health, and to develop international collaboration, so that which is the basis of Yanfi. So we see, and it was also said, that climate change is intimately linked to biodiversity, loss of biodiversity, and also exposure to an set of other environmental risk factors, such as air pollution or quality of food, for instance. And so it is really important that we do not just center on human health. Of course, it's our main role, but that we also engage some collaboration, given the intersectorial and transdisciplinary approaches we should embrace to tackle this issue of climate change. Next slide, please. So, in fact, national public health institutes are very legitimate to tackle this issue of climate change and health, because it corresponds to the different public health functions that were defined by WHO regarding the missions of national public health institutes, and organized around three pillars. Public health functions, there are around 15 pillars, but here the most important of these issues are around three pillars. The first one around monitoring and evaluating, in the objective of gathering all the scientific evidence-based knowledge regarding links between climate change and health. The second one is respond and facilitate actions, and in this topic we can think about especially the actions of national public health institutes in case of extreme weather events, heat waves, for instance, during the summertime. And so in this scope, national public health institutes have a responsibility in terms of response and preparedness, and most of the time collaborations with the National Weather Forecast Institute. And then the last pillar is, of course, protection, promotion, and education, as it was related by the last speaker about giving information to the populations, and especially the most vulnerable populations, to try to decrease also the social inequalities regarding risks due to climate change, because we know that there is a superimposition between environmental risk, so climate change, and social vulnerabilities. So it's really obvious that National Public Health Institute can have a strong role to play in the field of climate change and health. Next slide, please. So that we published this roadmap just during the COP26 that you can download on the YANFI website for free, of course, and in which we underlined 5 priorities to be defined by the different national public health institutes. So the first one is a priority in terms of advocacy, and I think that it's really in the scope of what we said before, then knowing and let the policymakers know that there are a huge amount of scientific evidence that links climate change to health. So that's really an important issue, and that's really an essential task of National Public Health Institute. So advocacy, then enhancement of capacities, competence and training through peer-to-peer support and knowledge sharing between NPHs, so that we are looking for doing this in the communities. The increase of collaboration with international and regional organizations active in the field of public health and climate change, and so I'm very happy to be participant of this panel because we see that a lot is done about, for instance, indicators by the Lancet Countdown and its regional offices, and so it's also important to not duplicate what is done very, very well by the others. So it's also a kind of start that we are seeking for collaborations with other international organizations. The first priority is to support the greening of public health services. And then, of course, and one of the topics that was already mentioned before is to monitor the progress in the NPH's involvement in climate change policies through key indicators that reflects all the panel of potential impact of climate change on health. And so you have some pictures from this roadmap. Next slide, please. So next steps for the committee. So the committee, as I said, started its work less than 1 year ago. So we made a lot of progress working together and try to have a common sense and a common view on what should we do on climate change and health. So we divided the group into 4 subgroups, one specifically dedicated on indicators. And so I invite you to join a webinar that we will have next Monday, and you can register on the YANFI website, and Marina will participate to this webinar. We have other groups on warnings and planetary health, risk assessment and adaptation that have just started their work, and so the objective is to share experience and then to organize webinar and to structure other collaborations. And of course we are looking for developing interactions with WHO, the European Environmental Agency, and so there was a presentation by Rachel of the Observatory of the agency, and other international institutions, of course, such as the Lancet Countdown. So just to learn more, so the roadmap is available in different languages, so I invite you to download this roadmap and to share it, and then we can also diffuse this different communication thread. And I thank you very much for your attention.
Thank you so much, Sebastian. It is really, really great seeing public health agencies around the world starting to look at climate change and health and getting the evidence that they need to inform public action. So that's the first step, getting the evidence into the public health domain. Thank you so much, Sebastian, for that. And to pass on now to our final speaker, Dr. Renee Salas, who has been leading, as I said, on our US policy brief for many, many years, and that has been a very high impact product that has been handed and seen by high-level policymakers in the US, which is obviously the big emitter. So thank you so much for everything you do in terms of getting this into the US. So if we can get the slides for Renee up, and the floor is all yours.
Thank you so much. Well, here we are, final speaker. It's good to be back in person here too, so I can look at all of you in the eyes. So it's been an honor and privilege to speak along this amazing panel and to learn from all of them. And we're going to go back, as Marina said, to the Lancet Countdown. So the plan for the next 7 to 8 minutes is to talk about what the process is for the Lancet Countdown US policy brief, And then I'd like to share some of the successes and I think opportunities for improvement. Next slide, please. So when the U.S. policy brief launched in its current iteration in 2018, it was led by 2 emergency medicine physicians, and so we thought about the reality of how we do things in the emergency department. There's a patient who's crashing and the room fills with a diverse sector of individuals, from nurses to pharmacists to medical students to doctors and beyond, to save the patient in front of us. And we wanted to create that same room for the U.S. policy brief. So we wanted to make this a national collaborative platform where we could bring all of the minds and experts together, because we knew that it had to be shaped collectively and co-created by all of us together. So we created a working group that is now over 80 organizations, and they span the gamut. So there's federal science and technical advisors from entities like the EPA and CDC. There is academics, of course, and researchers. There's professional societies, and there's NGOs. And the reality is that everybody is coming to this from a different perspective, and everyone is equally valuable. And we have increasingly been integrating, as you see, some of the other expertise. So we wanted multidisciplinary perspectives. We wanted to get increased representation from across the U.S. We also have been increasing our health equity and environmental justice components, because as we know, we weave equity as a fundamental component to every brief that we do. And that is especially highlighted in our launch. And I think an exciting addition, which I'll talk a little bit more about later, is also this year we've brought on an amazing group of social and behavioral scientists. And they are thinking about it in very critical ways. Next slide, please. So what is the process? So we bring together everyone at the kickoff series and talk to those stakeholders who are really engaged in the policy discussion in the U.S. So we ask, what is the policy priorities? What are the areas that we need to highlight this year in order to be relevant for the discussion? Of course, there's a little bit of complexity there because we're having these discussions in June, July, and this launches in October. So this year was especially interesting given that the Inflation Reduction Act passed, and so we were rapidly trying to understand what the IRA meant for climate change, health, and equity policy. So it was definitely a moving target. But we identify the priorities. We also really seek feedback on what areas we should highlight. So every U.S. brief builds on the previous one. So we highlight different threats, climate threats that exist. So then through those discussions, we also then, and these are done through surveys and through conversations, the power of Zoom, as we all know by now. And then we also engage individuals in figuring out what indicator data we want to obtain that we think will best support the priorities that have been identified. And all of this is happening in rapid fashion. So then the core author team develops the initial brushstrokes on the canvas, as I like to discuss it, or frame it as. And that initial brushstroke, it's an amazing process to go through because the final picture never looks like anything at the start, but it shouldn't. I would argue that the whole goal of this is to be created together. So there's literally a Google document where the initial framework is edited, and we had over 50 reviewers, again from this breadth of organizations that engaged. And I think some of the opportunities that I've seen to really help further and hone our messages, not only in the brief, but in other work, is literally in the amazing dialogue that happens between different experts across the U.S. as we hone in on areas and say, well, what is the right framing for this? What does the science say on this? Where do we need to go? And I think one of the most inspirational pieces has been the people who have met during this process and then gone off and done the things that we've identified that need to be done. And then we produce the final, the brief product, and we have had a supplementary appendix that is actually written by members of our working group. So we identify key areas for case study and critical insights, and people volunteer and the experts are identified, and they actually write the case study and critical insight components, and so those supplement and are integrated in as well. And then the last piece is a regional perspective, which I'll talk about. Next slide. So what does all of this mean, right? The goal of it, this is a policy brief. I mean, sometimes we shorten it to brief, but it's a policy brief. So the first half is state of climate change and health, and the second one is what the policy recommendations are. So here's our change theory on how we approach this. So we have, of course, the global report, which is the scientific foundation. We're getting the disaggregated US-specific indicators and presenting them in the brief. We have this amazing working group who has a sphere of influence that collectively is enormously broad, so we can use that in order to engage with policymakers. We also have media who allows us to also be able to get that further disseminated into the hands and minds of other individuals. And then we also these are the other components, and I think this is where I'll talk about in what's to come in regards to where we need to be able to hone this theory more. And that is that one of our change theory components is that health professionals can be a powerful messenger to talk to policymakers. And so we actually create tailored ways to engage them. They can talk to their patients, and that lay public, of course, can also advocate for policy, in addition to our direct communication with policymakers. Next slide. So what does that really look like? So we have engaged with a breadth of individuals from across the U.S. government and policymakers. And again, this is a federal brief, so we engage at the federal level. And so the U.S. launch, we always ensure that we are integrating some perspective and that scientific expertise so we can get those individuals in the proverbial room to hear that and to be able to reflect on that. And the goal of the launch is to take this tool, what we hope is a living tool, and actually allow that discussion to shape what is it that we are seeking to achieve. What does this actually look like on the ground? So you can see in back, this is pre-COVID days, we would actually go and literally hand, that is a chair of a climate change and health committee in the U.S. House of Representatives on the far right. So you can see she's proudly holding the Lancet Countdown. So we literally are putting it in her hand. Next slide. And so these are the suite of products. So with our change theory, we recognize that we are creating not only from the U.S. indicator data, but also from the latest scientific literature that we're integrating. But that policy brief is, despite we try every year to shorten it as much as possible, but it's still meant to also be a foundation, right? There will be a number of individuals that we hope will read it cover to cover, but we want to be able to optimally target those audiences in our change theory of how we can actually influence policy. So we have an executive summary, which is meant to, I heard yesterday about how policymakers have a 3-minute time span. So what are the high points? Executive summary. Here's the high points. Slide that across the table and then get a staffer to read the dense brief. A summary for the general public, because again, our theory of change is that they can influence policymakers. And then we actually have a specific one for medical professionals, so that way they can understand why this is actually relevant to everything they do day to day. So to show that upstream impact. Next slide. As we know, though, that the way in which people experience climate change and how their health is impacted varies enormously wide, depending on where you live in the U.S. And so we've created regional tailored handouts that actually showcase and especially this year, I think there's a lot of action happening. And this was also co-created by members of our working group who live in these regions. And so they highlighted what policy actions are actually happening. So we highlighted a diverse set of states because nothing is more motivating than knowing that there is action happening. Next slide. So I'm going to end with what do we view as our successes, but I actually think they're really integrated. Where we've had some initial success, I think we've also identified there's enormous opportunity for continued improvement. And capacity, of course, has been a limiting step in this. We all do this on a volunteer basis, and we are able to produce these resources based off the generous support of our working group. So there's 5 things I want to highlight. So first, there is an enormous appetite for collaboration. As you've seen, all of these you've seen numerous faces on slides, right? We can only solve this by doing this together. And so the collaboration piece is this collaborative platform. We have a directory where we allow members to connect with one another Because the goal is, yes, we produce this product, but we want to be able to create the working relationships through this process that then catalyze into numerous other things. The second one is our change theory. As I said, we have integrated social and behavioral scientists, and we're sort of in phase one of that, of what that can look like. But we recognize that there is enormous opportunity to develop very specific, targeted change theories towards certain goals, so we can make sure we get the right data to the right people in the right way at the right time. Next. And then the third piece is the data. The Lancet Countdown data is amazing. Yeah, sorry, I said next slide too soon. The U.S. indicator data is amazing, but when we are identifying what is needed by our stakeholders and by the policymakers, there's often a disconnect. So how can we identify first and foremost what is needed in order to influence that change that we're seeking to achieve, and then work backwards and create that data in a way that optimally targets that? And of course, we have to evaluate that, because as everything, this is iterative. And then the fourth piece is the recognition that we have to have more capacity for the engagement. Again, we recognize that there is an enormous opportunity, and we've been using our stakeholder group for them to then go out and engage. But we have this initial launch, we have a series of meetings, but this policy brief theoretically should be relevant throughout the entire year. And I think there's an opportunity to have continued dialogue and to make sure that we are bringing that back up in critical points, so that way we can stay relevant and continue to influence things. And then lastly is evaluation, figuring out if what we're doing is actually working. We have this theory, we need to find ways to be able to highlight, okay, is this working, is it not, why isn't it working, and how can we do it better? And I think that that is fundamental for us to really accelerate this conversation and make sure that we're having optimal impact together. So, thank you so much.
Thank you so much, everyone. We've run out a bit short in time because of the technical issues, so we won't be able to have the discussion session that we wanted, but I think we've heard from a variety of different actors that are operating at regional levels, trying to ensure that the science that we're collectively producing, so much research, so much knowledge for so many decades, actually does get to the hands of those in power to ensure our health is protected and the health of our futures is thriving. So we've heard a bit about South America, the challenges faced in the region. We heard about the different actors being involved in Africa, the importance of education to bring people on board, how important it is to bring youth, indigenous communities to the table. We've heard about the enormous amount of wealth of resource that we have in the US, and importantly, how the European Commission is engaged and is starting to use the evidence in their own formal processes. We've heard about the US and what is happening there, how we've managed to get policymakers to listen through regional data, exposing stories on the ground for their constituencies. And we've heard about what public health institutes are doing. The fact that public health institutes are starting to incorporate this data as a fundamental cornerstone of how we understand and address climate change to inform actions that genuinely can protect people is an enormous success. But last year, we reached record levels of emissions. 30 years on from the signing of the UNFCCC, we're at record levels of emissions. We don't have all the answers in this group, and as Renee said, we still have to evaluate what are we doing right, what are we doing wrong, what is working and what isn't. And we try to engage with policymakers, we try to understand what do you need from us. Sometimes they don't even know. Sometimes they don't even know what information they need from us. So we're driving ourselves mental, producing all this evidence, trying to find what is the next big finding that will actually make a difference.
Can we ask a question to the policymakers?
Yes, I'm going there. Sorry, this is laying the ground to harass you just slightly. In 2009, we concluded that climate change is the biggest global health threat of this century. And you would have thought that the world would stop and we would do something. We've heard from the IPCC that the window of opportunity to secure a livable future, not a healthy future, a livable future, is rapidly closing. And in those discussions over there, not much progress is being made. I'm sorry to tell you. So what we need to hear now is what it is that we need to be doing, what evidence we need to be producing, and how can we ensure that that evidence is efficient and reaches those that need to use it. And we're very, very fortunate, because we have a very perseverant person in the room, to have a policymaker now with us. And I'm so sorry to do this to you, but I'm going to invite you to sit down here with us and tell us a bit what has been your experience in using evidence to drive policy.
Thank you, Marina. Thank you to the panel, and thanks to everybody. I am a scientist myself. I'm a neurobiologist. I've been doing research, basic research in a laboratory for almost 3 decades. And a year ago, I decided to run for Congress. So I'm a congressman now. And I do share the frustration of every scientist who wants to communicate a message to a non-specialized audience. And I guess that is the point that we want to address here. How do I, for example, explain someone who doesn't understand basic scientific language what the molecular mechanism of Alzheimer's is and why that should be relevant to public health? It's very difficult. So what you guys are doing is fantastic in terms of putting together the information, setting up the networks, and the collaboration that you need to do in order for this to be a global initiative. But the main problem still seems to be, how do I communicate it? And it is essentially a communication problem, a science communication problem. You need, I would say, my personal experience is you need to work on scientific culture, you need to work on environmental culture, and you need to work on research culture. One of the things we learned from the pandemic was, yes, we need to listen to science, but many of our medical doctors in Peru would not listen to science. They were doing evidence-based approaches, not evidence-based approaches. So they were telling you things like, yes, I've seen 200 patients and I know what to do with this pandemic. And we have the world record in terms of deaths per million in Peru, because we didn't listen to science. So that's one main problem in the medical community, if I want to be critical. In terms of society itself, in Peru at least, and I think this reflects the situation in Latin America, we don't really know what science is good for as a country, as peoples, right? We think that science is this microphone, it's a cell phone, it's an airplane, but it's not science, it's technology. We don't understand that knowledge can actually provide answers. But for us to understand that as a society, we really need, I think we also need champions. We need science champions, medical champions, people who are charismatic, who know how to translate this into simple words and go out there and reach out for people on media and so on. And this is a training that we usually do not have. So this is a skill that we need to work on. And I could go on and on. Yeah, they're going to kick us out. So one last thing. In terms of politics and politicians, you also have to understand that your average politician also does not understand science. And what they want is just a very concrete indicator, a very concrete recommendation. They will read these bulletins, but they will not understand much. They want to know how much that will cost the country, for example. And so the task is daunting, it's not so easy. You have it much better in developed countries than we do, but certainly we look up to you. Solutions you come up with, but I think part of the, just to close, part of the challenge is to get involved. I would love to see you guys being involved sooner or later in politics or in activism, because if nobody can do the job better than you guys can do.
Thank you so much. Those were quite inspiring words. Is it on? Yeah. Quite inspiring words. So thank you so much for that. And with this, we're going to just close the panel and thank all of the panelists as well for this, and to you for staying. And if you have any further ideas, if you have any thoughts or stories of success, do share it with us, because we need inspiration. We need to know what the way forward is. Thank you very much all.
Good afternoon, everyone, and thank you so much for joining this event in the beautiful WHO Pavilion. I am Catherine Bowen from the University of Melbourne, where I am Professor of Environment, Climate and Global Health and Deputy Director of Melbourne Climate Futures, which is the university's new interdisciplinary climate change initiative. And I'm very pleased to say that health is at the core of this initiative at the university. So it's wonderful to see that being reflected in an interdisciplinary climate initiative at a university. It is my pleasure to welcome you to this session on partnerships beyond the health sector for accelerating the uptake of scientific knowledge. So the purpose of this session is to highlight the importance of action on climate change for human health and well-being benefits, and provide examples of partnerships that can really show us the types of rapid and urgent transformations that we need in order to safeguard our future. As you will see, our panellists represent research, practitioner and policy perspectives, and we'll all bring different case studies of partnerships and the science, policy and practice nexus. So we hope that in this session we can hear ways that we can really strengthen our understanding across and within sectors about the fundamental importance of collaboration and partnerships beyond the health sector. Panellists will speak briefly on their topic area and discussion from the audience will follow. So we have a fantastic array of speakers in our session today, and I'll introduce each speaker briefly now, and then we'll hear from each for about 10 minutes, and then there'll be time for a broad discussion with questions as well from the audience. We really welcome a dynamic discussion. So firstly, I'd love to introduce our first speaker, Dr. Chandni Singh, from the Indian Institute for Human Settlements, and Chandni is also a lead author on the Intergovernmental Panel on Climate Change. So Chandni will be speaking about partnerships beyond health, and particularly showing us some case studies from South Asia. Next we have Professor Dioraj Kalsi, who is from the Inter-Academy Partnership. And unfortunately, we had one of Dioraj's colleagues, Jackie Cardo, who was meant to be attending today, but she was one of many, I think, who missed their flights over to Sharm el-Sheikh, so unfortunately she can't be here. But this partnership is also with the network of African Science Academies. And what Dioraj will be talking today is really climate and health, science and partnerships from an African perspective. We also have Dr. Joy Shumake-Gimo. Joy is joining us remotely. She's the lead of the WMO-WHO Joint Office on Climate and Health, and she'll be talking about health partnerships with climate science and services, which we know is so important as well. And then finally, we are joined by Liz Willits and Diarmaid Campbell-Lendrum, sitting in the front here, the head of the Climate Change and Health Unit, and Liz is a consultant within that unit. So Liz will be talking about the policy document that the WHO has been developing, looking at the findings from Chapter 7, the Human Health and Wellbeing chapter, and how we can really ensure that those findings are converted in a way that policymakers can make the most of them. So with that introduction, I will pass firstly over to Chandni. Welcome, Chandni.
Yeah. All right. Thank you so much, Catherine. And if we can just get my slides on, that will be really helpful. And in the meantime, I'd just like to say that I will be talking about some of the evidence from the Asia chapter that I was a lead author on from the IPCC report, the Assessment 6 report, and then also just a few examples from my own work in India and how we're thinking about the intersection of climate change and health, focusing on heat and adapting to extreme heat in these very unequal conditions that you have in cities across South Asia. So if you can go to the next slide. I know it's a bit of a stretch to go back and forth between. Yes, so the first thing, of course, the IPCC very clearly talks about is that
we know climate change is happening. It's really unequivocal evidence on that, and we know that climate change is having very severe impacts on a range of issues around health, both physical health as well as mental health. In Asia in particular, we show that its primary impacts both on things like disease incidence, spread of diseases, especially things like dengue and malaria, which we're going to also see them expand towards other regions that previously didn't see the incidence of these diseases. And also the fact that there are lots of second-order impacts of climate change on health. And a classic example of that is extreme heat, and that having repercussions on people's work, their ability to invest in health and things like that. If we can go to the next slide. Of course, one of the key areas where some of these risks are really concentrated are in cities. Across a lot of South Asia, as well as even Southeast Asia really, cities are places that are really densely populated and are highly exposed to climate risks. So we have a lot of evidence, again in the IPCC report as well as the Asia chapter, that says there is growing understanding and recognition from city governments that they are these places that concentrate risk. And there's also a lot of understanding now on actually planning for dealing with some of these. So we do find a lot of evidence on adaptation or intent to adapt in city governments. Next slide. However, what we find is that this progress is uneven. Lots of cities are showing intention. So we did an assessment of, we found across South, Southeast and Central Asia, there are at least 180 types of adaptation activities that cities are undertaking. And it's a range of activities. I'll show you some examples later. But they tend to really remain specific to certain sectors. So there might be something on floods or a heat action plan, but not really looking at risks in a combined and a compounded manner. And of course, that leads to sectoral interventions that are quite fragmented. So this progress that we are seeing is still not transformational in that sense. Next slide. This again reiterates that point that whatever action that we are seeing tends to be in preparatory phases. So around 57% of the adaptation actions that we saw in cities across Asia tend to be preparatory in nature. What I mean by that is there'll be evidence of, say, a vulnerability assessment. There'll be some evidence of some kind of planning processes being put into place, but that movement into actual action on the ground is still taking a lot of time. Next slide. And so we are seeing what we call in the IPCC an urban adaptation gap. And the gap really is this gap between what we need to do to deal with the climate crisis and what we're actually seeing on the ground. And we find that this urban adaptation gap is particularly large for the poorest in cities. If we go to the next slide, I'll show you what that, all right, it'll come ahead. The other thing that's really key to understand when we're thinking about climate change adaptation in Asian cities is we can't endlessly adapt. And I think as IPCC authors, we're constantly trying to bring this message out that there are limits to adapting. One really pressing example of that was the March-April heat wave in Pakistan and India, where we actually saw that some systems start to break down at certain temperatures, and we know from the climate projections that we're only going to see more of that. So to understand that even at current warming levels, which is 1.1 degrees, we are approaching what we call soft limits to adapt, which is that some people are able to adapt while others can't. At 1.5 degrees global average warming, which means different things in different countries actually, we're going to really start breaching some of those limits. And at 2 degrees, we know very clearly that some systems will collapse. So when we think about urban adaptation around health, around climate risks, we need to understand that there are very real and quantifiable limits to that kind of adaptation. Next slide. So this is what I was talking about, the urban adaptation gap. I would have ideally just walked to the slide and spoken through that, and it's really small, but if you look at chapter 6 of the IPCC Working Group 2 report, you can get into some details. of this, here we try to, through an expert elicitation process, really highlight. Ideally, if you look at the top right little bar graph here, the top right graph, it talks about this idea of no risk. This is where we want to go. This is where ideally we'd like to go, which is no risk. The blue bit is, this is what we're doing, current adaptation. And we'd ideally like to come towards this, but this is where we're at. So for different parts of Asia and for different kinds of risks, this is all we are doing. And these two ranges talk about the higher 20% of the population, higher income, and the low income. And you see the gap is much larger for poorer people. So again, this kind of assessment highlights how for particular risks, poorer people are much more affected, of course, but also are not getting the kind of adaptation support they have to. So I think this is, it's particularly critical for targeting and prioritizing the kinds of adaptation options we are doing in Asian cities. This graph is much longer and much more detailed in the report, so I'd really invite you to look at it further. Can we go to the next slide? Another thing that has really come up in this report, I think that we have enough evidence on this time, is this idea of maladaptation, which is, in simple terms, the unintended negative consequences of adaptation actions. We do have growing evidence on this. Of course, the classic example that we keep on talking about is building seawalls for coastal flooding. But I think if, again, from my own work, if you think about adapting to heat, there are lots of maladaptive strategies, particularly things like using active cooling, air conditioning, which can have negative consequences for carbon emissions. So it's really trying to start tease out what are the outcomes of current interventions that we're putting into place, who's winning and who's losing, and then can we avoid maladaptation by planning in advance and trying to avoid some of these negative outcomes. Next slide. So this is what I was alluding to in the beginning, that we have a lot of evidence, growing evidence of adaptation strategies across Asian countries. This is a list of some of them. We have rich examples from various parts of Asia, and I'd really, again, invite you to look at the chapter. The two that I want to highlight here, which have particularly become something that we now have a lot of evidence on their effectiveness. One is what we call green infrastructure. There are different terms people use: ecosystem-based adaptation, nature-based solutions, which look at both green spaces, both public and private and commonly collectively owned, to really help adapt and reduce risk for certain people. The second one I'd like to highlight is this idea of social infrastructure. So city networks, learning, peer-to-peer learning processes, social capital between different actors, processes that allow to or build social infrastructure have shown to also reduce risk. Next slide. And so I'm going to end with these two examples of what does this look like in practice on the ground. One is, of course, India has been quite, I think, at the forefront of understanding that it's a country that's experiencing a lot of heat and is only going to see more heat in the future. And there has been this range of heat action plans that cities and states in India have put into place. Of course, they aren't perfect, but I think they are works in progress, and there have been a range of actors that have been part of this, right from our National Disaster Management Authority, the NDMA, that sets out guidelines around heat waves, Meteorological Department, which actually provides forecasts at short-term and longer-term scales for informing some of the action on the ground, and then a range of researchers, local and international civil society actors coming together to improve just awareness about the risk that heat waves and extreme heat pose. So I think that this to me is a very good example of how you can learn from doing and have, multiple people coming together from very different communities of practice, really. It's difficult work to get these communities who don't usually work together to come together and to think about adaptation in a systemic manner. The second example is not from cities specifically, but I think also has a lot of lessons for what we're talking about today, which is partnerships, is in the 90s and early 2000s, the Indian government put in a lot of money behind developing good technology around climate information services. How do we provide forecasts at a really local level to inform adaptation decision making? And because of that push, there's been a lot of investment in the institutional architecture to do this. And while this was focused on agriculture, I think there are lots of lessons that the health sector can really pick up and understand how you can move from science, the meteorological department, the agriculture universities, bring in the agriculture extension officers, and then really reach the community. So I'm going to stop there. Thank you so much. Hope it was useful.
Thank you so much, Chandni. That was a wonderful mix of really interesting case studies and hearing from the ground from your own experience. So many, many thanks for that. We'll move straight to Professor Deoraj. Thank you.
Thank you. Good afternoon, all of you. Thank you, Catherine. I will be presenting a report from Africa. Okay. Sure. Thank you. The report I'll present is based on the work done by the academies, the Network of African Science Academy, working in partnership with the IAP, Inter-Academic Partnership, the role of which is to present evidence-based information in a timely manner for policymakers. The report is entitled Protecting Human Health Against Climate Change in Africa. I recommend you read the full report. I just produced some of the highlight in here. Next slide, please. You've heard the narrative, all of you, that the health of Africa is disproportionately affected by climate change. Let me repeat it again. That narrative been repeated, and let me tell you why it is so. When we just measure the burden of disease, if you look at the work done by WHO in the year 2000, I know the data is a bit old, but you can see Africa bears the biggest brunt of disease from climate change. In some countries of Africa, it can be as high as 120 excess deaths attributed per 1 million exposed population. So clearly, this is an injustice in relation to the amount of greenhouse gas that we produce. This injustice has to be addressed. Why are we not addressing it? Because we lack knowledge. So in that backdrop, next slide please, we undertook this report that look at what is the existing evidence, what are the existing gaps, are we reaching a tipping point, and what knowledge do we generate for in terms of adaptation and mitigation, and in terms of policy making. By the way, similar reports have been done by IAP in Asia, in Europe, in America. So this study is part of a global study that I'm presenting. Next slide, please. What we found, the knowledge we generated, that we have multiple vulnerabilities in Africa, starting with the high climatic hazards from direct impact of heat, rising ocean, adverse events, to the harsh geography that we live in. The continent has about 60% of arid land. On top of that, we have a high burden of climate-sensitive diseases like vector-borne disease, waterborne disease, airborne disease. That's going to be amplified with the climate change. And the population, by and large, have low resilience because the health system doesn't respond in time, in a timely manner, and the population of the low socioeconomic development, of the social determinant, they don't have access to adaptive capacities. Next slide, please. Now these, what I'm showing you, they also interact in many ways. The vulnerability is not just due to one. I'm showing you, for instance, in this slide, the direct impact of heat, drought, and flood, compounded with proliferation of pests like locust. They lead to crop failure. The most immediate impact of crop failure is malnutrition. Malnutrition spells disease and mortality. On that, then we can also have indirectly the flood can contaminate the water we drink, the food we eat, then it leads to waterborne and foodborne diseases. So the net effect is this loss of life and livelihood, this exacerbate poverty, and this civil unrest. Next slide, please. So what are the main findings of our report? We break it down into, I urge you to read the main report. We have 5 pillars: social capital, need for data, mainstream policy, implement adaptation and mitigation, and galvanize partnership. Social capital, we need to invest in social capital in Africa for people to be able to detect, avert, and manage these diseases due to climate change. We also need people who can negotiate in international forum like COP27. They have to know the ABC of climate change. So we need to build that capacity. Also to negotiate for funding. They should be able to put in a funding proposal and have all the right elements. We need data because policymakers need data for action. In absence of data, policymakers may be reluctant or may make the wrong decision. And we have a dearth of information there. Despite all the policy we have in Africa, we are lacking a centralized, uniform policy on climate change for Africa. There are many policies that are dispersed in many organizations, in many books, but the central one is still lacking. Adaptation and mitigation are an immediate way we can protect ourselves against climate change. And we have to use methods that are familiar in adaptation, mitigation to the local people. How are we going to do this? I'm going to elaborate a bit more. We need to go have a partnership. Next slide, please. Now, here's partnership. When we talk about partnership, we're talking partnership at all levels, starting from different sectors. The way we can adapt to climate change immediately, health adaptation, is through having a public health package by instituting an EWA in the system that can anticipate what is coming on and manage. And the best way to ensure that the EWA is going to be perennial is to have it engraved in the NDC. If you look at the NDC of Africa and the world, you see that most of the NDC in Africa have included health have mentioned health in the NDC. But beyond that, very few countries have really formulated an action plan that have NDC including health. And that is lacking because that intersectoral collaboration is not happening. We have the tool for it, health in all policy of WHO, yet it's not being implemented. Clearly we have to overcome this barrier. Next one, please. So adaptation is our immediate need we can do. But adaptation, we come to a limit because the carbon level, the greenhouse gases keep going up. So we have to mitigate. Now, to mitigate, we need to have the technology and the money. Yes, we're coming at the crossroad of the pandemic that have wrought havoc on our health system and our economy. Now we're going to recover. Okay, we have an opportunity for green technology. But do we have the technology, the money, the know-how, the transfer? So it's a very serious question that African nations are going to ask. And so for that, we need the partnership at all levels, especially from the know-how to the financial. We have $700 billion committed, US dollars committed to Africa, but we need to move beyond commitment to action. One more thing we have done, next slide please. The policy booklet is about 45 pages, so we come up with a policy brief, 2 pages only for policymakers that we'll be launching in our workshop in Nairobi next month, that will be made available officially. And what I want to conclude by saying, next slide please, climate change is happening now in Africa. Climate change is a global issue. It requires a global solution. We're not going to address a local problem. So I urge you all to partner and give whatever support you can. Every little bit counts. I thank you for your attention.
Thank you so much for that inspiring presentation, Durraj. We will now move to Joy, who's joining us online. So we'll wait till the magic happens somehow behind there, and we'll see her online any minute.
Great. Catherine, can you let me know if you can see the slides?
Oh yes, we can, Joy, and we can hear you. Please, go ahead.
Excellent. Well, thanks so much for inviting me. I'm glad I can be with you, at least virtually today. And as we're starting off talking about partnerships, hold on, is my slide going to advance? There we go. So since we're talking about partnerships, I wanted to start off with a very quick introduction to the World Meteorological Organization. WMO is the UN system's authoritative body on weather, climate, and water. And it does a few pretty important things that external partners and health partners are sometimes unaware of. And so first, just starting at the top on the right-hand side, to be able to know how the global climate is even changing, WMO coordinates and regulates the standard measurement and collection of Earth system observations. And then to make the forecasting of the weather, extreme events, and predicting the climate even possible, the WMO coordinates a global network of designated specialized centers for the data processing, the production of global and regional climate models, and the production of local forecasts. Then to be able to support then the advancement of science, the coordination and synthesis and communication of climate science, the WMO has a very broad range of joint programs and scientific partnerships, such as the IPCC, the World Climate Research Program, and the Global Atmosphere Watch. And a few of the products that come out of these joint programs are the greenhouse gas emission bulletins that are measuring what the gases are in the atmosphere and the state of the global and regional climates that can help policymakers. And then finally, to make sure that climate science is really responding to societal needs and being used by the communities that are affected by climate change, WMO supports a broad range of products and services that are developed through its members and sectoral and development partnerships with humanitarian actors, the agriculture sector, energy sector, water, and of course, health that you see down here at the bottom. So when it comes to adaptation in the health sector, it's clear that building resilience to climate change really calls on health partners to first understand the climate and how it impacts health outcomes, health services, and to be able to use this information, for example, to assess local vulnerabilities, know where and when to deploy infectious disease control. We just heard examples of heat action plans, where and when to build safe health and water infrastructure. We need this knowledge. And to get this knowledge, it really necessitates strong partnerships with the climate and weather science community, the experts who are measuring and predicting the climate and weather. And so the products featured here on the right-hand side are a few of these from around the world that I'm referring to. And because this partnership across the health and climate sectors is so important, the WMO and the World Health Organization have been working together for many years, back to 1952, in fact. And today we have a range of joint programs and mechanisms that help us work together. and accelerate the use of climate science. So these include expert teams on specific topics like extreme heat, sand and dust, and infectious diseases. We have a new 10-year joint implementation plan that's setting out priorities that we'll be working on. We have a coordination office, which is what I lead. And then we have regular publications and projects together. But we have two new ways of strengthening the partnership between the health and climate communities that I want to tell you about that are highlighted here in yellow. And these are focal points in the National Health Services and a new platform that we have just launched called klimahealth.info. So the first, we know that partnerships really start with people, and that it's often hard for health partners to know how to even approach the National Meteorological Services. So we're really happy to share that today 66 countries have nominated over 90 focal points within the National Met Services to work with the health community. And these focal points have a role to collaborate with health partners, identify the data and application needs, work together to build early warning systems, deploy heat action plans. Again, we heard some examples from India where that is happening. And these focal points have also been working with us to identify the relevant products that they have been developing at the national level, relevant data, research at the country level, to help the health community better navigate and find what is most relevant, because that's often a challenge. So in our new web platform that I'm about to tell you about, we have specific pages where these national products and resources are featured. And here you see an example from the United States. So the big announcement in this presentation is that we're really excited to share with you. Just last week, we've launched a new web portal called klimahealth.info. It is a joint project between the WMO and the World Health Organization. And this platform has really been brought online to help health partners as well as the climate partners to find expert groups, to find these focal points, be more engaged with local events and opportunities. It is intended to direct users to find the most relevant and authoritative resources and tools and data for their purposes, and to help find the relevant evidence in the growing scientific literature on climate and health. So the platform was really designed to meet the information needs of a variety of different users to help learn about climate health and find specific information. So we really hope that there is something in this platform that will help everyone do their work in advancing climate and health issues. So a broad overview of what is on the platform. It's arranged in 5 functional areas which all interact. There's an understand section for learning the basics. We have an act section that provides guidance specifically on using climate science and services. The learn section is a infrastructure around a library to help find topical resources at country thematic levels. The connect section is a live repository of what's going on, opportunities and experts. And then the explore is about the research library, which today has about 15,000 unique items in it as a starting point that we expect to grow. So to jump in and give you a very quick tour of what the site looks like, and I encourage everybody to explore it. This is the understand section, which is 3 short narrative chapters on climate and health impacts and solutions. And it explains what are climate services, the value of using climate science, and it's filled with examples and case studies. The ACT section can particularly help practitioners who are trying to design and use climate services. This includes a readiness toolkit of downloadable templates and checklists and a stepwise process to help consider and design better projects jointly between climate and health partners. And this responds to lessons learned and experience through projects of what have been regular barriers encountered and how to overcome them by using a tool like this. The next section is the resource library, which again is filled with case studies and tools and a literature portal, which is provided in collaboration with the U.S. National Institutes of Environmental Health Sciences of the curated scientific literature portal. We also have a country page for all UN members where content from across the site, which is tagged to that country, will be featured. And that's including the case studies or tools or products or partners that exist at the country level. So that's a really rich entry point and resource if you're looking for what is happening in your country or a country that you may be working in. We also have 22 specific hazard and theme profiles, and these provide actionable information on specific climate-related hazards and risks, including things like standard definitions and then specific tools to help manage those risks. So here we're looking at an example of drought and health, and all of the pages are about that hazard and its impacts on health and what are the tools to manage those risks. And then, as I've already mentioned, we have pages on the climate service provider profiles, and these showcase what types of resources and information are being provided by the Met services, including who to contact to better build these relationships and collaborations. So I end here, and I encourage everybody to explore this site and use these contacts to provide feedback, help us update the site with new relevant content, and help others connect with you and the work that you may be doing. So thank you again for inviting me today.
Thank you so much, Joy. I can see the audience was really interested in this initiative that's been recently launched. So it's wonderful to see the progress. And I don't know if you want to share with us your picture or not, but all we saw were the slides. But it was excellent. Thank you, Joy. Okay, I'll pass on now to Liz.
Hello. Hello, everyone. We had a last-minute shuffle in the delivery of this presentation, so We had a last-minute shuffle in the delivery of this presentation, so I am speaking off the top of my head, and I do have some notes, but I think I can cover this topic well. It's a really interesting session speaking about partnerships beyond the health sector. And what I'm going to speak about is the WHO review of the IPCC. And this was done for several reasons, including connecting the health sector to the UNFCCC process and the actors within that. I only have a couple of slides here, and this is the slide of the document. You can find it online pretty easily. What I'd like to do is just walk through the major topics of the document and then focus on the application of this piece and the knowledge it contains. Before I do that, sitting next to me are IPCC authors, and I would like to acknowledge them because there are thousands of volunteers who review tens of thousands of documents in order to produce the IPCC. And what the WHO did is read it and try to digest it to make it further applicable to certain audiences. So acknowledgement over here for the hard work that was done by my colleagues. And what this report contains is a review of Working Group 2, which is on the impacts vulnerability section, Working Group 3 on mitigation, and then some reflections on Chapter 7 on health, as well as Chapter 8, which goes into some of the poverty dimensions. So really looking at a full spectrum of what the IPCC has delivered in 2022. Again, I'll come back to the point that the intention of this piece was to fill a knowledge gap and a gap in mobilizing knowledge and applying it to different areas. That includes the gap between scientists and policymakers, as well as between different scales of the health sector itself. Those folks who are working on implementation at the national level, and those who are in these hallways trying to address global policy, as well as in the hallways of other forums addressing global health. So the first section of the report really looks at IPCC, and it does that because there are two global forums on climate. One of them we're in right now. The other is the IPCC itself, which is a decision-making forum on climate evidence. One really interesting takeaway from that analysis is the IPCC has been reporting on health since 1990. And maybe I'll take one step back. For those who don't know what the IPCC is as a body, it is similar to the UNFCCC in that governments come together to have an agreement, and the agreement is on the scientific evidence produced by the working groups. This evidence has evolved over time, but so has the agreement. And so since 1990, the adopted evidence under the IPCC has changed. In 2022, it is more holistic. There is a strong consideration of planetary health, so the interconnection of health and the environment, which is really significant not only for thinking about the evidence that's contributed, but also in the application of the evidence and how you apply interconnected knowledge. The next part of the analysis here is looking at how the scope of the problem has changed. A big concern for health is that both means and extremes are increasing. So average temperatures are increasing, as well as the extreme events. And for health, both of those have huge implications. The next big element of, there are four that I put into this report. The next is that both mental health and physical health are impacted by climate change in a variety of ways. Loss and damage is reviewed in the IPCC report, and its impacts are broad, including on non-economic impacts, which is where health falls under. And then lastly, climate resilient development is a concept that the IPCC has covered in its report in the AR6. And that's really interesting because it's really linking mitigation and adaptation to sustainable development and achieving the SDGs. And then it also frames that in the context of that is not possible unless there is a renewed focus on equity and justice and looking at planetary health, the interconnection of health and environment. The next section of the report is really intended to speak to the health sector, public health practitioners. It's organized the IPCC evidence by health equity and environmental determinants of health on food, water, and air. So it's taken the evidence and just organized it into those categories. Next slide, please. There are key takeaways on those determinants, namely that they are not in good shape, and in the future they will be in worse shape. One other element of this report is it took those environmental determinants, looked at the global health agenda, and then applied the IPCC evidence to what the WHO is trying to do on the SDGs, the health-related SDGs. So the slide on the screen right now has mapped out the IPCC evidence against the health-related SDGs under WHO custodianship. There are 32 health-related SDGs under WHO custodianship. 17 of them are impacted by climate change. 16 of them are related to children who are specifically impacted by climate change. I won't go through them here, but you can hopefully read them on the screen. In terms of the environmental determinants of health, I would just want to highlight a few points. One, that under food, we're talking about climate change impacting not only production, but access and cost. We're talking about malnutrition as well as food safety. Under water, there's strong emphasis on a range of outcomes that create an unpredictable relationship to the hydrological cycle and how that impacts a range of health outcomes, including water and sanitation and hygiene. And then on air, there's increasing evidence about the impact of wildfires and aeroallergens on health. And as we've heard many, many times, and the lungs surrounding this stage show us the very close connection between the burning of fossil fuels, the drivers of climate change, and air pollution and respiratory conditions. So the next part of the report is shifting. Now we take this evidence and look at what the IPCC says about action. This is my last slide, so that one will stay up here. But the topic I'm talking about is shifted a little bit. The IPCC talks about adaptation, what is ideal for achieving good outcomes, and many of it speaks to health. It also speaks about mitigation and links that to health in new ways. So on adaptation, on both, there's strong key takeaways, including the need to focus on synergies between both mitigation and adaptation, the need for multi-sectoral approaches, the need for proactive approaches, including to adaptation, and a very strong need to focus on co-benefits of all actions taken. Under adaptation, there are a number of highlights you can look at in the report, but a few are looking at climate resilient health systems, resilient water and sanitation systems, which is a largely neglected topic in climate policy, and looking at resilient food systems. Under mitigation, there is some kind of early evidence about the connections between mitigation actions in SDG 2 and SDG 3, so the Sustainable Development Goals on nutrition and on well-being. Under mitigation, there's also another interesting section that's relevant to public health practitioners, is a focus on demand and shifting consumer demand to be both more healthier and more sustainable, and much of that applies to healthy living and healthy natural and built environments. The last part of this report, this review, is applying this evidence to negotiations itself. For anyone trying to follow along on the UNFCCC, here right now, you may want to turn to the very last page or two of this report, because it is looking at how you apply the evidence from the IPCC to the conversation happening right now in terms of the treaty and the decision text. And namely, it's pointing out that the objective of the treaty, it's an environmental treaty, is the stabilization of greenhouse gas concentrations, and how that is an objective that is health promoting. But that this idea has not been elevated into the UNFCCC conversations. There's further discussion in the report about enhancing and expanding national adaptation plans with this evidence, expanding nationally determined contributions with this evidence, and then further looking at how this evidence can be applied in other intergovernmental forums where climate and health is extremely relevant. All in all, that last section is really geared towards elevating the health argument for climate change and trying to bring health into this space and creating that partnership with the UNFCCC. Thank you.
Thank you so much, Liz, for that very clear overview of the report that's been developed by the WHO, and I'm interested in all of it, but particularly that last section that you spoke about, and really how do we ensure that the health voice is strongly represented in these negotiations. So many thanks to you all, and to Joy joining us online. So we'll now shift to questions from the audience, and anything you'd like to hear more detail about from our panelists, or any questions you have in particular for any of our panelists. And if you wouldn't mind standing up and introducing yourself as well, and then the video can capture you. Oops.
Thank you very much. My name is Abiola, pronounced, and Non-Communicable Disease Alliance, Nigeria. Well, my question is for the professor and also the lady. You were talking about the disproportionate effect of climate change on health in Africa. But you didn't tell us where we are at the moment so that we can begin to work to fill in the gaps that she mentioned. That's number one. Secondly, the solutions provided here by WHO is not country specific. And then one size cannot fit all. We have, like you said, we have peculiar issues of health in Africa. And so we also need to work on a position where the African continent will be able to present to the world our peculiarities in order to begin to look for partnerships from you. What we have now, we can't even stand to get anything from you because your technology is up there, your standards are up there, we are below. So the WHO has to come to us and help us with our peculiar issues so that we can level up, and now we'll be discussing with the world. Now we can't discuss with the world. We're not on the same page. We need help.
That's a terrific question. I think I'll pass first to Dioraj, but we also have Brahma here who might like to comment after Dioraj, potentially.
Maybe the others.
Oui, d'accord, merci. Je m'excuse, moi je vais m'exprimer en français. Certainement il y aura des traducteurs. Depuis que nous sommes là, nous avons constaté que toutes les présentations nous ont présenté la catastrophe auquel nous sommes exposés. Et les pays les plus pauvres sont encore les plus vulnérables, surtout l'Afrique. Donc pour nous, l'objectif de cette COP, c'était de voir comment est-ce que les pays qui sont avancés peuvent assister l'Afrique. Tout n'est pas argent. L'Afrique, il y a certainement des ressources. Mais comment sur le plan technologique, comment appuyer à transformer ces ressources-là pour que l'Afrique puisse de plus en plus s'adapter pour contribuer à l'effort mondial de lutte contre les changements climatiques. Merci.
I'll take the first question about the NCD. Well, the NCD one, we know climate change is going to affect NCD because climate change affects nutrition, crop failures. When crop is failed, we switch on to food eating habit, or imported high energy dense or grow bio crops that are again rich in carbohydrate, and we put us about 25 million people at risk for NCD in sub-Saharan Africa. That's the minimum estimate. Et pour la question de madame, de qu'est-ce qu'on peut faire à propos de la collaboration, évidemment, il y a beaucoup de trucs qu'on peut faire, mais essentiellement, ce qu'il reste, c'est la formation. C'est à travers la formation. Quand vous aurez une équipe de gens qui sont bien formés, ils pourront prendre en main, en charge, les problèmes. Bon, à mon avis, ce qui reste actuellement, c'est la formation, c'est principal.
And you wanted to make a comment? I think I just wanted to talk about this, exactly what you mentioned, that these reports tend to be global. And even when we do have findings, when we talk about a region, for example, the region I did the assessment for Asia, we covered 52 countries. What can you meaningfully say about when you do that kind of aggregation, right? And so on the ground, it's really difficult for you to use that kind of information. One of the things that I think the IPCC is now increasingly doing is these derivative products. So like WHO doing this for the health sector and doing deep dives into particular regions. But what we are constrained by often, and that's where especially the African continent is often shown up as a data scarce continent. We just don't have enough evidence, peer-reviewed evidence, because a lot of that is what the IPCC collects. So I think we need to find mechanisms, and that's why this partnership panel is interesting. We know that there's a lot of evidence and knowledge that on-ground practitioners have. We don't need researchers coming into these countries to do it. We just need funding to be able to get that information in a manner that the IPCC can use. I think and that's the conversation that needs to go ahead, because the IPCC has very clearly recognized that the evidence is there on the ground. It's not coming into the IPCC. So I think there is that understanding now, but totally understand your discomfort with our global assessments.
Thank you for the question. I think it's incredibly important. I think it's important for multiple dimensions, but if we think about it just in terms of the UNFCCC today and the focus of COP27, which is implementation, the fact that we don't have an answer to your question and that data is incredibly significant. I wanted to just offer one piece of insight as someone who has now spent my summer reading the IPCC and all of its hundreds of pages, is that one of the ways I think this report is helpful is that it's a state of knowledge of health information adopted, and in that sense it can also be interpreted as the gaps of what's missing. And perhaps it can start to be used in the health sector as where can we develop further information at the global level? Or a country could look at this report and say, wow, this information is being collected in some countries. Is it being collected in our country? And if not, how can we apply for funding for this? And then that hopefully will feed into enhanced implementation to address the real problems that are affecting communities, but also can help you feed into this conversation here in a more meaningful way in the COP27, COP28 conversation and beyond.
And just to quickly add as well, as an IPCC lead author from the health chapter, it's an argument that I am prosecuting with many funders at the moment, is to help ensure, like Chandni was saying, that we have an equitable representation of the knowledge, and it's not at the moment. So if you've got ideas that we can collaborate on and really build up those partnerships, and particularly focusing on early and mid-career researchers and practitioners and policymakers to equip them with the skills that are needed to transfer what we know exists. But unfortunately, as we all know, the IPCC really does prioritise peer-reviewed publications. So how can we support a rapid upskilling of people so that those publications can really be much more representative? So it's a passion of many of ours, I think. So let's talk about how we can move that along. Brahma, did you want to make a comment as well?
Yeah, for sure. Thank you so much. I think the idea of having such panel is for our countries. Oh yeah, thank you. So I think the idea of having such panels is mostly to show to countries how they need to get out from the silos. There is no more way for working in silo. From the Minister of Health, how many countries from the Minister of Health look at the IPCC report related to impact on health? How many? If you document this, you will see where the gap in scaling the research output is coming from. We are not going through scientific evidence, and we are not working with the ones who can help us. If in our countries we make the connection between the Ministry of Health, the Ministry of Scientific Research, the Ministry of Environment, whatever evidence is coming from IPCC, you will certainly get scientists from your own countries who will explain this to you, who will support you to go through your minister and explain him what is the urgency and how they need as politicians to act. This is the main message of this. The partnership is not systematically going beyond the countries. How in your country you start working together to build on the scientific evidence that are coming out and how you can use them to move forward. Personally, I reached WHO due to frustration as scientists. The evidence we were coming out with, in order for me to meet with the Minister of Health, I need someone to come from Geneva. And then the Minister of Health door was open to me. When I reached WHO, what I'm observing now is what? When you ask a country based on the result coming from IPCC, what can we do for you? They even don't know what is in the report. So there is something to do. We need to come together. And this is related to this. This is the main message I wanted to share with you. We need to get out from our silos and to go to the ones who can help us understand what is coming out. And this is quite urgent right now. I don't know if it makes sense, but I think this is really good to touch on it for all of us. Thank you so much.
Thank you, Brahma, for that impassioned plea to really work outside of the health sector, and exactly this is what this discussion is all about. So another question up the back. Can you pass that back? Someone.
So just building on what Brahma has said, and also this session has come on the back of the Lancet Countdown, which is also based on trying to summarize the evidence for policy to create action. We do have a problem in that we ought to recognize that in health we've had evidence for a very long time on how to improve health, and policy, I'm afraid, is rarely built on good evidence. We saw that in AIDS. I mean, if any of us think that refining the craft of evidence is going to get us somewhere where we have our heads in the sand, that's not going to do it. We have political cycles to bear in mind. We have the fact that there's, in order to influence policies, you certainly have to at least be practical with the solution, not presenting information and reams of paper of what the problem is. We may need to do that for ourselves in order to identify what is the most strategic problem to focus on and what solution to propose. So let us, as academics, engage in that, dialogue. But then, if we really want to change the needle, let's recognize that we can't ask for a million different things. We have to unify. I mean, the only way we're going to get big systematic change is within the context of the very many issues that we identify, whether it's at national level or regional level or global level, one or two things that will really rock the boat in terms of making the kind of difference we want. and at least get the health bodies around lobbying for that in an articulate way with a budget, a solution. And then let's, with a few successes, and even if it means that we're all arguing for renewable energy and to get off coal, why not? That has spillover effects for everything. Something like that, even if it's not our sector, not our pet country issue. We are organized and we're not using our political agency. So however we, carry on shaping our next research agendas, please let us at least single out one or two things that make practical sense around which we can propose solutions and get behind them and move the needle. I really want to sort of suggest that we're wasting our time otherwise. We've known about climate for a while, and we're just simply wasting our time if we want more reports that no one is going to read. Let's continue with the research so that we understand what to do. But as we saw in the science tent today, which was a fabulous discussion, we also have to get comfortable with the fact the days of peer review research in this field are over and redundant. Our problems are shaping themselves in such a fast way that any solutions we even identify today will not apply tomorrow. We have to be comfortable with going with what we know now, unfortunately, and learning by doing. And that's not a comfort zone that academics are used to dealing with, but we have to get real and start with a few things. So things like, getting off coal, we know we could get behind. Just, let's just identify some things and use our collective voice. Thank you.
Thank you.
We've got a quick response. I like to focus on solutions. So I would just offer a takeaway here on that very important comment. The UNFCCC, so late in the day, the UNFCCC treaty, its decisions, and all of the years of work has yet to reference the environmental determinants of health. All of the evidence on health that's contained in this report is not included in a decision. Next week is the close of COP27. Perhaps a term like environmental determinants of health, reference to air pollution, reference to water security, water sanitation and health, reference to food system resilience would be a step forward as small language solutions to hopefully move this dial forward and apply what we know.
Thanks, Liz. And I think we'll also hear from our other panelists and really wrap up with some concluding remarks too.
Yeah, I really liked your comment, of course, I think, and I'm a person who sits on the intersection of research and practice, so I've started my career in civil society and then only moved to research later on, so I understand the value of learning from doing. But I think, and that's what the IPCC report shows very clearly, we don't know as well as we think we do what works and what doesn't work. We actually try to do an effectiveness assessment of adaptation solutions in different sectors. There are things we know, of course. We have a lot of evidence, but there's still a lot of gaps at higher warming levels, for example. What do adaptation limits look like at different warming levels? Adaptation effectiveness and how that changes, because of course as warming goes up you've got compounding and cascading risks. We haven't seen those kinds of things, and so the solutions that we're talking of today aren't fit for purpose for those higher warming levels. So how do we really think about that? And that's a collective it's really an all hands thing kind of, so we can't say that the research isn't needed and now we only talk about practice or vice versa. I think it's really, instead of thinking about a binary, I think we really need to think about these collectives, and that's what I said, communities of practice. So we need different types of minds and ways of understanding the world and solutions. And so that's why I see that we do get a lot of pushback about
what's the role of the IPCC now in this world? We've had these endlessly long reports. Where do we go from here? There are knowledge gaps that the IPCC reports pull out, and I think to the research community, I would say, look at those knowledge gaps. To PhD students, I always say, please look at those knowledge gaps, fill those. That's your mandate. But then there's the mandate of the practitioners, the knowledge brokers who are roaming around these corridors and trying to influence policy. So I feel in our different roles, there are multiple things we can do. So it's not we're done with this and now we move on to this. I think we need all these different kinds of things. So that's my reflection on being part of this mad IPCC process for the past 5 years.
Thank you for both your comments. I think they were appropriate. I go back to what I'm saying. The role of academia is to produce evidence base, to act on information available now. And as my colleague was saying, to fill the gap that is missing to move forward. So we advocate using the information we have at all levels, from including in the school curriculum, teaching at university, having workshop to disseminate it, having the physician who's treating the patient to be climate change conscious, to your politician. Everybody has a message that is addressed in our report. So we have the policy brief, and this is, you hit the nail on the head. It's exactly, we identify the gap, and the way forward is to build a capacity at our level of knowledge so people can take the action at the right time when they have it. Thank you.
I think we've run over time because we've had such a wonderful discussion. So I hope that these discussions will continue, and it's terrific to see the amount of energy and ideas and really passion for what are we going to do and what are the solutions that we're going to develop in an intersectoral way, so working beyond the health sector. So many thanks to our panel this afternoon and for sharing your thoughts and your experiences and the processes you've been following. And thank you, Joy, as well, online. I hope you might still be there, but there was a great interest in your talk as well. So with that, we'll close this session. Thank you very much.
Hello, everyone. Let me welcome to everyone here with us. So, welcome to our side event to this afternoon. My name is Ahmed Oda. I am a medical student studying in Egypt. I am serving as the contact point of the Yango Health Working Group, and I am one of the official delegation of the UNFPA. So I would like to share a few words about the human rights, because these words are so important to just address it into the Youth Day, because the Youth Day is meaning the right to healthy environment. So in the 8th of October, history was made. The UN Human Rights Council adopted the resolution 48/13, recognizing that clean, healthy, and sustainable environment is a human right essentials. On the 28th July 2022, the UNGA adopted the resolution 76/300, which actually universally recognize the human rights to be a clean, healthy, sustainable environment. This recognition can catalyze action to halt the alarming decline of the natural world if states comply with their environmental and human rights commitments. Individuals and communities around the world experience negative human rights impact results from the environmental damage. The human rights to live, life, health, food, and water and sanitation depends on the healthy environment, and thus are at stake as a result of environmental and climate instability. So the field most of actually in these valuable solutions, including women and girls, indigenous people, children, people with disabilities, if their rights to participate, access to information, and access to justice are protected. These same people can be leaders in safeguarding the environment as managers, leaders, defenders, and resources. Against this backdrop, the event will highlight the importance of the youth participation, gender equality, and gender responsible action, address climate action and environment. Climate justice depends on women, empowerment, leadership, inclusive and decision-making, and complete, equal, and meaningful participation of women and girls in environmental matter. So let me introduce that actually we're having an amazing speakers here. So let me introduce first to Dr. Carly. She is from Stanford University School of Medicine. She is a professor at Stanford University. She studies the effects of the climate change, especially the air pollution on children. She is a member of the National Academy of Medicine. She works with the WHO and US EBA on childhood issues around climate change solution. So the question is, what's the most... Oh, sorry. So it's a technical issue, sorry. Okay, so what's the most important thing that affecting the children health? Over to you, doctor. Sorry.
Thank you so much. It's a pleasure to see all of us here, and it's an honor to be here at the table with all of you and to be at COP27 in Egypt. And thank you. This is Youth Day, so this is quite appropriate and symbolic for us to be able to speak about child health. And as we move forward, I wanted to present my slides. And the faces of climate change often are children and pregnant women because those are the most often affected by climate change. They're disproportionately affected by climate change, and they're disproportionately affected by migration. And you see that here in the picture. On the next slide, it's really important to know some of the numbers, and I cannot emphasize this enough, that there's a staggering crisis of climate change, and it impacts children. Currently, 2.2 billion children are living in areas around the world in which the air pollution exceeds that is defined by the World Health Organization's guidelines. Let me say that again. Over 90% of the children in the world live in areas where the pollution is over what it should be. And in addition, with climate change, there are heat waves, there's river flooding, there's coastal flooding, water scarcity. All these are affecting millions of children, as you see there. And the next slide. These are slides from UNICEF, and UNICEF has done a great job also looking at how climate change affects children. You can see on the map there where the extreme weather conditions are going to affect more children and pregnant women in a higher degree. And what's expected is that 80% of the children on our planet during their lifetime will experience at least one climate change event, and most likely more than one. In the next slide. Now, we've talked about climate change, but how does that affect any individual child or pregnant woman? There are a lot of exposures that one has to deal with. I'll talk about one at a time, but remember that any one individual could be exposed to all of these things at one time point, and that's very important to think about the health risks. I have the pictures there, and you can see there's exposures in terms of infectious diseases, in terms of water sanitation, in terms of air pollution. And why do we worry about children and pregnant women? That's because their metabolism is higher. They have more air that they take in any one given minute, and so the air pollution can affect children even more, for example. And their organs are developing. And so because the organs are developing like the lung until the age of 23, air pollution and climate change and heat stress are going to affect children more than other ages. And it's also important to put social determinants of health, environmental determinants of health. It is very likely that people that are vulnerable, indigenous communities, for example, children that are younger, don't have access to health care as they should, for example, as an adult. In the next slide, I talked about how one individual can have many exposures at once due to climate change: heat stress, drought, water scarcity, food insecurity, as well as air pollution and wildfires and floods. But what's also important is to know that children now born today are going to be affected by climate change events in a cumulative way. And so we need to look at the cumulative exposures and how they put someone at risk as well. In the next slide. So I've talked about the problem, but let's talk about some solutions. And what was excellent was that the World Health Organization put together a policy brief on climate change, health, and intergenerational equity. And what I want to point out is that Liz Willits, who was here just recently, wrote this with many of you in the room, most likely, to review this. But it's really important to know that what was recognized and what was suggested was that the WHO is the ambassador to the SDG UN indicators, 16 of which are highly affected by climate change. And I list them there in this slide. But why is that important? It's important because we can use this towards changing policy so that we can ensure that when we think about what needs to be done, we need to reduce greenhouse gases consistent with the Paris Agreement so that we can have approaches that are human rights oriented towards health equity and intergenerational equity. In the next slide. And now with that solutions framework in mind, the London School of Hygiene and Tropical Medicine had a wonderful report and used questions in children and their families to ask them what they thought of air pollution and climate change. And I think what's really interesting here is that 40% said that their cities had air pollution, but 40% said their cities were cleaner. So I think that gives me a lot of hope and promise. In the next slide, what would happen if we reached Paris Agreement goals? You can see there, look at the numbers in Dhaka alone, how many lives would be saved, how many low birth weight births would be reversed if we were able to reach the Paris Agreement goals. These numbers can help us all frame our policies towards achieving the Paris Agreement and what we can do to try to get there. In the next slide. So I'm going to give you one case that I did as a pediatrician where I'm trying to help people and especially adapt to vulnerable communities. We have a lot of wildfires in California, and so I oftentimes tell my patients who are children to wear masks, and they have to wear filters as well in the home. But oftentimes people that are asked to put home filters in their home might not be able to afford them. So we were able to work with policymakers in our local city, and they were able to get free filters for all of the families that needed them. In the next slide. Lastly, I really want to focus on mental health because that's critical as we talk about climate change cumulative effects, especially in the youth and in children and in adolescents. And what I also want to talk about is not just the problem, but about the solutions. And what this group did in Australia was to actually put greenery in the schools, and they did a study where they put greenery in some schools and not in others, and they showed that the schools that had greenery improved their outcomes in their studies and their cognitive function. So right away, I want to make sure we can promote solutions that entail biodiversity and greening. Next slide. So I hope this was helpful. Most importantly, it is now imperative. The IPCC report shows that we are on red alert. We need more action for children. We need more action now, especially for vulnerable children and girls. Next slide. And in that, we need to build a better future together and leave no one behind. Thank you.
Thank you so much. And just a reminder that leave no one behind. And actually, we saw how much we can save lives if we just implementing the Paris Agreement very well. So how many children will be saved? How many children will be born into the healthy environment? So my second speaker, let me welcome Tasnia Ahmed. She is from the UNFPA Joint Youth Advisory Committee. She is a climate activist and public health practitioner working at Sirak, Bangladesh as program manager for the last 14 days as volunteer and 6 years professionally. She is the coordinator of the Youth Coalition for Climate Justice. She's acting as UNFPA Youth Task Force Committee on Population, SRHR, and Climate Action. She is the team leader of SRHR and D project focusing into the improving the sexual and reproductive health for women and adolescent girls. So I want to ask you, Tasnia, how the climate change make an impact on the gender disparity and the gender issues related to the SRHR. Passing the floor to you.
Thank you, Ahmed. Let's start with a story. A story about a community. It's a cartoon that we specially called Meena cartoon. And Meena cartoon is something developed by UNICEF and some of the officials of UN who work closely with young people and children. So on that time, this Meena cartoon was mostly focused on the gender people or the young people's perspective, that how they should be maintain the equality or how they are going to make a balance in everywhere. So this is a story when it was invented in terms of the connection with the climate action in 1989. So this story was covered about all of the things aligned with not only the health rather than in everywhere, because Meena was a girl and her brother name was Raju, and Meena was something that he always somehow deprived from getting all of the accessibility like education, health, information or anything, especially from her parents or their other family members. So in that time, Meena was thought that it should be something that I'm not having accessibility, all of the things that I should be get equal with my brother that also happen on the same things or same platform. Then why I am always getting so diverse all of these things, and why I'm always making a most deprived or avoided when I'm having such kinds of services or informations or any kind of, especially again the sexuality educations. And on that time, what was happened, it's something like, if it's a food, always parents make a short or small portion to the female child and the big portion to the male child. So with that concept, this Meena cartoon was invented, especially by one of the people of the government authorities who are mostly working with the youth and adolescent gender rights, the Director General of Family Planning and UNICEF. And mostly these things were not only the specific or example of the Bangladesh or India, mostly cover all of the South Asian region. Not only that, because this gender avoidance or disparity is very common. Let's go into an example of the climate affected areas. When there is a climate or flooded areas or the climate prone areas, there is such kinds of water must be available for everyone. But again, a girl who is having a menstruation, she needs more water than a boy. Then if it's really happened, then equality should be maintained, rather than we should just be more focused on the justice or equity, that what he or she needs must be avoided or cannot be fulfilled. We have to rethink about it. And if it's something that is happening in the community level, so let's come to the point of the policy level. What is happening here? Because there are so many policy. There is a policy in constitution in all of the continental of this Asian region. Not only that, there is another constitution in Africa or other region as well about to making a balance of gender equality. Then what was happened if it's connecting to make an implementation all of this policy or amendments of these things? Is it really happen? No, it's not going to happen in anywhere, because we always are going to make more focused on the making some policy or advocacy with the high level community members. But in terms of getting the information from the grassroots levels, there is a huge gap to the reality and the paperworks, because paper is something that is applied all of the points, but again when it comes to the point of the implementation, there is sometimes zero or sometimes even the negative side as well. And again, thirdly, I would like to mention about the monitoring and evaluation process that we all should be maintained. There are so many projects happening around the world focusing on the gender, but the project is complete, then we are going to get back to our work, and again we are going to another project. So what is the sustainability of all of these things? Especially when it comes to the point of the climate action areas, the peoples are not having such kinds of information or service on those areas. If it's something that we are just doing for the sake of the project or burning the budget or something like this. This is a question for everyone, not only this COP, rather than for everywhere, where we are actually recognized as a development practitioners. So this questions is not only for only the development practitioners, the academicians, the individuals, the consultants, and everyone. Then what is actually happening if you really want to make a sustainability all of the things? Because look, we are just going to make an SDG 30. We are going to implementing this SDG 30. If it's something, then what is the actual process and actuality all of these things happening? This is not happening. So if it's something, just we are going to make it right now, and then after closing this session, we are going to on our way, and the topic is remained here, then it doesn't really make sense to work on to talk about the gender, climate, or anything, especially for the children and young people. Look, the children, the adolescent period, the young people period, these are mostly vulnerable. And there is no any specific constitution for the young people at all. Somehow children are covered on the children categories. Adolescents are also covered on that phase. There are some people who are making any highest impact, especially from the South Asian countries. In my Bangladesh, there is no any kind of youth regions or youth perspective or amendments for the young people. So if it's something, then there is no any amendments, there is no any policy, then where we should take over all of the information, accessibility, our rights for the things. Are we going to take help from the adult, or are we going to search our things from the adolescents? There is a gap again. So again, there are so many things we can just take out, but one solution can make it happen. We should all take our voice from our side. We shouldn't not make a platform that when I get a platform, I will talk about it. No, you have to make your platform right now. Other than that, no one will make your platform. No one will even give you space to talk about things. You have to make your safe space. You have to talk about in your own way. And all of this, just one action, it will really make happen in the gender or climate action or any other topics as well. So I will want to stop here. If I make chance, then I will talk about it later. Thank you.
Thank you so much, Tassia. Really, just inspiring words that coming from you. So literally, that when we leave this session, we need to remember that every voice is accounting. Every action we are taking here during the COP, it's actually accounting. We need the policy decisions. We need negotiators outside to listen to us, to listen to the children and youth, to listen about the importance of the health topic. Right now, they didn't recognize the health topic officially, but they will, and also they will be enforcing to that, because any climate action, it's actually affecting into our health, and they need to understand this. So let me introduce the third speaker. So the third speaker will be Agniti, co-global focal point, United International Federation of Youth for Water and Climate. She is addicted to water and climate advocacy. She is working as interner at the World Meteorological Organization, focusing on bringing youth with key water and climate actor and decision making. She is certainly one of the global focal point of the United International Federation of the Youth for Water and Climate. And she has been working with the disaster displacement community in the Philippines to provide basic health services and to enable and train local women to become rare health workers. So the question is, how can the youth contribute to the climate action to resolve the risk and the challenges related to the SRHR. Over to you.
Thank you very much, Ahmed. Good afternoon, everyone. My name is Anjanette Bantiles, and I'm here from UNIFY, the United International Federation of Youth for Water and Climate. And we're building the platform where youth and youth organizations can hopefully forward their voices and their demands. And luckily, the World Meteorological Organization, through the Water and Climate Coalition, has been generous and committed by institutionalizing interns to focus on creating engagement with youth and how they can bridge the knowledge that they have to the grassroots communities through the youth. So a little bit of background. I'm originally from the Philippines, from Tacloban City. And in 2013, I don't know if you guys remember or heard, but we were hit by Typhoon Haiyan. So during that time, around, let's say, 900,000 people were displaced and were living in evacuation centers. And according to the estimates, around 300,000 women who just gave birth and lactating mothers were living in evacuation centers with not enough basic services for health and how to take care of newborn infants. And even the WHO estimated that in December 2013, 12,000 babies were born. And the question was, where were these babies born? Because during the typhoon, all of the city was leveled. There was nothing left. So there were no infrastructure to provide healthcare service, and there was it took some time for international aid to arrive and help the people that were affected by the typhoon. So all of the basic health services, especially for women and for children, were being given in makeshift maternity wards and tents, which was really not very sanitary at all and not very hygienic, which is one of the challenges during that time. So what they noticed was the vulnerability really was with the women and with children, because they were able to estimate that there was an increased incidence of rape, of trafficking around the evacuation centers, around the latrines where women would go, because everybody was living very close to each other and it was not safe. So there was a question not just of health but of security as well. So why am I talking about this? Because I would like to introduce what we have been working on with UNIFY, which is the Water and Climate Youth Development Plan and Agenda. So because of incidences like the Typhoon Haiyan, we have created this survey where we can gather inputs from youth on the ground all over the world on what they think about the gaps and challenges that their local communities are experiencing in relation to water and climate. So what we have established is that most of the gaps and challenges revolve around 5 problem dimensions, which include awareness and capacity, governance, policy and management, and climate change in the water sector, and WASH. And that also includes youth representation and engagement. So for WASH, I guess we can summarize the inputs and the perspectives of the youth is that we are still far from meeting SDG 6 in terms of WASH and protection of the quality of our water resources. So aside from doing the survey and making sure that we reach and we gather inputs from all of the countries all over the world, we also conducted validation sessions. So we had the inputs and then we gave it back to the youth and asked them, do you think this is true? Do you think that this actually applies to you? And if it doesn't, then tell us, what is it in your community that is not included in the data set that we have right now? And now that we have all these gaps and challenges that we identified, what can the youth do to be able to address these challenges at the local level? So that is basically what the Water and Climate Youth Development Plan and Agenda is trying to do, or the YDPA, is to be able to create a reference of initiatives of the youth initiatives from the governments, initiatives from UN agencies, the private sector, and put them all in one document, in one platform, for us to be able to look back on it and see what are the existing activities, policies, programs that we have that perhaps we can apply or adopt in our locality. And aside from that, we also wanted to present what the youth are doing right now, because I know that like for youth, we want a lot of things from our leaders, and rightly so. But because we are, we will inherit this planet, we have this responsibility and we have this fight, really, that's, I think, very, very important. So aside from that, we also wanted to tell them, like, look, this is what the youth are doing right now. Now it's your turn to help us. Support us to be able to implement this policy programs, projects, and activities in our localities in however way you can. So in terms of support that we're looking for, of course we want funding, but aside from that, we want to empower the youth to be able to provide the solutions themselves and come up with it from a local or grassroots perspective and connect it to the global agenda. So the Water and Climate Youth Development Plan and Agenda will be presented in the UN 2023 Water Conference in New York, and we really are trying to get the support of different member states and different governments, different organizations to be able to institutionalize 5 things. So I wanted to share 5 things, but unfortunately the PowerPoint is not working. But if you have some time later, please come up to me and I'll give you some cards. But basically, we want to institutionalize a youth secretariat that can monitor all of the programs that are being implemented locally. We want to create an inventory and be able to say, okay, this is what the youth have done in 1 year. Now what have you done? And how can you help us improve the numbers that we have right now? So I guess what before to close my speech, I also wanted to say that today is November 10, and the Typhoon Haiyan happened on November 8. So 2 days ago, that was the 9th year anniversary, and in the Philippine culture, it's supposed to be the final year that you commemorate the death of someone. But I guess for us who are still here, it's the ending, but for us, it's just beginning. And I think that at the level that we are right now, we shouldn't be still at the beginning, but we are, and that's something that we have to accept. But yesterday, the Secretary General mentioned that while it is difficult, the youth can always win. Why? Because you have the energy, you have the responsibility, and the future is yours. So it is something that you have to fight for. And I guess what my fellow speaker said earlier, especially Tasnia, the platform will not be made for you. You have to make it for yourself. And at Unified, that's what we're trying to do, is to create this platform for youth where everybody is invited, no matter what your advocacy is. If you want to do something about the climate, if you want your voice to be heard, then you're welcome to put in your inputs, and hopefully all together as one united front, we can talk to our world leaders and have them work on climate action now. Thank you very much.
And from the younger side, we are saying to the whole youth from the whole world, please join to the Unify, because really they are doing a great job. It's especially we will have the Water UN conference will be coming after this COP in New York, so they are doing such a great job, and also congratulations for these efforts. And I would like to say that I would like to introduce our 4th speaker, and last but not least. His name is Sean. He is 17 years old, and he is a member of the Waterhen Lake First Nation. He is currently a grade 12 high school student. He is passionate about indigenous advocacy and the equity of the inclusion voice. He wants to contribute to fight and voice against the climate change of our earth. So the question is, how are the indigenous youth experiencing the impacts of climate change in Canadian communities? Over to you.
Thank you so much. My name's Sean Bernard. I'll just do a little background on me first, is that I'm from originally Treaty 6 territory in Canada, and that's located in Saskatchewan. And so I am from Water and Lake First Nation. That is part of the Cree Nation in Canada. That's the Indigenous group that I'm a part of. So as your question was, I live on reserve. I do live on reserve, so I've had full-on, I see things that happen in my community that are arising, a lot of issues. For example, one issue is the climate, the very hot summers, very hot, and now it's becoming very dry, and now communities live in very wooded areas. They're very isolated, and once these fires and summers become and the heat becomes more rising, there's risks of these forest fires where it eventually caused my community to evacuate their homes. So an entire community had to get up and leave their reserve and just had to leave, and that was very bad on our mental health, bad on our health in general. We didn't know what to do. Another issue that is still today is our water. Water is accessible. We have to boil our water to drink it. We have to boil to cook with it, and we have to drive into town to get clean water jugs to use at our home. And so, as Indigenous youth here, I think gives me hope that I got this position to come here to speak on behalf of Indigenous youth. And I really hope that me being here gives that sense of hope for other people in their communities, the other people in their reserves, to say that me from my small community, I'm here representing them, and that we are the ones that should be representing our communities, and that we know firsthand what's going on in our communities, and that's why we have to be here to fight for ourselves, to fight for our things and stand up to that. We have to make our own platform, like they said, and that's why I'm here, is to creating that platform to make that influence so that other Indigenous youth can see that we can do this, that our voices matter, and that our voices will matter in the future, and that we can change what's happening in the future. Thank you.
Thank you so much. So, as actually he said, so the indigenous people, they are so important to address their rights also. So we are here from this session. We are telling the world leaders into the policy decisions that the youth are here. The youth voices, every one of us is accounting, every action is counting. So literally that, the UN 1.5, they are doing a lot of job, and they are summarize it into the 1 year and telling them what did you prefer or offer during the 1 year. So this is actually what we want to see from our leaders. So right now I am passing the floor to the audience. If they having questions they want to ask into our speakers, then I will be passing the floor to the speakers to answer it.
Hi. I had a video earlier, and I think now it's working. So if you can put your eyes to the screen, it's a short video about the YDPA and how the process was done throughout the 1 year.
change the tide of fate, set our hearts on fire, and we will never stop until we break the chains that bind us down. We reap that which we sow, let our actions flow tomorrow.
So if you guys want to see the full version of the YDPA, we have a QR code. You can approach me or Sir Jonas in the back later on to get the copy.
Thank you so much for the beautiful video that you are showing on the screen. So I would like to ask our audience or our speakers if they want to have some reflections.
Hi there. Actually, my name is Muhammad Rafat. I am 20 years old from Egypt. I believe that there are plan A, plan B, and plan C, etc., but there is no planet B. So, as we all know that youth are the future of all of the world, but if we make a better future, so we have to work from today, not from other day. So my question is directed to Dr. Kari. So what's your advice for the youth from all over the world in the health education or the health field, so what they can do to provide a better planet and a better future for all the world? So thank you.
Thank you so much, Mohammed. That was an excellent question. I think we all can think about ways to solve the climate crisis in ways that we can individually adapt to it, that we can teach our communities how important climate change is, and how if we don't use renewable energy, if we don't stop using greenhouse gases, that the temperature will increase and there will be worsened climate change events. We know that to be true. There's much data. We have so much science now that shows that this is a very critical time. But in explaining that to someone and educating those people that you are near, those people that you love, your friends and family, also explain that there's solutions, and those solutions can be tracked. For example, if you use an electric bus, you can decrease asthma by at least 50% in a community, 50%. So those types of information, I think, are very helpful as we think about renewable energy sources. And in the United States, we've done some economics, because as you all know, sometimes money does the talking. And what we've shown is that for every dollar that's put into renewable energy, you get at least $13 back for health benefits and co-benefits of that renewable energy use. So I think that's excellent for us to think about how to implement these data and how to implement our work together.
Thank you, Dr. Carly. And any other question?
All right, thank you very much. Can you hear me? Does it work? All right. Is this better? All right, perfect. So my name is Bas. I'm from the Red Cross and Red Crescent, and I thought this was an excellent panel. My question is very much related to the first presentation from the colleague of Stanford University, I believe. You talked around a healthy environment, really from a physical standpoint, so to say, but you also alluded to mental health. We as a Red Cross Red Crescent, we are a disaster response organization, but mental health is an increasingly important aspect of our work, both in times of disaster, but also not in times of disaster, particularly for young people feeling climate anxiety, for instance. But you ended with a note about leaving nobody behind. And I think with health, that's for physical health, that's easier to observe. But for mental health, that's more difficult because people don't share their concerns per se, or there's such a large stigma around it in the community that people don't feel free to share that. So how can we make sure that a healthy environment is also mentally accessible for everyone?
I want to make sure that the other people can answer that question too. I think that in preparing people for good mental health, it's the environment that you grow up in. It's families that also have good mental health. It's making sure you have the resources not to be stressed. It's making sure that you're not discriminated against. It's making sure that you don't feel the pressure of discrimination practices or Indigenous peoples. And those can all compound when you have climate change or when you have to migrate. And so I think we should do a better proactive, preventative job to make sure that we help the mental health of children, because the future, I believe, is ours. All of ages can be part of that future, but we have to make sure that not only the physical health is protected, but also long-term mental health, and we need to check in with people to make sure that's happening. So thank you for that excellent question, but I'll give it to others now to see what they think.
I guess in connection to what Dr. Carey mentioned, yeah, I also believe that prevention is one of the key answers to having access to mental health, especially for young people. And I guess from the perspective of a youth, I'm still a youth. Oh, sorry. I'm still a youth, I promise. But from the perspective of a youth, I guess it's just creating a safe space for even just your friends to be able to make them feel that they can share. And I guess that begins with you being able to open up to them as well and creating and starting that conversation. And I guess in terms of creating a more stable environment for young people and for kids to grow up in and to feel safe and to have that stability, what the WMO's message to that is also how do you convey or how do you get the message out there in a way that people understand what it is, because as you know, the data is there, the science is there, but it doesn't always translate to something that normal people, that the rational individual understands. So I think that's the first thing, is how do you make people understand what is happening and how do you get them to react and to engage at all. So yeah, I guess that's it. And I think from the Unify front, we're just trying everything that we can to get young people engaged. And if you're watching the video, there was a song that was playing, and this is the Unify song, and we had volunteers create that as well. So even that small thing is to get people engaged and to get them sort of starting thinking about what climate is and what they can do. So you don't have to be a scientist or an academic to be able to participate. So in your own little ways, if you're an artist, then there's a place for you in the climate movement, for sure.
Just to add on to that, I can only speak on behalf of my Indigenous community, but with mental health, that's a big issue that is happening inside our communities right now, and I understand that the reason to that mental health is that we're losing our connection with our culture, with the connection of the earth. The earth is a spirit to us, and the earth is something that we needed to protect. And once we're losing that stability with the earth, we're losing that mentality of tradition and that culture. And it all comes back to going back to the community, going back to your people, and engaging your community in these conversations, engaging these people where they're actually being heard, being seen, and getting our voices in. I feel like that's really helps with our tradition. That helps with saving our planet, saving our culture, saving who we initially are, and saving our mental capacity. So I just think we have to engage these communities in these conversations more to have that mental stability, which is not that easy.
Thank you so much. And any other question? Okay, so I would like to ask our speakers so briefly into the one sentence. What's your last words that you will see it in this session, and what do you want from the policy decisions when they are hearing to you?
So, a common sentence is, today's children are tomorrow's youth and tomorrow's young people are the future. Sorry, I can't agree with this statement, because children and young people are the present. They have to talk right now. It's not going to be tomorrow. So this is the commitment, and for the next COP or beyond the sessions or other things or the platform, there is so many stakeholders, like there is a UNFPA, there is a Stanford University and Youngwa as well. So I would like to urge something, that what we can do, we can make a statement, or we can make a gender-specific caucus where all young people and children talk about their gender rights in the very specific way. Because when it comes to the point of gender or any kind of health information, people always try to keep it in one umbrella. Then why don't we think about in a very simple or separate or segregate way? So if we make a different caucus, especially for the young people or children, it will be more merging, or more collective message will be developed on that way. So as UNFP is as well and WG is also working, I will ask to both of them that if they have chance to talk and make a commitment, especially for the young and children caucus platform, where they can talk and they can work and they can even make a safe space to talk about anything, rather not only especially on the things better than gender and beyond all of these things. And I will definitely would love to work with all of the young people on this specific platform. Thank you.
If I will summarize in one sentence, I guess it would be, let our actions flow for tomorrow. Make sure that whatever you do today adds to the value of the future that you want, and not subtract from it. So whatever you do today, make sure it has a positive impact, not just on the future, but on each other and on yourself as well. So yes, that's it. Thank you.
Many of the things that have already been said are fantastic, so I applaud my colleagues. I would just say to be bold, to make sure that we are innovative, that we help each other, and that we embrace new ideas to make sure that we can help each other and the future. And that includes all ages, but especially let's help the youth, because oftentimes they are the most affected by climate change, but they are often not heard. And we are so glad that you're here at COP to make sure that your voices are loud and echo, and we hear them, and we want to do something together to help. Thank you.
Thank you so much. Just to add on to that, it all goes back to the youth. It always goes back to the children, where we need to educate them more on the crises that we know. We have to educate our children, our youth, what we already know and what we have already understanding. And not only that, we can learn from the children as well, that we can learn from us, that we can, in these conversations, we can have generations of different conversations, of different knowledge and different experiences and different perspectives. One thing, just to add on, I talked to an elder before I left, and I talk to elders a lot, where this resonated with me, where they said we have to bring our tradition into the modern, and we have to bring those together, where tradition and modern meets to become this sustainable life where we can all come together as a whole community. And I just thought that's like pretty much what it means, as we have to learn from each other. We have to learn and have these conversations and have each other, where we can have each other in these circles so we can have these perspectives. So thank you.
So my last reflections and actually words that we don't need to have a signature on paper. That no, we need action. We need real action. We need to see the real impact into our local and national communities. We need to change, not to have the signature into the paper and that's it, and leaving the table and okay guys, we are actually signature into the Paris Agreement. No, we need something to do about it. We need to address the youth, the gender rights in your NDCs, not to just ignoring them, excluding them. We want the SRHR rights to be addressed in your NDCs. So we want all that. We want the youth being engaged in your processes. We want to see the youth are being in your national delegation. Not all of them, they are negotiators. No, we want a young negotiator program in every country. We want the youth to be in. We want the youth to be sitting on the negotiating table and say that it's our demand 1, 2, 3, 4, and you must to address it, not to ignore it. So thank you everyone for being here, and I'm so happy for you. Thank you all.
Yes. Hi everyone. So now we'll be starting our session about climate change and health from medical students' perspectives. So this session, it will be more about sharing experiences, sharing personal thoughts, reflecting on what's happening throughout different regions, different countries, because all the people on the stage, including also our amazing moderator, they are all from different countries as well. Just like two from one same country, but yeah, anyways. So first of all, I would like to introduce the moderator. It's Iris Blum. Iris Blum is a 27-year-old PhD candidate at the London School of Hygiene and Tropical Medicine, researching how to make health systems more sustainable and resilient in the context of climate change. She's a medical doctor from Netherlands with a master's degree in global affairs from Tsinghua University in Beijing, China, as a Schwarzman Scholar. She attended the COP25, COP26, and the first ever UN Youth Climate Summit to advocate for planetary health. She's the first next generation representative on the steering committee of the Planetary Health Alliance. She has represented medical students worldwide to the World Health Organization during her medical studies and helped set up and was part of the first steering committee of the WHO Youth Council. So welcome Iris and thank you for moderating this session. And I will leave Iris to introduce the amazing panelists. So yeah.
Thank you so much, Mohammed, and I'm very glad to be here with all of you. We're going to be talking, as Mohammed said, about medical students' perspective on climate change and health. And I'm very, very excited to be joined by incredible medical students, and also there on Zoom we have another medical student joining us. So you might be asking, why are we here? Or we get that question a lot, I think, outside of this pavilion. Many of you are very much aware of the relationship between health and climate change, and we'll be diving more deeply into that during this panel as well. There will be time at the end for a Q&A, so please note down your questions and anything that you would like to ask our panelists or engage with them about. We would love to hear from you as well. So with that, let me sit down so you can see them better. I will be starting to introduce our panel. They will wave shortly at you to indicate who I'm talking about. So first of all, we have Ahmed Al-Bayati, who's a medical student from the University of Baghdad in Iraq. Then we have Nikolai Patalon, the 6th-year medical student from Katowice in Poland. We're also joined by Juliette Matthijssen, who is a final-year medical student from Erasmus University in Rotterdam in the Netherlands. We have on the screen in front of us Omar Amwafi, a medical student in Cairo in Egypt. And we have also joining us in person Mariam Benazouz, a final-year medical student from Casablanca in Morocco. And then we also have Bea Alberman, who is a medical doctor from Switzerland. She's also been a national WHO youth delegate for Switzerland. All of our panelists have extensive experience in advocacy for climate change and health, working in that area, and we'll find more out about that during our session. So I hope you're ready to hear from them. So let's start out. I hope to learn a bit about how you all first found out about climate change and health. I remember for me, when I was in high school, I just thought about the polar bears and the melting ice caps, and all of a sudden, after my first year of medical school, I found myself in Barcelona, and someone told me climate change is the biggest threat to our health. And I was like, wait, what? I've never even thought about this before. So that's kind of how I came to that realization and have been in this space ever since. But I would love to hear how this was for you. So Ahmed, I would be starting with you. How did you find out about climate change, its relevance, and how did you feel about that?
Okay, thank you, Iris, for your question. So the first time I heard about climate change was in high school, when my parents told me that we are a country known for its hot summer, because for most of the days in July and August we have the degree exceeds 50 Celsius. So it was like the first time in high school when my parents used to tell me that when we were younger things were different, things were a little bit colder. So yes, there is an issue, but I didn't know that this issue is called climate change until like I joined college and I started working in civil society to know more about the issue. And as you're having unknown issue, unknown destiny, it is frustrating, especially for a young person. It's frustrating for any person, but especially for a young person who doesn't know what to do. And especially at that time where I didn't know that I can do something. Like it is the responsibility is the skill to do something changes in the feeling of the person. It changes the feeling from frustrating feeling into a responsibility feeling. So yes, that was my story, how it started.
Thank you so much for sharing that, and also that feeling that I think a lot of us probably in the room as well are sharing with you. So now, Nicolai, let me turn to you. So how did you realize it, and what kind of challenges were related to realization?
Well, precisely. At first, just like I think many of us, I wasn't aware of the urgency, because in my day, in the school curriculum, obviously climate change was present as a fact. It was presented, it exists, that it may increase in the future, but in no communication in the media, in the school curriculum, there was no sense of urgency. Second of all, there was no mention of health. So, to be honest, it wasn't until I was at medical school when that topic was introduced to me, and it was not introduced through the medical school curriculum, sadly still. It was introduced through IFMSA Poland, through the member organization of IFMSA, where this topic was introduced thanks to our international operations, international policy making in IFMSA. People travel to international events, learn there, participate in sessions, and then come back to their countries and bring the message locally and adapt it to local circumstances. So it was in my NMO and my national member organization that I found this, that I strove to learn more about this topic, and it brought me here. Like through policy making, through those first steps, I found myself, just like you found yourself in Barcelona, I found myself in Sharm el-Sheikh at COP. At this wonderful event. So I think this is a real point to be made about the fact that the sense of urgency is not always communicated, and people should learn about climate change and get to know about climate change with full knowledge, with full background.
Yeah, I very much agree with you on that. Hello? Yeah. For sure. Thank you for highlighting that. And for those of you that might not be aware with the term IFMSA, this is the International Federation of Medical Students Associations. And all of the students here on the podium with us are part of that delegation to COP27. With that, I would love to hear Juliette. Can you tell us a bit about how you got introduced to the concept of climate change, and also why you realized it was relevant to your work?
So I have been engaged in public health since the start of my medical education career, I would say, because I believe that health is something extremely complex and difficult, but also something very intimate to all of us. It touches upon the lives of people. And in my country, we have the Netherlands, we have a lot of health inequality as well. So I believe that the health system, if not caring, is not enough to improve these lives of people. And then 3 years later, I discovered that all the work I was doing on human rights advocacy, on health improvement, on SRHR, it had everything to do with the climate crisis. The climate crisis touches every effect on every aspect of our lives and every aspect of our health, and that is why I started to engage, because if we want to improve the health and well-being of people all around the world, this is the topic that we should continue to focus on.
Thank you very much, and also that strong call to make us realize that we need to have action and that we need to realize the importance, all of us here in the room. Omar, with that, let me turn to you on the screen with us now. I would love to hear from your side, and thank you also for being here and adding the perspective of the Egyptian medical student, as we are all here together in Egypt. Could you tell us a bit about how you realized that and how it made you feel?
Okay, I'm sorry. The connection is a little bit bad, so I'm not hearing you very clearly. Oh yeah, I think for me, I first heard about climate change when I started degree. I think it's a common thing from all of us being medical all around the world that we start taking it seriously when we were presented with the knowledge and the facts. I remember at first feeling a bit helpless, not being able to act. But I think it went on further. I think every day it's it's about taking more steps and about having. It's really about like pursuing your goals and your visions toward climate action. And from an Egyptian perspective, I think it's a great honor, of course, to have Egypt host the COP27. But I do believe it's just this should not be the end of it. Continue on building on this and continue doing more steps to engage youth and participate in climate action.
Thank you so much, Omar. And thank you for joining us once again and highlighting the perspective also from Egypt and from now organizing the COP27. I hope the connection improves and that you can follow the discussion here. Now let me turn to Miriam. Let me turn to you. I would love to hear when did you find out and also when did you realize the scale and importance of this issue?
So for me, it was actually really similar to all of your stories. I was aware of it in high school, we studied it, but I was not helpless, but I was feeling that it was impossible really to make a meaningful and sustainable change and try to do things at my level, not to use that much AC, not to take long baths. And afterwards, in IFMSA and when I entered medical school, I discovered something. My passion about infectious diseases and the One Health issue, the fact that people are not really interested by it, and so I learned to love it, to be interested by AMR, and little by little, the more I learned about AMR, One Health, and infectious diseases, the more I understood its links with climate change, and then I began searching more about climate change and health, and saw the urgency and actually what was happening during COPs. I was also there during COP22, and it filled me with this kind of curiosity and also motivation to begin to advocate, to work on it locally at first. And here I am in the COP27 with the amazing IFMSA delegation. And I believe that health is being brought forward a little bit more lately, and this shows that we can maybe save the planet and go toward planetary health. Thank you.
All right, thank you so much for that, and I hope everyone can excuse our mic passing and me looking throughout the whole room, but we're making do with the logistics that we have. So let me now turn to our last panelist to learn from you, Bea. How did you get introduced to the topic? Was it a specific event, and what made you realize the relevance to your work?
Well, after these amazing perspectives, we know the diagnosis is clear. The climate crisis is killing people all around this planet already today, right? And coming from the global north and the very high-income country, Switzerland, I knew that the way we in Switzerland live and consume is threatening the life of people in other countries, but also affecting the lives of people within Switzerland, right? And we're here in the name of 1.3 million medical students. Just imagine that every single world leader here needs medical care once, and we are here in the voice of the medical students asking them to promote climate action. And my aha moment was really when climate activists from all over Europe came together in Lausanne for the very first meeting of the Fridays for Future in 2019, and I was organizing this conference. And when I saw all these young activists, over 500 of them, coming together, I was like, we need this energy also in the medical sector, in the health sector. We need our voices, and we need to amplify those voices, because they're the ones who are the most affected. And what we can do as aspiring doctors is to point out that they're calling for climate justice to protect the health of every single person on this planet today.
Thank you so much for illustrating that very, very eloquently. Let me now move to another question to dive a bit more deeply into this relationship between climate change and health. I would love to know what you might have seen being a medical student, living in the countries that you live in. What have you seen about climate change and health? And Mariam, let me start with you. What have you seen in Morocco, being a medical student there?
In Morocco, I think that I have seen it all, but this is something that is common with a lot of countries. But I think that the first thing that I saw before becoming a medical doctor and student was with my little sister that had severe asthma, and we had to go so many times into the hospital. And that was the first time that I encountered these consequences. But then afterwards, as a medical student in the emergency room, in the medical yard, we have seen lung cancers from people who are... Sorry, that have never smoked a single cigarette in their lives. We can also see that through the drought and the lack of access to water, healthy water, and the increase of infectious diseases. And we are currently on the watch of infectious diseases that we have been able to fight against, and we are on the watch right now in the epidemiologic surveillance. We are looking out for them because we are threatened by them, and we have to know that they have been taken so many lives in the past, and we are currently afraid to see that again. And also we have to be aware that more than 10,000 people are dying by the consequences of climate change in Morocco yearly, and I can see how this number will decrease in the future. So I'm worried about my health and the health of our future generations in Morocco.
Thank you so much, Mariam, for drawing us that really, really important and I think very realistic picture that makes us realize the importance of what we're doing and why we're talking about what we're talking about today. Juliette, let me turn to you. The Netherlands, a country in a very different part of the world, can you illustrate a bit about the effects of climate change that you might see there?
Yes, so I think there are some relations as well as what Miriam said with Morocco, but I think, for example, in my city, in Rotterdam, the air quality is so bad that for free every day I can smoke 7 cigarettes without smoking. That is the air quality in our streets. Second of all, I come from a very urbanized country, which means that we're very prone to the health effects gotten from heat waves because of the heat island effect. People that live on the streets, poor people, elderly people, they get sick due to the heat waves. And you can see in Rotterdam, in the richer part of my city, the buildings are very well adapted to both heat and air pollution. And when you go down the metro line, we get to buildings in which there is no heat infrastructure and the air pollution is even worse. And just a difference in where you live results in a life difference of 7 years in the Netherlands already. So we see how climate is affecting our health directly in our practice, but we also see that if you live in a different part of the city, you're much more affected by the effects of climate change.
Thank you so much, Juliette, and I hope this makes us all realize that around the world this is not a problem of the future. This is a problem of what we're seeing already right now, and it will just increase. So Ahmed, I would love to hear a bit about what you see around you in Iraq, and I hope that you can illustrate a bit about that for us.
Okay, so to start with, now we have meningococcal infections as endemic in Iraq. That's the first thing. The second, am I audible? Okay. So the second, we don't have health systems resilient to the level that we can host or accept people who are suffering from asthma on weekly basis, because we have 2 to 3 sandstorms per week in summer, and we don't have that resilient system that can face all of that. It is affecting not just the response to those patients, but to other patients as well. That's on a side. On the other side, we don't have the enough support for mental health, because mental health impact is exceeding the acute phase of sandstorms. But when we are facing that amount of temperatures each year, each summer, people are getting even more agitated every year. It is affecting their resilience. It's affecting their adaptation to the climate change and to everyday life issues that they're facing. So, and part of other, newly rising asthmatic cases and tuberculosis as well.
Thank you so much for that. And last but not least, let me turn again to the screen, because Omar, we are in Egypt here today. Can you tell us a bit about the climate change impacts that you see around you in Egypt, in Cairo, where you're studying?
Okay, so despite our minimal contributions to the climate crisis, sadly, change and climate disasters that rise with it. Rising sea levels are a huge threat to the people living in the Nile Delta, which is approximately 10% of the whole population, which is about 10 to 15 million people. It's a huge number. We are also expected to go into very severe water scarcity by 2025. I think we can all agree these are all factors that endanger the health sector. Like we have seen in the COVID-19 crisis, our healthcare systems are not equipped. And judging by the current situation, we need to adapt to face the climate crisis consequences. And hopefully, although I'm terrified of the future and the consequences that may come with it, I hope that we will start taking action, because it's urgent, and we need to properly equip our healthcare systems to face the crisis properly.
Thank you so much, Omar. And that's an excellent introduction to my next question for the panel, which is actually around action. We're not just here to tell you a doom story. We definitely want you to realize the importance, which is what we have hopefully just done and illustrated that. But now let's go to action. Let's see how this story, or these many stories, fuels us in why we're here and what we're doing here. So Bea, you've talked a bit about the impacts in Switzerland and also globally. So can you tell us a bit what action is necessary in your country, in your region?
Well, when we think of a healthy and sustainable future, we need to acknowledge that our planet has boundaries, and there are 9 of them, right? The planetary boundaries. And what we're doing now currently with our economic system is just basing it on infinite growth. We assume that economies can just grow infinitely. And when we as medical professionals hear that, we think of, this sounds like cancer, this cannot be healthy. Our planet has boundaries, as does our body, and we need to shift our economic system within those planetary boundaries, and we can really center our whole society, the way we work around care, because that's what we're all here for, right? We're not here to attend a fancy conference in the desert of Egypt, but we're here because we care. We care about our own health, about the health of others, about the collective, and about the health of our planet. And if we put care at the very center of our policies, and we could call that planetary health in our policies, then we could shift towards a future where well-being within the planetary boundaries is possible. And this would also mean prosperity and security within the planetary boundaries. And those are huge societal shifts and transformations that we need. So, like, we are used to being the emergency team, right? But right now, in this health emergency, everyone is the emergency team, because we don't just need one sector to shift, but we need everyone to shift. And the high-income countries who have caused the biggest amount of pollution and have most contributed to this emergency, they're the ones who now need to take the first aid emergency kit and fill it up with tools. And this means also finances to treat this emergency. So this is my call for Switzerland, being having one of the 5th biggest financial markets in the world, to fill up the first aid emergency kit and take responsibility also to treat the emergency we caused.
Thank you so much, Bea, and I hope that that is widely heard across the halls here in COP and of course here in the room. Very, very important and a big reason why the health community is here. Thank you for illustrating that. Mikola, let me turn to you. Can you tell us a bit what action is needed in Poland, in your region?
I think that for the next years, the basis of all is both education, but education at every single level, for every single age group, for every single social group. Because in order to have, like 2 days ago we had a session about effective communication in climate change. That communication, in whatever shape or form, is there to gain popular support for reforms, popular support for a change in the way we live, in the change our societies are organized. Without the will of the people, we are not going to see any change delivered. My country used to be heavily industrialized. My country used to be very polluted, especially my region of Katowice, which was happy to host COP24. And it was very symbolic because my region of Silesia for many decades was exploited due to coal excavation, before that due to silver excavation. And after that period, when the industry fell in the 1990s, we were left alone. The region was left alone. And many people who migrated to that region for the purposes of having a stable life, feeding their families, found themselves unemployed, underemployed. It is only through making sure that every single person who may lose their job due to lack of due to the cutting off the fossil fuel industry, these people need to feel that they are safe, because if they don't feel safe, they will not agree to any changes, they will not support any changes. They must never feel expendable to feel as if they are expendable to politicians. So I think through education and through taking into account the interests of every single social group, we are able to get that support and get the political will and get things done. So first and foremost, education and raising awareness of the urgency, because everyone can say, in my country, I think 80% of people might say what climate change is, but they don't feel what I said in the first intervention, the urgency of that. And I think that putting health at the center of climate action can make that happen, because health, after all, is very important to people. I think without health, there is nothing.
Thank you so much, Miguel, and very much agree with what you shared with us just now. Let me turn again to the screen. Omar, we would love to hear from you. We've heard two different perspectives now. What do you think is needed to be done in Egypt?
Okay, so first of all, I believe there's an awareness gap that needs to be confronted. A lot of Egyptians still do not know about the true consequences of climate change. Although the fact that we're hosting COP27 is helping and is helping the Egyptian community turn an eye on climate change and climate crisis, I do personally believe there's a true knowledge gap on how the consequences can touch us as members of the Egyptian community. There's a sad consensus that climate change is a Western problem, but factually it is a global crisis and it will touch us all, especially the vulnerable countries. I do believe there needs to be more highlight on waste management. It needs to be more properly monitored, and introduction of the culture of the 3 R's, which is reduce, reuse, and recycle. I do think green initiatives need to be more supported and looked upon by influential stakeholders. And last but not least, I do believe that the backbone of true change is the adaptation and implementation of effective policies that support climate action and seek to build a sustainable future for the Egyptian youth.
Thank you so much, Omar. And I mean, it's great to hear from our perspective that COP27 is helping a bit, but I think you're adding a very strong call to action that much more is needed. So thank you for sharing that. And now, Ahmed, let me turn to you. Can you share a bit on the perspective from Iraq and what needs to be done there?
Okay, so first of all, maybe because I'm a young person, but I think that we need more support for youth. For a simple example, when I got accepted for COPE, they didn't understand the relationship between health and climate change. So I believe that the ambition for working on, like, the first thing that we do is something wide-ranged for all cities, for all the population. It's something too ambitious for the resources that we have. So we can use youth, like, because I don't want to say it's a cheap labor, but it's voluntary work, and we are going to be happy to contribute to the issue. So maybe we can start with youth organizations, we can start with universities. It's going to be a win-win negotiation because students want to contribute, they want to learn more into the experience because they may be in the future going to be in the government itself. So I would say to the resources that we have, work on local projects, then we can reassess the situation and maybe we can go wider.
Thank you so much for that, and I fully agree with your call to action and your call to engage youth, and I hope many of us here in the room agree as well. I think it's not only the fact that youth is the future, let's say. It's not only the fact that we have now here some future doctors sitting us and talking to us. Youth also have a unique perspective. They have a different lived experience than the generation before us, and they can add solutions that other generations might not have and might not see. So in that sense, youth are definitely essential to getting out and combating the climate crisis. So with that, I would love to hear, Mariam, do you have specific actions that need to be done in Morocco?
I think that from my side, I agree with all of the actions that were listed by my colleagues because these are priorities. But what I have witnessed in general during this COP or in my country is the lack of coordination and collaboration. For example, I know that the Ministry of Health and the Ministry of Energy Transition and Sustainable Development are not that much connected. This is just an example. So when we think, for example, about logistics and transportation in my city, we don't have good public transportation systems. So people have to buy cars. So when people have to buy cars, they drive them air pollution. It has an impact on health. So what if we have a campaign of these three ministries or these other three organizations linked with this? So I think that, for example, the Ministry of Education, Higher Education, and the education of children should also be involved. So I think that this collaboration should not be within the government only, but also with organizations, civil society. We need to involve everyone. Like you said, we are not only in the emergency room of our hospital, but we are all kind of emergency saviors of this planet and of the people. Like earlier I was reading that we are Earth, humans are Earth, and if Earth is not healthy, then we cannot be healthy. So we need the involvement and implication and engagement of everyone, and maybe this will help us not only fight climate change but also go around and make sure that we arrive to a world where we leave no one behind through the SDGs, because they are all interlinked. So if you work on health, you work on climate change, and if you work on other subjects and priorities, you will work on the development of this world.
Thank you so much, Mariam, for that. And I know that you've been already managed to talk to some of your delegates here from Morocco, so I hope that your call to action is also very well heard by their ears as well. So Juliette, we've heard lots of perspectives now on what action needs to be done in different countries. Can you add something from the Netherlands?
Yes. I'm not sure if it's from the Netherlands. I think Bea and my countries are very much aligned, so I also stress the historic responsibility that we have. The Netherlands maybe I can say this about the Netherlands. So when we think of the Netherlands, we think of a country with a lot of bicycles and that we're doing an amazing job at climate mitigation. Meanwhile, we're the fourth most polluting country per capita in Europe. So what I would say to most countries, and what's also relevant of something that we can do as a health sector, is to tell the truth. And what we have seen many world leaders doing is making promises over the last couple of days that had already been made. Promises on loss and damages funding, promises on adaptation funding, which already had been made last year. Last year, my Prime Minister promised not to subsidize the fossil fuel industry anymore. And today, still, the Netherlands spends millions of euros on funding fossil fuels, which is damaging to health and climate change. So what I would ask is, one, tell the truth. And for us as health sector, I think that we need to release our political potential, because we are a huge part of our society. We are, my country, my sector pollutes 8% of our carbon footprint. We are 13% of the economy. So if we dare to speak up, if we dare to be bold, and if we dare to ask for political action, I'm sure that steps will follow.
Thank you so much, Juliette, for that and that very strong call to action. If there are health people in the room here, you've heard her. Let's definitely follow that call to action as well and take up our own responsibility and not contribute to this health emergency. So with that, I will go to my next question. So we've talked about action now, and part of why you're here, of course, is to bring that action into being a reality, and to bring that call, the strong call to the decision makers here at COP27. So I would love to hear how COP27 has been for you so far. So for some of you, it's been the first COP that you've been to, including you, Mikola. Can you tell us a bit how it's been for you so far?
Okay, so at first, obviously, such a massive event is a little bit intimidating. You feel like you're not able to follow everything that's happening. So you always need people who attended 2, 3, 4 COPs around you in your delegation or outside of it, people you meet, people you talk to be able to teach you how to prioritize and how to choose things that are important. I think that one of those things, one of those places was and is the WHO Pavilion, where we are able to meet the health community. Also the other NGOs in the health sector are present, and what is very heartening to see is that we are united, we have common message, and when we don't have common message, we meet together and we make that message, because only a united message, united front of the health community can achieve the goal that we all desire. And from year to year, we see more and more of health being implemented and visible and heard in COP. But what needs to happen is we need to double down on it, and we need to make it even more visible this COP and in the next years. So I feel inspired. This event inspires me. I already have some ideas that I will bring to my region, which I will, as I told, was severely impacted. But also for the medical community in my own country, because I saw people who are inspiring, people who have ideas, people who dare to challenge the status quo. And I think that my community, my future community of medical professionals, not yet, a few months away from me, that this community also needs to have at least some people who will drive others towards change.
Thank you very much for that account of how it's been for you so far. Very, very illustrating. So with that, let me turn to you, Bea. Bea, you've interacted with government, youth, civil societies. How has it been for you, and what are you feeling?
Well, I came here because I'm angry and I'm scared as well. I'm very much concerned about the health of our future patients, of everyone, right? And seeing decision makers negotiating climate as if it was something we could negotiate about. And what we're actually negotiating is our only habitat, right? And all of our health. And this can be quite overwhelming to see, because we have the colonizing structures just being reinforced, because the people being most affected are not the ones deciding those things, right? What I also find quite interesting to see here is today's Youth Day, right? This is why we're sitting here as the future voice of all doctors around this planet. And this is not a full room, right? We can ask ourselves, who's missing here, and also whose voices are we missing on this panel? Because not all medical students get the chance to sit here, and not all of the ones who are most affected and also speak up very loudly have the chance and possibility to speak up here at the COP. And what we know as health professionals, we know that good healthcare needs time, and if we talk to our patient, we need empathy, right? And I don't think that we see a lot of empathy happening in those negotiations. The way we communicate, the way this whole conference is being designed, is not at all a way that we can find sustainable solutions, because it just reinforces the status quo. So I would wish a lot more empathy. And as we see in the medical sector, when we're super stressed, we just don't have time, and we don't have time to listen to our patient empathetically. We're just putting plasters on wounds, like, oh, everything is going wrong with you, and you have like a scar, and then there's like a whole polytrauma, but I just put a plaster on it. It looks good from the outside, but I don't take the time to find the source of the problem. And for this I need really time, and I need the whole team, because also we as doctors, we cannot work alone. We need the nurses, we need the whole technicians, we need people cleaning in the hospital, we need everyone. So what I would wish for so much is that we create those spaces here to give voice to everyone, especially the ones most affected, and to listen to each other with empathy, and then come up with solutions to create this future we are also very much longing for.
Thank you so much for that, Bea, and thank you for illustrating all of this, also connecting it to the experience that we have in the hospital as doctors. And I would even say all of the negotiators here should spend a day in the hospital and experience that themselves. So with that, let me turn to you, Juliette. Juliette, this is your third time at COP. What is your experience at this COP? You've been also engaging and strategizing on how to have health in here. Luckily, you managed to get the Prime Minister in this room for a whole 2 minutes, which was great, short but great. Can you tell us a bit about your experience at this COP?
I feel like Bea. I too am scared, and I feel that we have the responsibility to act upon that. Sometimes things can be rationally hopeless, but that doesn't mean that we do not need to try. Because if we do not, because we have everything to win. Science is on our side, justice is on our side, so we have to be as loud and clear as possible. And that is also why I and you together, we have been knocking on country doors to try and get that story heard, the health argument heard, the ambitious policies that we demand heard. And what I've learned in all these COPs is that very often you get a no, but that we have to have the courage to go on and on and on, and sometimes a door opens. Sometimes there's a country that may listen to you. On a national level, medical students and young doctors have been able to get change into our policies, and that gives me hope. And when I see what's happening in civil society, that is what is giving me hope. When I see young people around the world demanding here for to stop fossil fuel subsidies, when I see indigenous communities coming all their way here and spending a lot of money to come here and to have their voices heard, that gives me hope. And when I look at many places around the world where people revolt and risk their life for freedom, for safety, for health, that gives me hope. So I hope to remain inspired and to keep that inspiration, to share that inspiration. And it's sometimes difficult to keep that at COP, but it's still important for us to be there and to continue to make the change, even if rationally it is difficult to see that it's going to happen in the pace that it's happening.
Thank you so much, Juliette. And I really appreciate how you're underlining the hope that you still have. And I hope that those in the room with us can share that hope. And those watching online, there might be students there as well. I hope you also have that hope and maybe even get inspired by our amazing panelists today, which I definitely am getting inspired by you. So with that, let me turn to you, Mariam. You have talked to many, many country representatives here as well. Can you talk to us a bit? How is your experience here at COP27?
Me, from my experience, I was present in the COP22, and for me it was all rainbows and butterflies, like we are going to be saved and everything is going in this perfect way. But arriving here and looking it up, I'm seeing that countries have been making some promises. They have not been faithful to their promises, and yet they are still here, they are still negotiating, like you said, they are still denying some realities, they are still denying, for example, there are some countries that when you approach them, they say, oh, you speak about health, but this is not important, like, this is not our priority, this is not relevant. Okay, I don't think that this is something interesting, but on the other hand, there are some countries that are surprised and that are excited that you came to them because of health, and they are excited to actually do something about it, and as they are excited to do more, they have been doing a lot. And also something that I want to share with you is that I'm seeing so many young people, so like youth, like minorities, and they are really all hopeful, and I'm just hoping that they will be meeting their expectations and their demands. I don't want all these people and all this money that people invested in to come here to go to waste. I really hope that countries, that NGOs, that even private sector, or like we said earlier, the whole world goes toward these hopes and the initiatives and the work that all these people do. Even here in WHO, it's the second time I believe that they have a pavilion, so we are working through developments and we need to keep hope and to keep fighting. And yeah, so this COP is giving me hopes for the future also.
Thank you so much for that. And whilst you were speaking, I got a memory of what Jen from the Global Climate and Health Alliance was telling us a few days earlier. She said the most frustrating thing that those in power can tell the young people is, you're going to change the world, you're going to do this. And I'm hearing a lot of hope, I'm hearing a lot of ideas, solutions, calls to action, but we cannot do this without those that are in the position of power to make the actual decisions. So that very much connected to what you were saying as well, and thank you for highlighting that we are here with the solutions, and the negotiators, those that are making the decisions, need to take us seriously so that they also can be implemented, of course, with our full support and help. So with that, Omar, I would love to hear your perspective on after COP27, after this event is over, which is a major event here for the world and also definitely for Egypt. What do you hope to implement to ensure that we're continuing to combat the climate crisis?
Okay, so I believe we should continue pushing for societal change, and we should all seek to become effective members of our community, not only calling out stakeholders, but also becoming vessels of change, raising awareness in our surroundings, and always seeking to develop initiatives that support climate action. I do believe that if you want to see a change happen, you need to look for ways to become that change yourself. You can influence yourself and influence others around you. I think I will also continue to develop climate change initiatives in my NMO as an effective member of the IFMSA community. And as a climate change and health advocate, I will try as much as possible to let people know that not just because COP27 is over means that our fight and our race against time is over. Even after it's over, the challenges are still going to be there. They're still ongoing now. We're feeling the effects now, and we continue to feel it afterwards. And it's only getting worse. So we need to be quick on our actions, and we need to continue our development of plans and looking for ways to meet them. I will also continue, which I believe is also one of the important pillars of the fight, is continue to do research on your own, always seeking to find out more about how you can proactively participate and learn more about the knowledge disseminated worldwide, because there's always innovative solutions that are being brought up by people from all around the world. And I'm proud to say that most of them come from youth-led initiatives. Because I believe these are the people looking for the future, because it is our future and it is our concerns. But like you said, we do need the help of the influential stakeholders and the policymakers. And also I think there is an important motto to keep in mind, which is the IFMSA motto: we need to continue thinking globally while acting locally. And we need to emphasize on that, because it is extremely important to promote a culture of global collaboration and cooperation, which is hopefully how we will resolve the climate disaster.
Thank you so much, Omar, and it's great to hear that you have this willingness to act and continue to harness the momentum that COP27 is also giving, specifically in Egypt. And then, Juliette, let me turn to you. I know that you're working on a lot in the Netherlands. Can you tell us a bit about that, and also how that will continue and maybe change after COP27?
Yes, thank you so much. I'm working on the national level a lot as well, because the good and bad news of COP is that change doesn't happen here. It happens where you are and where you can start, and in your own communities. And in the end, influencing your government to influence decisions here is super powerful. So I started with a youth-led initiative from the National IFMSA organization that focuses on three things. First, health in all policies and health in all climate policies. Second, planetary health in all medical curricula, and thirdly, to get our health system towards net zero. And for example, on the second point, we got there. All Dutch medical faculties have at least some courses on climate and health, so that is a youth-led initiative that has become a success, and they might develop further courses in each and every area of medicine, so that the planetary health is integrated in the entire medical curriculum. On the political side, we have been able to give advice to our national government. We are trying to get health in the national climate strategy, and we are also trying to ensure that health professionals might be part of the climate authority checking Dutch health policies. We have been reaching out to our ministers, but also to parliament, and we also try to collaborate with what Iris also said, with different generations, because that works best. I think what we are trying to prove as well is that youth are, we do not need to claim our space in a certain sense, because we are already making changes in our own communities. We are doing the jobs that others should be doing as well, and we are trying to contribute to our societies by making that change. So I think we can learn a lot from each other. I think we have proven to be bold, and I hope that we can continue to do that, to strengthen the health and climate movement in our own communities, and to see each other next year, us or our colleagues, to have a stronger COP.
Thank you so much, Juliette, and very inspiring to hear also what has been successful in the Netherlands. And I know that, for example, Anouk here in the room with us has contributed to that, and many other medical students and youth from the Netherlands as well. So that's very inspiring to hear, and also what the next steps will be. So Ahmed, I'm looking forward to hear from you. Once you get back to Iraq, what's going to happen?
Okay, so on the technical level, we had many initiatives to work on the climate change, but again, the mentorship. We needed mentorship from people who are oriented about the climate change. We can do lots of projects, lots of youth-led projects, but in the end, if you're not mentored, if you're not oriented to the proper direction to go, it's going to be a wasted effort. So on the technical side, it is important to spread the knowledge that we had on the level of maybe other organizations, Okay, maybe other organizations like the Youth Coalition that we have in Iraq. That's on the technical side. On the other side, we have what we learned from the external affairs, from the policy writing, and all of these skills are used as methodologies to implement not only climate change, but any advocacy that we can use or we might need as youth.
Great, wonderful. That's really, really good to hear, and I think you're very wise in saying that. So let me turn to you, Nikolai. What are you taking away to Poland?
I think the point we need to make here is that we as medical youth are put in a very special but also difficult situation, because our main goal for the year is now, for the, some say the best years of life, should be learning, studying, sometimes having fun. But the situation of with climate change and with many other issues and crises put us in a position where we need to advocate not only for our own profession, but also for the entire health community. Somehow we, with influencing our own community, the health community, as well as the general population, we now are fighting to fill the gap that was left behind by the older generations that weren't always up to the challenge that was present at the time. So, but I think that our community of medical students took that responsibility well, and we are living up to it. We are engaging, we are delivering, we are creating policy, not only creating policy on paper, but actually we are taking that message that we create internationally to our own countries. We are adapting it, and we are delivering the knowledge to people who might not get it otherwise. So I think what I'm taking personally, what will be my mission, will be continuing what I've done already. That will be the first thing. So trying to get climate change and health into the, not only the medical school curriculum, but also the general curriculum, so that every single person, every single student is able to learn fully about that in intersection. The other thing would be engaging within the community, something I mentioned already in my previous intervention, engaging with the medical community, which needs to be unapologetic about going to the governments, going to stakeholders and saying, there are health needs, and there will be further health needs that will be unmet due to climate change directly, but also indirectly. And we will need funding, we will need education, and also we will need to make it not only about ourselves, not only about those, about a region, about a country, but we will need to make climate change and health global. And that's something that we will guide my actions in the coming months and years. And hopefully I will be there next year at next COP.
Great, that's really, really amazing to hear as well. So with that, let me turn to you, Mariam. I would love to hear, what are you taking back to Morocco? Has the COP inspired you to do something else, something additional, and what are you already doing?
So before coming here, I had this ambition to include climate change in the health curriculum, because I believe that we are not educated, like we are educated to take someone, treat him or her or them, and then move on with our lives. But are we aware that there is public health, there is something called global health? Are we aware about economical economics and health? So this was my plan, and I was already discussing with some of my teachers in my university. But when I come back, now that we have met with the ministry, with some other youth Moroccans, we want to create a youth council within the Ministry of Energy Transition and Sustainable Development. So I will try to follow up on that, and to make sure that we health and all the different sectors are represented, because I believe that this is something major, important, and maybe it should happen not only in this ministry, but maybe in other countries. That could be interesting. Also, I think that I really want to follow up on the future national plan of climate change and health in my country, and to make sure that we have pretty good research and data before moving on with it, and to make sure that it's applied, and maybe to be it is not my position, but maybe to help with the communication between the Ministry of Health and the Ministry of Energy Transition, because I think that if they join hands, because I think that they both don't have good funding, maybe they can collaborate and do some magic together. So I'm really motivated to do a lot of advocacy and also to raise awareness within my community.
Super great to hear about those initiatives, including the Youth Council, and I believe that you can make that happen, what you mentioned at the end. I very much believe that. So Bea, let me turn to you. What have you been involved in, and what are the next steps after COP27?
In Germany and in Switzerland, we have a movement of health professionals and health students, which is called Health for Future. And when talking to people in decision-making power here at COP, what they often told me was, well, we need the people on the streets. We need the pressure from civil society so that things can move. And what we observe often is a ping pong, right? Like politicians are ping-ponging the ball to the economy, and then the economy is doing it again to the politicians, and then, but we just need civil society again, so it's just ping-ponging the responsibility around. Again, this is a health emergency. We don't have time to just ping-pong and just play again here. We need everyone. And there are good ways of involving everyone and to make different voices heard. For example, citizens' assemblies. This is a new format where governments can try to consult civil society and really throughout all social levels have everyone around the table and inform them and hear their voices and form their policies by them. So I invite governments, and especially the Swiss government also, because everyone is praising the Swiss democracy, right? And just a quick reminder, in Switzerland, only last year we celebrated the 50 years anniversary of women having the right to vote. And this is one of the best democracies in the world, right? And nobody invited the women finally like, yeah, now you can vote, because we realized our policy is much better when everyone can vote. But they were allowed, and they demanded and insisted on their right to vote. And I think now's again the time to disrupt. We don't have the time for more blah, blah, blah. We need to disrupt, we need to be loud, and we really need to rethink the ways we come together. So what we are really trying is to include such youth consultation processes in our negotiations and in the way Switzerland is doing its politics. Because otherwise they just continue to come with an empty first aid kit to this emergency. And we really want to fill this up, because this is our future they're negotiating.
Thank you so much for sharing that, and that is great to hear, and I think we'll all stay tuned to see how all of that, what you just all mentioned, will come to fruition after COP27. So thank you for sharing that. With that, I would like to turn to our audience. If you have any questions, I would love to hear from you to make sure to engage you in this conversation as well. So feel free to raise your hand, and once I give you the mic, you can stand up and ask your question. So I will look around to see if there's any.
Andy Hoffman, University of Pennsylvania. I am absolutely enamored with what you're saying. Thank you for speaking out. I'm a veterinarian. I head a veterinary school. And I think I'm one of 3 veterinary professionals here. So that's something we can talk about next year. Questions for multiple of you as medical professionals. How did you get from the ground up curriculum or educational opportunities for medical students started? How did you get that started? If you don't mind, I'm sorry if you repeat it. If it's repeated, then don't bother, because I haven't been here the whole time. But I'm intrigued. You said you have planetary health and climate health infused in the curriculum. How did you get that started?
Thank you so much. And I think I can pass this one to Juliette.
That's a very good question, and it took a lot of advocacy, I guess. And I think the key to success is having different people knocking on the same door. So, for example, it started in my university, also with Anouk, who's in the room with me. I got into, I demanded a public health professor to ask this to the dean. I took a position in my student council, at which I knew at the end of the year I could have a speech in front of the dean. So I took a year of my life to just get that speech there, and I said that this is the future health crisis, and we need to implement this in our medical curriculum. And then Iris had already created some education in Amsterdam, so I said to the, I asked someone else to point him out, look, Amsterdam is taking this opportunity, and we're lagging behind. So in the end, from different sides, the board of directors of my university, they felt some pressure. They got introduced to the topic, and I tried to find allies within my university. One of the professors, he gave a course on Public Health 101, and he said, okay, your story is good, I can give you 1 hour, and that's how we got it started. And that hour was a success, and from that point we got to other people, and they are giving up a little bit of their time. And I think also what we're trying to say is, in the end, it is not a big revolution, because planetary health is health. So whatever specialty you are teaching, you can speak 5 minutes about either the effects of the health system on the climate or planetary health crisis, and vice versa. So this is also the story that we have been telling. It's not a new topic, it's a topic that has always been there, and the only thing that we need to point out is deepen it and show like what relation does our health have towards the planet, and that's already there.
Thank you so much, Juliette, for that answer, and thank you once again for the question. Anyone else in the room that has a question for our panel?
So I was so impressed by this panel. And I've learned a couple of things I'm going to implement, particularly Ministry of Health and Energy. Lots of things I think we can do there. Thank you. So my question is also comment and feeling just for you in terms of giving up your youth, your playtime, and all of the rest to take on what should have happened in terms of my generation before. There are still, and I hope you've identified in your own worlds, people who are older with agency who care. So the question is, are you using medical associations within your own countries to try and make an ask, but also to get the buy-in of older, better planted people to come behind you for specific changes in your countries? Thank you.
Thank you so much, Fazia, for that question. I think I see lots of people interested to answer. I will start with Dea, and then we'll move to the others.
Thank you for that important question. What we did in Switzerland 2 years ago is that we said, okay, our National Medical Association, they don't mention climate change with a single word. They don't work on this topic, and they don't advocate on this topic. Even though medical professionals during the COVID pandemic were omnipresent. So this is our time to speak up about the complex interconnectedness of health with our environment. And everyone was telling me, oh, you dreamer, forget it, you cannot just go to the Swiss Medical Chamber. It's over 90% white men, old men, they're very conservative, they will not accept this. And what we did is say, but this is not a question of dreaming, it's a question of life or death. So we just went forward and we handed in a motion for them to work on this. And luckily, even the Swiss Medical Association realized this is a health emergency, and they acknowledged our motion. So we spent the past 2 years working on the first ever planetary health strategy in Switzerland on climate change and health, which was just adopted in October 2021, which is now really kicking off a whole procedure also on a ministerial level and with different stakeholders. So it really, like it's hard work, right? Because it's very like institutional politics. But youth voices really can make a change, and we can, and also just waiting for medical students to address this topic is not an option. We need all the voices to point out that we need to work on this topic now, right? And include medical students and youth from the very beginning in it. If we feel, okay, we should, like if I'm working in my university or in a hospital and I would like it to change, but maybe there's no organized youth working group and they're not protesting outside, but I would really love that there to be like loud medical students demanding this. I can still contact them and I can involve youth from the very beginning in the way we're doing our strategies and designing our policies and the way we're working towards sustainable healthcare and health and all policies approach. Yeah, so I invite you all to go home and think about who do you know who has a little bit more power than you in your system, because you all here have a very big ecosystem altogether. Who has a bit more power than I have? And can I nudge this person to include youth voices and create new policy, like processes and spaces where we listen to each other with empathy and come up with new solutions?
Madam, when I spoke of like working at our age on those old social causes, I might have sounded a little bit nostalgic, but I feel like we are not really giving up our youth. We are rethinking it. We are rethinking this period in our lives. When I joined my local organization, I was a simple student, and I would never have imagined that within 2 years I would go on to be president at COP. Because like 4 years ago, obviously I was already like not a bit knowledgeable about climate change, but 4 years ago, COP24 happened in my city, in Katowice. And memories of most medical students from that period were just, okay, we can't go anywhere in the city is closed. And within 4 years, I am president at COP, and I'm able to advocate for those things that will be important to me, to other medical professionals. Also, my great-grandparents who lived and their ancestors who lived in that environmentally destructive region, who bear the brunt of the fossil fuel industry by working in it, because like my great-grandfathers, most of them were simple miners. They would never have imagined, then my grandparents, parents who lived under communism, closed from the entire world, they would never have imagined that their blood would ultimately end up in the international community, working with people from so many countries that I cannot even count. This is not giving up our youth. This is rethinking it, and it's giving it a whole new dimension. And I think that this new generation that's coming, I don't know if I'm Generation Z. I'm like between the generations. But the generation who's coming, we see them. They're active, they're present, and they want to be heard, and they do not want to be infantilized. They want to be made, they want to be given seat at the table, and they want to be heard as valid members of the community. Because as we've heard in the other pavilion, 1.8 billion people. We are a lot.
Yes, thank you so much for that. And we're running out of time, so Mariam, I would invite you to talk to Fasia right after, because I do want to hear one more time from Omar as well as we're wrapping up this session. Omar, could you give our audience just one final message, being a student from here, from Egypt?
Okay, so I think a final message for me which would be to not lose hope. Climate disaster, we're educating ourselves. We're presented with a lot of negative facts and a lot of negative numbers that may let us see the future in a gloomy way. But we should not concede to that. We should always try to reflect on ourselves and try to take that initiative and take those feelings and use it for our own good and push ourselves in a good way so we can effectively contribute to this and not only stand back and watch as the world dies around us.
Thank you so much, Omar. And with that, I would like to wrap up this session. I would like to thank the International Federation of Medical Students Associations for organizing this session and making sure that we can hear the perspectives of medical students at COP27, for the WHO and everyone involved with the Pavilion for hosting us, for all of you for listening to this conversation and engaging with us. And of course, a final big thank you to our incredible panelists that have been here with us today. I think there's a lot more conversation to be done. They will be around, so make sure to talk to them as well after if you have any more questions or anything you would like to discuss. And with that, thank you very much.
Welcome, everyone. Thank you so much for being here today. I want to welcome the audience and the distinguished panelists to this side event co-organized by Stanford University and the World Health Organization on wildfires, planetary, and public health solutions. I also want to thank our IT specialists and Pippa and Milan and Antonis for all of their work today to be able to provide the World Health Organization Pavilion a great day of side events. Wildfires are increasing, and they're increasing the risk to the population health across the globe. Many of the commitments that governments make here at COP27 are critical to how this risk is going to impact our lives, health, and well-being in the future. This event will aim to explore recent evidence on wildland fires and health in the context of climate change and what is needed from a public health perspective. I want to introduce my distinguished guests. 2 of them are here and 2 of them are on Zoom. Dr. Geladio Cisse is a professor. He's a research professor and head of the Ecosystem Health Sciences Unit at the Swiss Tropical and Public Health Institute and IPCC lead author. Professor Chris Field is a professor of interdisciplinary environmental studies and director of the Woods Institute for the Environment at Stanford University. Dr. Dorota Jarosinska will be joining us from Zoom, and she is a program manager for living and working environments at the WHO European Center for Environment and Health. Mr. Juan Castillo is an advisor on air quality and health, climate change, and environmental determinants of health unit at the Pan American Health Organization. And my name is Dr. Kari Nato. I'm also a professor at Stanford University and have the honor of joining my colleagues today to be able to teach you and educate and receive your questions about wildfires and climate change. So first, I'd like to present some background on wildland fires. And you'll see here some slides that I've prepared for you today. And what I want you to see is this video, and that's a video of someone's airway, inside their airway, after having breathed in wildfire smoke, and the wildfire was 200 kilometers away. That is a long way away to be able to breathe in that type of smoke and particulate matter. But what I want to point out is that if you see this world map, you can see that wildfire smoke and wildfires occur throughout the world. In fact, a lot of wildfire smoke circumnavigates the world. In any one region where it occurred, it can occur around the world very quickly. For example, in Australia, 3 days later, the other side of Australia saw the same smoke. But I also want to point out the map in the background. This was actually modeled in 2013. 9 years later, we're actually seeing their map come into reality. And so you're seeing all of the fires that they predicted back in 2013 come into play with all of the different fires around the world that are now increasing in intensity. In the next slide. Before we begin and before my colleagues give their talks, I want to explain some definitions. When we talk about wildfires, they're defined as any fire occurring in wildland regardless of ignition. And importantly, when we describe wildland, it's usually for vegetated and non-vegetated lands in essentially in areas without a lot of human interaction. However, nowadays, there's more proximity of humans to the wildland interface, and we call that the wildland-urban interface. It's a zone of transition where human activity is being developed, and we know that those human settlements are at higher risk for catastrophic wildfire. For example, the 2 photos that I have here show you a city in which the wildfire is juxtaposed to the city, and another development where the wildfire is almost containing those homes. Now, what about the degree of the wildfire threat? That pertains to 3 ecological factors as well as human factors and vulnerability factors. The ecological factors are defined by force, but that can include climate change, which is increasing. Human factors that define the wildfire threat oftentimes result in ignition caused by humans themselves at the wildland-urban interface. 85% of those fires are caused by humans. The vulnerability factors include environmental determinants of health, social determinants of health, and environmental justice issues and access to health. Ecological factors include climate and climate change, seasonal variations, as well as heat waves and geographical features. Now, I know we're here at COP27 and we've talked a lot about mitigation and adaptation to climate change, but it's slightly different when we're talking about the concept of wildfires. When we think about mitigation to wildfires, that oftentimes means making defensible spaces, using prescribed burns, which you'll hear from my colleagues. And when we talk about adaptation to wildland fires, oftentimes that means fire-adapted construction or allowing people to have better evacuation plans in their community, or in fact giving people filters for their homes or filters for their faces to help with mass and reduce particulate matter exposure. In the next slide. So wildfires are burning more acres because of climate change and other factors, and unfortunately this is increasing in intensity. You're seeing here the IPCC report as well as UNEP report and a New England Journal article showing that if we don't pay heed, if we don't work towards the consistent measures of the Paris Agreement, we will increase the risks of wildland fires precipitously, and you can see that in the maps here. In the next slide. Why is this so important to health? Well, unfortunately, wildfire smoke in the human body have both short-term and long-term effects in terms of health. And what you're seeing here is that there's increased risks in both during a wildfire as well as after a wildfire, because the wildfire smoke goes to the ground, it can go into the water supply, and it also increases toxicity. And the wildfire oftentimes has at least 200 different toxins in it, and you can see that exposed here and the different diseases that can occur. The next slide. I want to make sure that all of you know that when we measure wildfire pollution, oftentimes it's in the pollution definitions that we use for air pollution, which is a silent killer. It has associated with 7 million deaths, and we look at the WHO air quality guidelines published in 2021 as our means to know what are the thresholds by which something is safe or not. But unfortunately, wildfire smoke is now unraveling decades of air quality guidelines that we were putting in place, for example, in California, and now we're seeing wildfire smoke change that balance. Next slide. So I want to point out that there are at-risk groups for wildfire smoke. They include pregnant women as well as children, those with lung conditions, those who are underserved, and all of this plays into how we can allow resources to be developed to help public health populations. And importantly, we're looking at a lot of public health actions which include community-based participation and include human rights-based sustainability guidelines for the United Nations. In the next slide. I'd like to leave you with some hope and promise, and that is the message that along with the WHO, the World Meteorological Association, the Pan American Health Organization, as well as experts around the world, and Stanford University, we are in the process of developing 2 reports on wildland fires and public health, and hopefully they will be available later on this year. We're publishing a scoping review and a document for public health officials and public officials. So I'll stop there and thank you for your attention. So I'm also the moderator, and I'd like to ask Dr. Sase a question. Professor Sase, as a leading author of the recent IPCC AR6 report, can you describe for us the current evidence on how climate change is affecting the risk of wildfires around the globe? And how are health and well-being at risk from these compounding extreme hazards? And what is the IPCC calling on the international community to do?
I don't know if I should stand up and be better in front of the screen so that I can follow from here. Thank you for inviting me to contribute to this. And I'm going to present some synthesized highlights on wildfires and health from IPCC AR6. Next slide, please. So recall that IPCC has 3 working groups Working Group 1 on the physical science basis, Working Group 2 on impacts, adaptation and vulnerability, and the Working Group 3 on mitigation of climate change. I'm taking the highlights from the report of the Working Group 2. Next slide. The Working Group 2 is composed of, as you can see, 270 lead authors from 67 countries, and we have been supported for many more co-authors. Next, press button, so it will show. Next, please. We have 18 chapters on the report from Working Group 2 with a summary for policymakers. But what is important? Next, press. The SPM has been released in February, and since then we are in outreach activities in highlighting several components of it. Next. So here I'm focusing on wildfires and health highlights from Working Group 2. I will talk about observed impacts, projected risks, and range of responses that we have. Next slide. From the Working Group 2, I can say that all the other groups are mentioning wildfires somehow, but it's more prominent in the Working Group 2 work. What we are saying from Working Group 2 is that wildfires are more and more observed all around the world, but in some regions they are more described than the others. There are particularly 3 regions. In their reports, you can find very much focus on wildfires. These are the Australasia region, chapter 11, the Europe region, chapter 13, and the North America, chapter 14. They have even special box or cross-chapter boxes on wildfires. And then the chapter 7, which is about health, well-being, and changing structure of communities, the one where I was mostly coordinating lead author, we also mentioned several times wildfires when it comes to risks from climate change on respiratory diseases, because I will show some highlights later. Next slide. Very often in all these boxes or these chapters, they highlight the combination of drought, of warming, of wind, so extreme combinations that are leading to wildfires, and they are increasing. So they observed in all these regions deaths and injuries to people and animals, and damages to ecosystems, property, agriculture, water supply, infrastructures. And they observed also some impacts on mental health. And with regard to health, it's mentioned that climate change has increased the number and severity of wildfires, and this, from the smoke from wildfires, will increase respiratory hospital admissions. This is evidently highlighted in all the reports. Now, going more specifically report by report. Next slide. In Australasia, there is a mention of 2009-2020 Southeast Australia wildfires, where a lot of death and casualties have been reported. In Europe, let's go to the next slide. In Europe, it's particularly in West and South Europe that we have a report on increased wildfires throughout Europe. And there have been some extreme wildfires in recent years, 2017 in Portugal, in Sweden, and in Southern Europe, even recently in 2021. And the third region highlighted here will be North America, where the areas of wildfires are reported as increasing in Western USA and in Canada, and that this is really a huge problem in many parts of these regions. And as vulnerable groups or vulnerable regions, the reports highlighted Indigenous people and the wildlife and urban interfaces that are more and more problematic. And also in this region, they are emphasizing the risk of respiratory admission and respiratory distresses. Next. For the projected risks,
In Australasia, there is a very strong projection in the horizon 2060-2080 about fire weather condition increasing, particularly in Southeast Australia, and the greater severity and frequency of these, particularly in urban and peri-urban contexts. Next. For Europe, you have more uncertain projections, but they did a number of studies regarding estimations at different degrees of warming, and they see a risk of increase across all regions of Europe. Next. In North America, there are some projections, and hot and dry condition will be increasing, and this will increase the risk of wildfires, and also the fact that in the projection there is more risk of close wildfires to human settlements, and there are more and more projected risk on admissions in hospitals due to respiratory diseases linked to wildfires. And here again, the projections are showing some risks for indigenous peoples, and in northern Canada in particular. Next, now, my last slide. This is now the range of solutions that are coming across all these reports. The first is a recommendation to put in place fire management plans and programs everywhere from regional to local, to develop national disaster risk frameworks, as in Australia, to develop national support systems and also all the associated elements of it, increase capacity to extinguish wildfires, and there is the call of regional and international collaboration. We see it in Europe, where countries are helping each other. Avoiding and reducing forest degradation, and there is some good examples of how indigenous people could be involved in it. Providing air quality information to the public with regard to health, and enhancing the collaboration between health sector and fire suppression agencies. And last but not least, creating agencies that are really supporting resilience and recovery, including health systems in the firefight on what do you do against that. So thank you very much for listening.
Thank you so much, Professor Sise. I'd like to ask a question to Mr. Juan Castillo, who's joining us from Zoom. And I think thank you, Mr. Castillo, for joining us today. Over the past few decades, WHO has been working with the health sector to protect populations from the health impacts of air pollution and climate change and to build resilient health systems. What role does the WHO play in addressing the intensifying risk of wildfires to public health?
Thank you for that question, and thank you for such a very interesting panel. So we are aware that air pollution is one of the largest environmental health risks that is causing nearly 7 million deaths each year. So from WHO, we actively work to identify ways to reduce that burden of disease attributable to air pollution, and that includes understanding the causes and effects of air pollution. Wildfires have been identified as one of the contributors to air pollution, greenhouse gases, and short-lived climate pollutants. So if we want to reduce the burden of disease, we definitely need to be looking at addressing the wildfire risk. It is worth mentioning that wildfire represent an air pollution and an air pollution health risk, but also a human security risk. Smoke pollution from wildfires is associated with increased mortality, cardiac events, a range of respiratory effects, including asthma attacks. But also, these fires can evolve into a more complex emergency that potentially require voluntary or planned evacuations, and vulnerable population, as it was explained before, includes like the most vulnerable population and also local indigenous and tribal communities. So from WHO, we take this issue seriously. We and our work also include like global activities on air quality and climate change. That includes, of course, the air quality guidelines that Dr. Dorota will talk about that in a few minutes. But also we respond to this call from the agencies to have like an integrated response and articulate response. So we have a WHO, WMO Joint Office on Health and Climate Change. WHO also has put together a group of experts on the group of expert group advisory team that is helping us to understand the health impact of air pollution, the methods for assess the exposure and co-benefits, understand emerging air pollution issues and interventions to address those issues. Of course, this work that is being done on updating the wildfire guides is very fundamental, and it is a request that has been coming from the countries during the last decade, and so we are glad that we are working on that. Also, we want to work on building early warning system. We want to stop being reacting, but also increasing the capacities of our countries and of our ministries of health and environment to have rapid response that are able to monitor this risk. And that includes, of course, expanding the knowledge that we have about air pollution, air quality monitoring. WHO lists the air quality databases that include more than 7,000 measurements for more than 7,000 cities, but in areas where they are more vulnerable to wildfires, usually we have less air quality monitoring capacity. So we need to increase those capacities as well in order to inform like this early warning system, emergency preparedness, and also when we are doing those, is working with increasing the capacities of health professionals. Currently, WHO is leading the preparation of a training material focus on the health sector professional in order for us to work together in understanding what will be the health recommendations from the primary care perspective. So all this is part of the work that we are doing. I am also part of the Pan American Health Organization, that is the regional office for the Americas of the WHO, and we are also very vulnerable in the region to the wildfire risk, and that is increasement with climate change issues. So we have the leadership of countries like Brazil and Colombia that they are putting together task force between the Ministries of Health, Ministry of Environment, and the emergency departments in order to put together like integrated responses. We are supporting that work with like this overview, this large vision to strengthen local capacities on air quality management and public health protection, and support the countries to respond to emergency to wildfires. So this is part of what we are doing. I'm sure that we can talk a little bit more during the panel, but thank you so much for your question.
Thank you, Mr. Castillo. And I'd like to introduce our next expert, Dr. Dorota Jarosinska, and she will be joining us by Zoom. Dr. Jarosinska, can you describe for us the health implications of wildfires in the European region? What are some key initiatives that aim to protect citizens and build health system resilience to wildfire risk and poor air quality? What still needs to be done? Thank you.
Thanks a lot, Carrie, and hello to everyone. Let me start from introducing already mentioned air quality guidelines, and I would like to ask for the next slide, because this is also an instrument that's very important also in the context of the discussion of wildfires and health. So the guidelines are a very powerful instrument because it's a set of robust recommendations giving a list of levels of air quality for main health-relevant air pollutants that are necessary to be achieved to protect public health globally. And you should see it on the slide, and these are these numbers marked in green. And the guideline levels have been developed through a very rigorous process, both for long and short-term exposure and in relation to specific health outcomes. While in the process of developing air quality guidelines, specific sources of air pollution were not discussed, sources like wildfire, but I would like to turn your attention to the fact that these short-term air quality guidelines are relevant and applicable for the situations like wildfires. And these are expressed as these 24 hours or 8-hour averages. And I would like to explain it a little bit, because air quality guidelines serve also as the basis for setting legislation standards. This is mainly based on these long-term guidelines. But short-term guidelines are very important as a risk communication tool and also for short-term emission controls in case of episodes of air pollution like those related to wildfires. That's of particular relevance for susceptible populations because there is a big body of evidence showing that people who are susceptible because of the health conditions, people with asthma, cardiovascular conditions, or other respiratory conditions, they may experience much more severe effects when exposed to these even transient increases in air pollution. So while not designed particularly for wildfires, short-term guidelines are applicable as an instrument for monitoring in case of wildfires. But air quality guidelines, and I would like to ask the next slide, is not only a key tool to set policies, actions, interventions to improve air quality, but this is also a powerful instrument of climate action, because increasingly the recognition of the health benefits of climate change mitigation, one could say mediated by improvements in air quality, they are increasingly recognized. When we look at the key drivers of climate change, sources of emission of greenhouse gases, these are also mainly sources of air pollution, combustion of solid fuels, fossil fuels, in energy generation, household energy, transport, but also agricultural practices, waste management systems. These are sources of both greenhouse gas emissions and air pollution. And there are multiple health benefits of targeting those in an integrated manner. This sounds maybe now obvious, but it's not the practice. It is still an ongoing work to bring together different professional communities and to enhance this intersectoriality and transdisciplinarity in discussions, understanding, and actions. Juan mentioned this global, for example, this global advisory group on air pollution and health. And it's great to see that there is a dedicated expert working group on air pollution, climate change, and health. And while this refers to the, I would say, big picture agenda of air pollution, climate change, and health, I think this is also very much relevant when we discuss wildfire and health, which are at the interface of air quality and health agenda, climate change and health agenda, emergency agenda. And this truly interdisciplinary and transdisciplinary work is crucial. In the opening words, Carrie, we heard, for example, about what is understood by mitigation adaptation in relation to wildfires in health versus this what we consider in climate change and health. So this is really crucial to better understand and then to design more effective responses and mitigation measures. Next slide, please. It has already been mentioned in the opening words how big research is already being done. And I just would like to mention that the main health outcomes studied when investigating associations between exposure to air pollution related to wildfires and health outcomes, these are the group of health conditions similar to those studied in other air pollution and health studies. So it's total mortality, mortality due to cardiovascular diseases, respiratory diseases, morbidity, endpoints, situations like hospital admissions, emergency visits, etc. Also, a range of susceptible populations are investigated, and these susceptible populations include children, elderly, people with pre-existing diseases. However, the results of these studies are quite variable, and there are some inconsistencies, and the results are not, the findings are often inconclusive. And this is because of many methodological challenges. There are issues with proper assessment of exposure because of limited abilities to really monitor and assess exposure, how the smoke plan is being distributed. It's the component of human mobility related to evacuations. It's the issue of a proper identification of these health endpoints that we are studying. Is it hospital admission, emergency visit, or other action taken? So additional and further work is needed to really improve the quality of these studies so that we have a clearer picture to design better and more effective actions. Next slide, please. In this context, I would like to mention really what happens in the European region and the existence of some platforms which are facilitating these intersectorial discussions and development in terms of research, but also some practices. In this context, I would like to mention the Task Force on Health. This is a joint task force on health chaired by WHO and developed under the Environmental Convention of Long-Range Transboundary Air Pollution, which is meeting annually and existing since 1998. And for example, in this community in 2012, we had a dedicated workshop on wildfires and health. This was organized in the wake of the massive forest fires in the Russian Federation and Eastern Europe in 2010. There is also a platform bringing together representatives of member states in the so-called Working Group on Health and Climate Change. And for more than 30 years in Europe, we have a very well-established platform bringing together representatives of the health and environmental sector, so-called Environment and Health Process, which is also marked by a series of ministerial conferences discussing regional priorities. And we are now preparing the next conference to take place next year. Next slide, please. But in addition to these WHO-led initiatives and platforms, we are also part of other processes working in partnerships with other entities. And here I would like to bring the example of the European Climate and Health Observatory, which is managed by the European Commission and the European Environment Agency, but WHO Regional Office for Europe is one of the partners. And this very comprehensive observatory is also containing a thematic block related to wildfires, describing the main health effects, projected and observed impacts in the European region, as well as the relevant policy responses. And for example, in Europe, there is a well-established European Forest Fire Information System. It's the system of the EU Copernicus Emergency Management Service, which is monitoring forest fires and also doing some forecasting activity. Also, observatory provides regularly updated list of relevant research, since in many European countries, research activities are undertaken to assess also different aspects of health impacts of wildfires. And then moving to my last slide, I would like to conclude with the map. We have seen a global picture in the opening presentation by Kari. I'm presenting here the picture from Europe, coming from this European Fire Information System, and with these many red, not even dots, but red big covered places. I think this is a bit disturbing, but at the same time, a very good illustration of the timeliness of the discussion on wildfires and health in the context of COP27, so that we design and implement even better measures to protect population health. Thank you very much.
Thank you so much, Dr. Jarsinska. We really appreciate your time today. We've reviewed wildfire smoke. We've reviewed some aspects of climate change and wildfires, as well as the role of the WHO and the IPCC report, and the role of PAHO, and specifically WHO in Europe. Now I'd like to point a question to Professor Chris Field. Professor Field, you are a recognized climate scientist and you direct the Woods Institute for the Environment at Stanford. What do you think are the key next steps in forest management and fuel management to prevent the worsening effects of climate change on wildfire risk? And can you comment on how climate change is affecting wildfires?
Thank you, Dr. Nadeau, and thanks everybody for a really wonderful set of comments. Can people hear me over the background noise? Is it worth continuing to speak? I'll do my best. So I want to talk about three aspects of the question Dr. Nadeau asked. The first is, how confident are we that climate change is causing the increase in wildfires and wildfire impacts that we're seeing? What are steps we can take in order to tamp down that risk? And recognizing that there are limits to the effectiveness of all the steps we can consider, how can we reposition ourselves to be able to live with fire and its impacts in ways that take us beyond simply decreasing wildfires? So the question of wildfire risk and climate change is really pretty definitively answered. For example, in the western U.S., we know that climate change over the last 4 decades has essentially doubled the amount of area burned annually in wildfires. The dominant mechanism for this clearly is the dryness of the small fuels, the fuels that are smaller than about 1 centimeter in diameter and are the things that can take a single spark and bring that up to the stage of a massive wildfire. And what we see is that the dryness of those small fuels is exceedingly sensitive to the temperature, and it's exceedingly sensitive to humidity. Both of those have changed quite substantially in recent years, so that fire risk that used to be high is now catastrophic. And in so many places, not only in the western US, around the Mediterranean, North Africa, Australia, we see the transition into a new era of mega fires, where fires are essentially explosive. And the whole philosophy of firefighting really isn't relevant in these cases where fires are moving across the landscape at speeds of 50 kilometers an hour or higher, and where windborne embers are starting spot fires as much as 5 or 10 kilometers ahead of the fire front. The other thing we're really seeing in terms of the causal impact of climate change is an extended window of fire vulnerability. In California, where Dr. Nadeau and I are from, we used to have a well-defined fire season that was essentially limited to the autumn months. But now we're seeing high risks of catastrophic wildfires that extend almost around the year. And the consequence of that is that we've been much less effective at deploying firefighting resources. It used to be that we could bring in firefighting teams from Canada during the California wildfire season, or we could deploy California teams to Australia during their wildfire season. And increasingly it's no longer possible to do that because all the fire teams are needed in their home bases essentially around the calendar year. The thing that has led to the most catastrophic losses in California is that not only are the fires much bigger, but they're occurring in these clusters that mean that all the firefighting resources need to get distributed over the landscape and can't be concentrated on the highest risk fires. So there's no question that we are boxed into a hole by climate change. Of course, the climate change impacts are exacerbated in many places by decades of ineffective fuel management, and in most places the fuel management paradigm has been, if we can suppress fires, we will be able to get away from the worst risks, and that's resulted in accumulation of fuels that's amplified the effects of the climate change. And then a third factor that's important in many areas, especially in the Western U.S. and Australia, not so much in Europe, is that there are more people in the wildland-urban interface. And more people in the interface, more sources of ignition, and more people are subject to direct loss. So what can we do? The most important thing we can do is to recognize that we need to be ambitious in managing fuels. We need to be thinking about spending large amounts of resources to decrease the amounts of flammable fuels, especially the fuels that carry a fire from the understory, from the ground layer, up into the canopies. We also need to recognize that fire breaks are incredibly important, but in a context of these catastrophic wildfires with long-range windborne transport, the effectiveness of fire breaks has gone down a lot, and so many of the effective strategies transition over to home hardening and making sure that the places where individuals live are as safe as possible. But a really fundamental feature of the altered wildfire domain, the wildfire landscape, that has been an important theme of this afternoon's session is that we need to transition our thinking away from protecting lives and structures in the fire zones, which has been the firefighter paradigm almost everywhere, to protecting public health and the long-range exposure to smoke. And what that means is we need to deploy resources much differently, both for risk reduction and for fire suppression once it occurs, thinking about the areas that generate the most smoke in addition to the areas that put individual structures' lives at risk. And a final thing I want to bring us back to is a recognition that increased wildfire activity is simply going to be a signature of the era of climate change. We face decades of increased risk, even with massive investments in fuel reduction, home hardening, and other preparatory measures. So I think there are three main strategies we should be looking at for living with wildfire risk. One is to use good fire rather than bad fire, emphasizing prescribed burns so that they can be deployed under conditions that they are managing fuels, decreasing the risk of catastrophic fires, and also generating very little smoke. At the same time, those can be improving forest health. A second set of strategies we need to be deploying recognizes that smoke exposures are going to be widespread, and we need to be a lot more ambitious about providing protection in terms of filtered air, safe spaces for people to go, and effective early warning systems in the context of areas that are exposed to wildfire smoke. And then finally, I think what we also need to do is make sure that there's a massive public awareness campaign so that people are aware of the health impacts we've been talking about and don't take the unnecessary risks that I find incredibly frustrating and hard to manage, simply because we tend to think about ourselves as living in an era when air quality has been increasing over decades and simply aren't tuned into the fact that the health impacts of wildfire smoke are so pervasive. So just to summarize, climate change is a major factor, but there are important steps we can take to reduce the wildfire risk substantially, but we can't eliminate it. And we're going to have to learn to live with the fire risks that we can't eliminate. So thank you very much.
Thank you, Professor Field. That was excellent as a summary of all of the aspects of wildfire smoke, wildfires across the world, and then what we can do to try to manage it within the real situation that we're living in today. I'd like to open the questions now for the audience. And does anyone have a question? I'll hand you the mic. And thank you to Mr. Castillo and Dr. Jarosinska for being here too. So they're also open for questions. And you can stand up.
I'm standing. Hi, I'm Georgiana Gordon-Strawn. I'm from Jamaica. And my question really isn't about forest fires specifically, but I think it's relevant. When there was a volcano in St. Vincent, we saw some of the ash, and we actually got some of the ash all the way, not too far away, but quite far away. And I wondered about the strategy that we're trying to use to reduce exposure to smoke, and because it's way beyond the boundary of where the incident actually happens. And I just I heard you talk about public awareness and public education, but sometimes we think, oh, that's happening in California, we're so far away, we're not affected. What do you think we should do to try to be more aware of how far-reaching this is?
Thank you so much. Dr. Field, do you want to take that first? We can go there.
It's a great question. I think that in general we have not been attuned as a public to the long distance air pollution risks from wildfires or volcanoes or even dust storms that can transport fine particles over thousands of kilometers. And the frustrating history of air pollution is that when 19th century cities were heavily polluted with coal smoke, the idea was, well, we'll make the smokestacks taller, and that will allow the smoke to be carried so far that it's diluted and doesn't make a difference. And I think that it has literally taken us a century to recognize that those particles are still in the air and they're still causing health effects. And I don't know that I have a comprehensive answer, but I think that we are really transitioning from chronic exposure to poor air quality to episodic exposure, and that in many ways, and as with acute diseases, the management strategy just needs to be really different. And I think that increasingly we're just going to have to say the air quality today is too bad for normal activities, and people need to take protective measures. A lot of it is public education, and some of it is going to be decreasing the sources, But as I said, there's only so much we can do to decrease the sources, especially not from volcanoes. You want to speak to it, or I think it's more for you.
Okay. Before I try to answer, Mr. Castillo or Dr. Jarosinska, do you want to answer that, especially in relationship to volcanoes or natural events? Yes, Mr. Castillo, thank you.
Thank you, and I do agree. It's a great question. The Pan American organization, we actually supported the response to the eruption, and we deploy rapid air quality sensors monitoring like task force. So we deploy some sensors in St. Vincent and some sensors in Barbados. And after the deployment of those sensors, we could see also like the Saharan dust on November, and we get some measurements of PM 2.5 for the eruption of the Las Canarias volcano also in November. So last year, the Clean Air for Blue Skies Day had this slogan that was called "The Air We Share." And I think it's very appropriate and very related to your question. We need to understand that air pollution is not just a local issue, very focused on it is also a local issue, but it has global implications as well. And we are experiencing the transboundary emissions issues, and we need to prepare like an integrated response. In the Caribbean specifically, we have very limited capacities to monitor air quality. We have sensors in Jamaica, as you mentioned. We have sensors, reference stations in Jamaica, reference station in Trinidad and Tobago. But beyond that, we have here and there some stations. So it's very important that we work from the health perspective, the environmental perspective, and we try to have like an integrated view on this. At this point, we, from the Pan American Health Organization, with the World Health Organization and UNEP, we are working together on identifying like the regional strategy on air quality and health, sub-regional strategy on air quality and health in the Caribbean. But beyond that, the WHO has like this overview of increasing air quality monitoring, addressing the health risk, and also issue communications. And we should have, when we're talking about these early warning systems, I do agree with what you are saying. We cannot think just in an early warning system for my country, but we should have the opportunity to communicate between our countries from the region and understand what the health recommendations, share the experiences, share the knowledge, and that way we can have an enhanced response. And from the agencies, we are eager to support that work.
Thank you for mentioning that about monitoring alert systems, Mr. Castillo. That was very helpful. Other question? Yes.
Well, maybe a comment rather than a question. I'm working for the World Meteorological Organization, and very, very convinced of the importance of the topic that you described today. Air pollution being a silent killer that I would say nobody realizes. The order of magnitudes that you described in terms of the number of affected people are much higher than those of the people directly killed by the fire, right? But following on the discussion here, I think, and again, it's a matter of collaboration across disciplines, organizations at national but also international level. And we are very happy to support WHO in this publication that is to come, and also taking some steps further, because the fuel and the fire risk, as you described, is linked with vegetation mainly, and so there is an agricultural forestry component here. So this is one area, but we also work on different aspects which can help mitigating the situations which are about observation of the starting of fires. The more rapidly you intervene on a developing fire, the better chances you have to keep it under control compared to intervening several hours later. So rapid detection is an area that can help, building on space sensors, but also ground networks, UAVs, and those type of things. And then the fire propagation also helps in the firefighting people to handle. But specifically coming back on this air pollution and the long distance transport and everything, this is also not only about monitoring. I heard about sensors in various islands or the different places, but there are tools today, and there have been tools for quite a while, to model the atmospheric dispersion of particles and even the long-term transport. This has been implemented in a number of countries. WMO is supporting a framework of global and regional centers that support that for, let's say, nuclear safety reasons, for volcanic ashes purposes because of the impact on health, but also on aviation. And so this is an area where we would really like to work together again with all of those engaged people and agencies around the world. And I'd stop there. Thank you.
Thank you so much for that comment. It's a really excellent conclusion to being able to say that there are better innovations. We have made a lot of progress on monitoring and alert systems. Now we have to systematically apply that throughout the globe to low to middle income countries as well as to other countries, and make sure that everyone has access to these so that we can systematically approach wildfires. Each region will be slightly different, but in the end, some of these approaches can be taken and moved forward. So thank you for that comment. I know we're almost out of time. And importantly, I wanted to make sure that each of the panelists was able to say one or two sentences as to what they would like to see happen on wildfire management and resilience capacity building throughout the world before COP28. Dr. Jarosinska, do you want to go first? Thank you.
Thank you. First of all, thanks a lot. I think it was really a great discussion, bringing these different perspectives. And I think that increasing people's awareness that wildfires are not local, short-term episodes, but with the dynamics and the increased frequency, extent, and catastrophic nature of those, they are really part of the global agenda that requires coordinated and joint actions to ensure protection of public health. Thank you.
Thank you. Mr. Castillo. Do you have comments on what actions need to be done before next year's COP?
Congratulations for this wonderful panel. Yes, absolutely. I think that we also should promote like an integrated vision in terms of air quality, health, and climate change mitigation, climate change action, and solid climate mitigation. We make a review of this issue in the Americas, and over 35 member states in the region, only 3 mention wildfires as an issue on their national determined contributions. So, and we are aware that the issue is bigger and is large in the region. Probably this awareness that Dr. Dorota was mentioning is needed, and also to translate this into policy making. So in our country commitments, we can include this issue that probably the first risk hasn't been linked to air pollution, but more like human security. But we also have an issue related with climate change, air pollution, that requires like this integrated approach with a leadership on the health sector and the environmental sector. So I think that we can take that into consideration. Thank you.
Thank you. Dr. Field.
Well, I agree that one of the things that needs to happen is we need to transition from thinking about wildfire as a kind of isolated single risk element to really one of the core challenges we face in a changing climate. We've heard lots of good ideas about progress in addressing that, and we need to deploy it in a system-oriented way that, as important as it is to adapt to increased coastal flooding, we really need to see wildfire adaptation as a core element of the climate change response agenda.
Yes, if I refer to the highlights that I've shown, you have seen that its strongest regions like Australasia, North America, Europe, where we have a lot of studies evident on the table and showing that it's there are many other areas where maybe this is happening and we have not so much reports about it. So I would hope to see towards COP28 rather international coalition going up to fill the gaps on the capacities, on the evidence in some regions. And I was very struck by the good question asked that it's really an international threat that is coming from these smoke sources as wildfires. So this is my hope, that we have more and more capacities facing this in regions that are under tracked or under sourced. Thank you.
Thank you. Thank you so much. I guess in my last statement, I want to thank all of you as panelists for joining us today. You've had excellent presentations, and I want to thank the audience for joining. And in the next year, I hope we will be bold, be ambitious, be creative and innovative, and work together in the international community to really make a difference and let policymakers know how critical this issue is and how we can solve it together through multidisciplinary approaches. Thank you.